गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः. गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः.
Good evening, everyone. It's given me immense pleasure to extend a warm welcome to each one of you to this new chapter of the Adveshta National Seminar 2025, organized by Ayurveda. Ayurveda, as we all know, is a science that stands strong not only on theoretical foundations but also on profound practical knowledge. For the true growth of Ayurveda, it is essential that professionals in this field continuously expand their understanding of diverse subjects, cultivate the ability to represent the science with clarity, and gain deeper insights into the vast scope of research opportunities it offers. These are precisely the objectives that this seminar envisions. Today, we gather here to witness one important chapter of this larger initiative, the presentation session. At this moment, I would like to take this opportunity to express my heartfelt gratitude to our dedicated panel members who have worked tirelessly to review and verify the topics with great sincerity. Your contribution has been invaluable to shaping this event. I also extend my special thanks to the principals, professors, and doctors from various institutions and hospitals who generously shared information and encouraged participation. Your committed efforts have truly been the backbone of this seminar. Above all, warmly welcome each and every one of you, the presenters and the participants, who have come forward with the enthusiasm to make this seminar vibrant and meaningful. Without further delay, let us proceed to the very first presentation of the session. First, I would like to invite Dr.Niteen Ganpat Harimkar for the paper presentation on the topic Efficacy of Agnikarma Chikitsa in Manyastambh. I would like to invite Dr. Niteen Ganpat Harimkar.
Hello everyone, my name is Dr.Niteen Ganpat Harimkar and my topic name is Efficacy of Agnikarma Chikitsa in the Management of Manyastambh. Here we start the presentation. Introduction. Cervical spondylitis is an age-related chronic Hello everyone, my name is Dr. Niteen Ganpat Harimkar and my topic name is Efficacy of Agnikarma Chikitsa in the Management of Manyastambh. Here we start the presentation. Introduction. Cervical spondylitis is an age-related chronic degenerative disorder of intervertebral disc and the bodies of cervical spine as per modern medicine. Cervical spondylitis occur at the level at the lowest three cervical intervertebral joint, but the most common site is at the level of C5 and C6. Around the age of 50, 25 to 50% people and at the age of 75 years of age at least 70% of people develop cervical spondylitis. Repeated trauma related to specific occupation and smoking play important role in the producing cervical spondylitis. Symptom of cervical spondylitis, that is Manyastambh, are as follows. There is pain, stiffness of neck restriction, shirshul, chimchimayam. Aim and objective to study the etopathology of Manyastambh as per modern and Ayurvedic classics, to evaluate the role of Agnikarma in the management of Manyastambh, and to evaluate the role of Lakshadi Guru in the management of Manyastambh. Materials and method for study. Inclusive criteria. Patient having classical lakshan of frozen shoulder as per mentioned in the text. Patient of both sexes. Age of the patient. Exclusive criteria. High risk cases, that is hypertension, TB, diabetic mellitus, patient having lakshan other than frozen shoulder, rheumatoid arthritis, major trauma, age below 40 and above 60 year. Criteria for assessment: shirshul, headache, chimchamayam hasta, tingling sensation in hand, bram, giddiness, shool. Required investigation: routine investigation of blood, urine, and stool. Pathology before starting the treatment: X-ray of cervical vertebra, CBC, urine routine, HIV, BSL, X-ray neck. Are in These type of investigation are required. Drug used in this study: Lakshadi Gugul, 2 tablets 3 times in a day with Koshnajal for 1 month, along with Agnikarma. The Agnikarma process was divided into 3 phases, that is Purva Karma, Pradhan Karma, Paschat Karma. Purva Karma, that is preoperative care. Written consent was taken from the patient. Advised to take snigdha and pichin ahar before procedure. Arrangement of Triphala Kashai Yashtimadu Churna Kumari Swaras was done. Stove flame was used to heat up Panchadhatu Shalaka, that is red hot. Preparation of body part. Back of the neck was paint with repair kashai and dried with sterile gauze piece, and this area covered with sterile cut sheet. Samyak Dagda Varna over the back of the neck starting from C5 to C7 spine was made by making three Vileka Dahan chest with red hot Panchadhatu Shalaka one by one. After that, immediate a swab soaked in Kumari Swaras was applied by sponge holding forceps on it. Minimum 1 centimeter gap was left between two consecutive Vileka Dahan. Care was taken not to produce a samyak dagda varna. Total four settings of treatment were given at 7 days interval. Karma, that is post-operative procedure. Swaras was wiped out completely by sterilized gauze piece. Dusting of Yashtimadu Churna on the Samyak Dagda Varna was done to cover the whole Dagda areas. Patient was allowed to go home with advice. The advice apply paste of haridra powder mixed with coconut oil at night and leave the part. Not to use water over that part at least for 24 hours. Avoid Vatvardak Ahar and Vihar. Manyastambh is commonly Vatic disorder. Pain was reduced after one sitting, but totally relief after third sitting. Slightly present after work. Stiffness of neck is magically reduced after first sitting. It was started again after 2 days and then reduced after second sitting of Agnikarma. Agnikarma and Lakshadweep will help to relieve from neck restriction. It is slightly present up to third sitting. Both Agnikarma and Lakshadweep will heals to reduce shirshul and chimchamayam of hand. Agnikarma is the ideal treatment for Asti Sandhigat Vikar as per Shushrut. The reference of the study Charak Samhita, Shushrut Samhita, Ashtang Hruday. Thank you.
Thank you, Dr. Nitin. Thank you for the well explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation related to the topic adenomyosis. I would like to invite Dr. Sefali Satish Shingde for the paper presentation. I would like to invite Dr. Sefali Satish Shingde for the paper presentation.
Good evening, everyone. My name is Dr. Sefali shingde. I'm a JR3 of the Gynec and Physiotherapy department. My guide name is w.s.r. I'm the student of Aryapudar Medical College. My topic name is adenomyosis. I'm presenting the case study of the adenomyosis. So first is definition of adenomyosis. Adenomyosis means nothing but it is a medical condition which involves the myometrium of the uterus. It is a condition where endometrial tissue proliferate in the myometrium. This ectopic endometrial tissue in the myometrium start proliferating as a result of thickening of the uterus. Means in this, the ET, that is endometrial tissue, increases. Adenomyosis is also referred to as a uterine endometriosis, and it is a benign disease confined to the uterine muscle. So what? What are the symptoms? The adenomyosis can lead to the dysmenorrhea and can be the scanty menses, that is oligomenorrhea, or the heavy menses, that is polymenorrhea. It can be correlated and underrated with the three conditions, that is Udavartini Vinivapat, Vatachuni Vapat, and Asrudar. I mentioned the Samprapti. Samprapti is if the patient is taking Nidan Sevan, that is Vata Pitta Prakopak Ahar. Vata Prakopak Ahar means Mook, Matki, or Tana Pautan. Pitta Prakopak Ahar means oily spicy things. Then Prakupit Vayu and Pitta vitiates the Rakta. And San Samsha occurs in the Garbhashaya Gatsira. Rakta Praman Utpram is Rakta Praman बढ़ता है वहाँ पे और Vata Pitta Shasrudar occurs. Okay. I have mentioned the case study, that is 41-year-old female came to the OPD of the Prasith Tirthan Studio at the Yamekudar Hospital of Parari. She was complaining about three cycles of heavy menstrual periods, that is polymenorrhea, with a lower abdominal pain since 3 months. Okay. History of present illness. Patient was absolutely healthy 1 year back. She developed the localized mild pain in the lower abdomen and she increased the menstruation. Gradually, she developed the irregular menstrual cycle, means 2 months of gap. She was taken the allopathy medicine. There is no any detailed history that is we have asked, but she has no history. But she consulted PTSR at the Podar Hospital and we admitted her. The marital status was 21 years back, Mena for 13 years, and menstrual history has 2 months of gap. It first occurred in January, first period, then in March, then in May. Okay, the cycle was irregular. There is an interval of 2 to 3 months gap. Number of days of bleeding were 2 to 3 days. Or she was taking 4 to 5 pads per day, and the menstruation was filled. But that is dysmenorrhea is also complete. Okay, the obstetric history is G2, P2, L2, previous FTND. She has a male and female child with the FTND. Contraceptive history all nil. Examination. We examined the patient. The general condition was moderate. BP and pulse was normal. Pulse rate is normal. Temperature is also normal. BMI is normal. Jiva was Nira. And Malamutra was Prakrut. Okay, the per-vaginal examination. We done the per-vaginal examination. The cervix was soft. Movement was painless. Fornices are free, non-tender. Posterior fornix was not tender. Then bimanual examination is done. The position was anteverted, normal in size. The size is bulky in uterus because it was 7.9 and tenderness was present. The cervix, when we done the PS examination, then the cervical erosion was also present and mucoid white dish was also present. The ball was healthy. Okay. So we suggested the USG abdo-pelvis to the patient. She came with the report on 25 May. The AT was increased and bulky uterus with a focal adenomyosis in the anterior myometrium was noticed. Then the Samprapti Ghatak was Dosh was Vata Pradhan, Pitta Dusha, Rasarakta, Srotas was involved is Artha was Srotas, that is Artha was Hira. Okay. The drug and physiology, that is for Deepan Pajan we always give the Aragavardhanavati and Hingvasta Chunna, but we have given the Aragavardhanavati and Avapithikar Chunna. The 2 tablets of Aragavardhani was given 250 mg BD after Bhojanatar Apane with the Koshnajal and Avapithikar Chunna, that is 3 gram, that is half teaspoon HS with the Koshnajal was given. Okay. For cervical erosion, when PS examination was done for cervical erosion for 7 days, for 3 consecutive cycles, we have given the Zapta detail Unipichu for 7 days for 2 hours after the menses. Okay. The 5 to 6 follow-up was taken. The first follow-up on 4 May. For first follow-up, we given the Deepan Pasa, that is Arugavardhanavati and Avapithikar Churna. After the menstruation, about cessation of the menstruation, on the 9th May, we give the first Yog Basti cycle of Dhanvantari Tel. According with that first cycle, we give the Chandraprabhavati, Daruhratravati, Kanchanar Gugur, and Avapithikar Churna. And on the third follow-up, we give the second Yog Basti with previous medicine. On the fourth follow-up, we give the Darula Ganivati, Kanchana Gugul, Avapithika Chuna. On the fifth follow-up, which was occurred on the 2nd of July, we give the third Yog Basti cycle with the previous medicine. There is no any change in the medicine. The same medicine was continued. On the sixth follow-up, we didn't give the Yog Basti because only 3 Yog Basti were given to the patient. We continued the previous medicines. Okay. The Haridra Ganavati was given 2 tablet BD Bhojanatta with the Koshnojal. Kanchana Gugur with the Karshanian in factor. 2 tablet 250 mg was given with the Koshnojal. Chandraprabhavati also 2 BD Bhojanatta with the Koshnojal. And Yog Basti of the Dhanvantaritil Anvasan and Dashamatrapala with the Nirua. Post-menstrually, 3 consecutive cycles was given. The third cycle was finished on the July. Okay. And Avapilkar Churna, that is 3 gram HS with the Koshnajal was given at a night time. Okay. On the first fellow, patient was complaining the severe pain. The periods were irregular. She was taking 1 pad per day. Okay. On the second film, the pain was reduced. The pain was moderate. The one she was taking 1 pad per day for 2 days. On the third follow-up, the pain was moderate. She was taking 2 pads per day. On the fourth follow-up, the pain is reduced. And but the patient, the menstrual cycle has become regular. Fifth and sixth follow-up, the cycle was regular. The pad count is reduced, and the pain was also reduced. Okay. In the next slide, I have mentioned the sonography reports. On the 25 May, there was a bulky uterus with the changes of the focal adenomyosis, and the ET was also increased. But on the 21 August of 23, that is, there is no any. The ultrasound report was very much normal. ET was normal. Okay. Then now the discussion found the case was diagnosed with a focal adenomyosis. It is often asymptomatic. Symptoms typically associated with the adenomyosis include the heavy menstrual bleeding, prolonged bleeding, and dysmenorrhea. Acharya Sushruth advocate the Vata Shamak, Vatanulomak specific treatment of the Udavartan Unioper. In this case, according to the Stanik Chikitsa of Yoni Pichu with the Jatadithil was given for 7 days for the cervical erosion. Due to the Vranaropak properties of the cervical erosion was reduced. Then for the Deepan patient, we give the 2 medicines, that is Arugardhanivati and Avapithikal Churna. Arugardhanivati was given initially for the 7 days, which is Pitta Shamak and Pitta Virechak, which acts on the cervical erosion, acts as a Deepan Pachak and Anulomak. And Avapithikal Churna acts as a Pitta Kapha Virechak, Nitya Virechak, and does the Rakta Prasadan, treating the cervical erosion, Rakta Dushti of the adenomyosis. Okay, the Yog Basti has the both local and systematic effect. As we know that Basti is Ardha Chikitsa, Basti acts on the Apan Vayu and acts the Vatanulomak, due to which Pratinam of the Vayu gets direction and dysmenorrhea is also hidden. Okay. The Basti also acts on the central nervous system, also the molecular level, where excretion of the prostaglandin takes place. It acts on the autonomous nervous system, H2 axis, and secrete the neurotransmitter. And this neurotransmitter, like the serotonin and the hormones, heads acts on the arthavasvatas. That is because the Dushya is arthavasvata, acts on the neural pathway and relieve the spasm by the neurotransmitter. Okay. Here we mentioned the Daruvardhakanavati is the Tiktain Ras, having the Deepan, Lekhan, Shulhar, and Lekhan is property. Remove the ectopic tissue from the abnormal sites, and by the Vatanurma prevents the Udgama of the result, leading to the proper expansion. Considering the above points, plan to the normalize the function of Vata and Kapha, Samprapti Vignahatta. We have given the Basti from the external side and internally the core medicine, that is Daruvardhakanavati, Kanchana Gugul, Chandraprabha Bhatti, and Initya Virechaka Avapithikar was selected. In the present study, above treatment used for the adenomyosis, which is found to be very effective. Patient is free from all the symptoms and able to perform her daily activities without difficulty. Here, the treatment given was not only relieving the symptoms of illness, but also increasing the defense mechanism, that is immunity of the patient. And in this study, it is treated from the root cause. That is, we know that the Basti is a Vata Shamak Chikitsa, Ardha Chikitsa, and we give the Basti to the patient to remove the disease from the root and can be used for the many patient by using this Siddhanta. I have mentioned the references. Hence, by giving the 3 consecutive cycles of the Dhanvantar Tel and the Dashamatripala, I have reduced the adenomyosis patient to the normal USG. Also, we give the Darudha Ganavati, Kanchana Gugul, Adagavardhanavati, and the Avapithikal Churna to treat the patient. Okay, thank you so much.
Thank you, Doctor. Thank you for the well-explained presentation. Thank you so much, Doctor. Next, we go to the poster presentation related to Rasayana. I'd like to invite Dr. Prajkta Anil Inamdar for the poster presentation on the topic Rasayana as a preventive medicine. I would like to invite Dr. Prajkta Anil Inamdar.
Prajkta and Inamdar, PG second year student from Sri Satyashangi Ayurveda Mahavidyalaya, Nashik. My topic name is Rasayana as a preventive medicine. Introduction. Ayurveda emphasizes prevention, swasthya along with treatment. Ayurveda focuses not only on treatment of disease but mainly on prevention and maintenance of health. Rasayana is one of the most important branch of Ayurveda, which aims at promoting strength, immunity, memory, intelligence, and overall well-being. Rasayana plays a vital role in preventive medicine by improving the quality of life and delaying the aging process. Definition of Rasayana. Swasthasya urjaskaram yattu tadrusham rasayanam. चरक चिकित्सा स्थान रसायनम च तज्ञेयम यद जरा व्याधिनाशनम शारंग संहिता. Definition of rasayana. The term rasayan is derived from rasa means nutrient and ayans means path. Rasayan means the path that carries the essence of nutrition to all body tissues. Charkacharya defines Rasayan as the therapy that promotes physical and mental strength and improves body resistance. Benefits of Rasayan. Labhopayo sastanam rasadinam rasayanam chikitsa sthan. Rasayan is related with promotion of nutrition through improving Agnikarma therapy, enhancing metabolism by means of circulation of rasa. Types of Rasayana. Ajastric Rasayan, Naimittic Rasayan, and Kamya Rasayan. Ajastric Rasayan means diet based. Daily dietary items like milk, ghee, honey. Naimittic Rasayan used for specific disease prevention like China Jwara. Kamya Rasayan promotes vitality, intelligence, fullness. Objectives of Rasayan therapy: promotion of health and longevity, enhancement of immunity, promotion of intellectual functions, prevention and delay of aging process, maintenance of youthfulness. Mode of action of Rasayan. Mechanism: enhances nourishment of tissues, means dhatus, boost immunity, Ojasvardhan, improves digestion and metabolism, Agnidipan, act as an antioxidant and anti-aging agent, improves mental strength, Medha and Smriti. Rasayan and lifestyle. Rasayan is not just medicine, but a comprehensive approach involving Achar Rasayan, Vihar Rasayan, and Medhya Rasayan. Achar Rasayans include ethical conduct, discipline, and positive mindset. Vihar Rasayan, these include proper sleep, exercise, and lifestyle. Medhya Rasayan, that includes herbs to enhance brain function. Importance of Rasayana in preventive medicine. First, immunity enhancement strengthens the immune system and prevents occurrence of disease. The second, anti-aging benefits slow down the aging and maintains youthful vitality. Third, stress reduction improves mental health and helps in coping with stress. Fourth, disease resistance increases resistance towards infection and seasonal disorder. Rasayan for prevention of disease. In Hridroga, Arjun is mainly used. Yakshma, pimple is used. Pandu, loha is used. Amvat, bhallatak is mainly used. Conclusion. Rasayan therapy is holistic preventive strategy to maintain health, enhance immunity, and delay aging. Integrating Rasayan into daily life offers a powerful tool for preventive healthcare in modern times. References Charak Sanhita Chikitsa Stan, Sushrup Sanhita Chikitsa Stan, Sharanga Sanhita, and Yog Ratnakar. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. K. Pooja for the paper presentation on the topic Efficacy of Yoga Basti in the Management of Kitibha Kushta with respect to psoriasis, a case study. I would like to invite Dr. Pooja.
Good evening, everyone. Myself, Dr. Pooja, third year PG scholar of Kaya Chikitsa department from Dr. NRS Government Ayurveda College, Vijayawada. I am presenting a topic on efficacy of Yoga Vasti in the management of Kitibha Kushta. Introduction. Kitibha Kushta is one of the Kshudra Kushta mentioned in our classical text, characterized by Shava Varna, Krishnam, Aruna, Kinakara Varusham, Shravi, Ghanam, Ugrakandu, Vruddhimanti, Prashantani, Punah Punah Utpadayante, resembling the clinical features of psoriasis. Here a case, a 42-year-old male patient presented with complaints of dry, scaly, thickened, blackish brown lesions over the upper, lower limbs, upper trunk and back region with itching, powdery blisters since 2 years. History. Patient was healthy before 3 years. After that, he started complaining of slight skin discoloration over the anterior side of upper limb and below the knee joint of both legs and itching over it. Gradually, it increased and spread all over these regions. This patient underwent Panchakarma treatment of Vamana Virechana in the last visit of 3 months back. He got symptomatic relief and was discharged after improvement. But again, due to recurrence of all these symptoms, he got admitted in our hospital. No any family history was present, not known case of hypertension, diabetes mellitus. All the blood investigations reports were in the normal limits. No addiction to alcohol, smoking. That is mixed. On examination, all vitals of the patients were within normal limits and appetite is slightly reduced, bowel once in a day hard stool, and micturition 4 to 5 times per day and disturbed sleep. Ashtasthana parikshas, lipta jihva, and the ruksha sparsha. Systemic examination, everything is normal. Examination of the skin, on inspection, large, irregular, dry, blackish brown patches of about 1 mm to 1.4 mm thickness, which is the elevated powdery discharge in silvery color. It is a dry, rough, and warm to touch. Positive of candle grease sign and aspid sign. Dashvidha Pariksha, Vata Pradhana, Kapha Anubandha Prakriti, and Vastisara, remaining everything is in the Madhyama Avastha. Some of the clinical findings of Kitibha Kushta, that is a shabam, erythematous lesion turns to black in chronic cases. Karatvam, we can compare it as a candle grease sign. Parushatvam, abnormal hardening is seen in the chronic cases. Rukshatvam, dryness, like the scales which are hard to touch. Ugrakandu, severe itching. Treatment. At first, we are giving the Purva Karma. The first 5 days, we Amapachana to achieve the Niramavastha. So, Deepana and Pachana with Chitrakadivati, 250 mg TID and Panchakola Churna, 5 gram BD before food till Niramavastha, and Sarvanga Abhyanga with Murchita Thilataila followed by Ushna Jala Snana. And Pradhana Karma, planning the Vasti Karma, administered in Yoga Vasti pattern, Niruha Vasti and Vasna Vasti. In Parshat Karma, observations of Samyak Vasti Lakshanas after Basti Pratyagamana, Patya was observed. And after the course of 8 days, with an interval of 15 days, first follow-up and then of second follow-up, followed by these medications. These are the schedule of the Basti. We are using the Panchatikta Gruta of 80 ml for Anuvasana Vasti and Darvadi Niruha Vasti 570 ml with 60 ml of Madhu, 5 gram of Saindava Lavana, 90 ml of Darvadi Taila, 10 gram of Kalka, this is Sarshapa Kalka, and 400 ml of Panchatikta Kvarka. Observation, retention time, we are seeing the 6 hours for Anuvasana Vasti and 4 to 5 minutes of the Niruha Vasti across all the 3 administrations, and Vega in Anuvasana Vasti 1 Vega while in Niruha Vasti 2 Vegas, and observe the Samyak Lakshanas and patient experience improved in Ruchi, Agni Dipti and Ashaya Lagutva, and also feels Sukha Swapna and Balavruthi. These are the assessment grade wise grades. We are giving the 0, 1, 2, 3 grades for these symptoms. And these are the observations and the results before treatment and after second follow-up on 38th day. And we observe the decreases in the abnormal keratinization, which promotes the skin regeneration, and reduces in the skin hyperproliferation, and also reduces in the erythema, and reduces in the karatva, which improves the hydration, and peels of the scales on the psoriatic patches. It also promotes the skin regeneration. And PASI score before the treatment is of 8, and after the follow-up and second follow-up of on the 30th day it's of a 2.4. These are some of the pictures of the patient before and after the treatment. And discussion. References to this Basti Karma in Kushta can be found in various texts as Acharya Charaka specially indicated Basti in Chikitsa Sthana and Siddhisthana in the management of all Kushta, where we found Vata Dosha Pradhanya. And mode of action. Here in the formulation dravyas having these properties does the shosana of excessive kleda and also helps in samprapti vikatana of Kitibha Kushta. When action on the dosha, it eliminates the accumulated vata, pitta and kapha, normalizes kledika kapha by enhancing agni and reduces the kapha accumulation in the srotas. And also it helps in balance pitta and rakta, reducing pitta sara and promoting healing by improving rakta dhatu and complexion. While action on tvak is the astrayasrana of vata. Basti not only eliminates the vitiated vata but also improves varna and restores the skin softness. Action of Anuvasana Vasti. Anuvasana Vasti is indicated in Kushta with vata predominance, and the snigdha and mrudu qualities of sneha in these contract the ruksha and kara properties of the lesions, while the sandra, stira and mrudu guna of sneha calms the chala nature of vata, which prevents further lesion spreading. And it also nourishes the body, enhances the varna, strength and overall vitality, and also provides mana prasadhanam. Action of Kashaya Vasti. Kashaya Vasti dravyas mixed with sneha are readily absorbed into the rectum due to lipid soluble nature, as the rectum has rich blood and lymph supply. Large quantity of Niruha Vasti dravya can cross the rectal mucosa and are carried by the superior hemorrhoidal vein into the portal circulation. While coming to drug effect, Darvadi Niruha Vasti The majority of the herbs mentioned in this or discussed in Shalaka, Kustagna and Kandugna Rasaymanis as well as the Sushruta Aragvadagana, which can reduce the erythema and Kandu. And these dravyas is having Vata Kapahara and works as the Amapachana and elevates the Sangha at Srotas levels, and also having the antioxidant and immunomodulatory properties which have prevents the skin cells from becoming even more keratinized and reduce the immune mediated inflammatory response, and also which plays a major impact on lessening the erythema. While coming to Panchatikta Anuvasana Vasti, this all the dravyas is having Patola, Nimba, Bhunimba, Rasna, Saptaparna, due to this properties, it reduces the inflammation, improving circulation and promotes the skin regeneration. So this Dharvadi Niruha Basti and Panchatikta Anuvasana Basti showed significant results. So we can conclude this as Yoga Basti is effective in the management of Kitibha Kushta. Thank you.
Thank you, Dr. Pooja, for sharing such valuable perspective. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Shubhangi Shahu Sonavane for the paper presentation on the topic lifestyle diseases in children and Ayurveda.
Hello, I am Dr.Shubhangi Shahu. Today my topic is lifestyle diseases in children and Ayurveda. I am PG scholar Dravyagun Vigyan Department, Guide Professor Dr. Sefali Ma'am, Dravyagun Vigyan Department, LRP AMC.
Hello, I am Dr. Shubhangi Shahu. Today my topic is lifestyle diseases in children and Ayurveda. I'm the Chief Scholar of the Veterinary Department, Vice Professor Dr. Sefali Ma'am, Veterinary Department, LRT AMC, Islampur, Pakistan, from Maharashtra. Lifestyle diseases, also known as diseases of civilization, appear to become ever more widespread as the countries become more developed and industrialized. Lifestyle diseases can be defined as the diseases linked to the manner in which persons live their life. Lifestyle diseases. Now, the causes of lifestyle diseases. First, food habits, physical inactivity, wrong body posture, disrupt biological clock, poor social relationships, stress due to competition. These are all causes of the lifestyle diseases. Lifestyle disorders in children are children obesity, diabetes, hypertension, GI disorders, chronic obstructive pulmonary disease, COPD, computer vision syndrome, CVS, cancer, mental health issues.
Lifestyle.
Lifestyle. Now, Ayurvedic approach towards the lifestyle disorders in children. Ayurveda offers more proactive approaches to preventing lifestyle diseases through holistic healthy living medicine by following the rules of Vayu, Dinacharya, Ritucharya, and Sattva. Ayurveda has got the unique concept of daily routine known as Dinacharya. All social activities are included in Dinacharya. Everyone in our world is paid for a particular pattern and activities. One can adjust all according to circumstances, but should take care of dosha balance, early to bed and early to rise. Eat healthy and green vegetables, avoid junk food, processed food, and avoid extra sugar. Drink a good amount of water. It will help the body to wash out all the stored toxins. Avoid fast food, soda, etc. Go for a walk or a light exercise. Go for a defecation when there is an urge. Don't suppress or pressurize. Proper cleaning of teeth, tongue, and mouth in the body. Keep body and mind calm. Now, Rithucharya, seasonal routine. Seasons are six in number, six are three, and doshas are three. This is digitalized relation between all these to maintain health and remain in harmony with the nature and our doshas. One should follow certain regimes and avoid certain things in diet and lifestyle. Enumerated are Rithucharya. If required, do Panchakarma as per Pratik and dosha. First with fun family activities, daily exercise, yoga, Surya Namaskar, meditation. These are some Swasthavaskar examples. Now, Ayurvedic form. First, anti-diabetic drug, bitter gourd, plant of oak, obaba, allium, sativum, himidesmus indicus, iron of ginseng, Cuminium nigrum, Osimum sanctum, Curcuma longum, Jambul, Fenugreek, Wilmar. These are anti-diabetic drugs. You can be used. Anti-obesity. Use of guruchi, devdaru, spa, pipala, satra, arista, and honey is recommended. Powder of yak and amla is used. Pilates along with the juice of agreement works well. Honey water early in the morning. Powder of vidam, tulsi, yavaksha, yav, amlaki, loha tripalabatul, chandripathavati, arogya navak kudu. These are all anti-obesity drugs. Antioxidant and immunomodulator. Guruchi, tulsi, amlaki, hariski, yashti madhu. These are all antioxidants and immunomodulators. Now, conclusion. Ayurvedic treatment, Karma, yoga meditation, dietary adjustment, herbal remedies, preventive approach, early intervention, promoting health habits, stress management. Following these, we can minimize or prevent lifestyle diseases in children. Thank you so much.
Thank you, doctor. Thank you for the insightful presentation. Next, I'd like to invite Dr. Pratik Mane for the paper presentation. I would like to invite Dr. Pratik Mane for the paper presentation.
Hello, my name is Dr. Pratik Mohan Mane and I am a student of Sri Shiva Yogeshwar Ayurvedic Rural Medical College, Insal, Belgavi, presenting in front of you clinical study to evaluate the efficacy of Agnikarma with the loha shalaka in parshnishoola with a special reference to the plantar fasciitis. Now, I'll move on to introduction. Over a long period of time, different branches of Ayurveda has evolved in which health is mainly concerned with the preventing as well as curing the diseases. Plantar fasciitis is a common condition that causes heel pain and sometimes bony spur may be seen at the attachment of plantar fascia. Parshnishul can be correlate with the Vata Kantaka, mentioned in Ayurveda as one of the symptoms of Vata Vyadhi. Vata gets aggravated and localized in Khuddha Pradesha when person walks on irregular surface. Nowadays, it can be managed by physiotherapy, NSIDs, steroids, etc. But this conservative management gives short-term relief with certain drawbacks, and surgically it can be managed with an increase in high hospital stays and high economical expenses. Acharya Shushruta mentioned in a Shushruta Samhita that Agnikarma for painful condition of Twaka, Mansa, Sira, Snayu, Asthi, and Sandhi. Local application of heat causes vasodilatation, improves blood circulation, and removes strota avrodh, obstructions in channels. It reduces inflammation, decreases nerve compressions, and helps in breaking the pain cycle. The Ushna and Tikshna properties of Agnikarma provide immediate and long lasting pain relief in conditions where conventional medicines only provide temporary effect. Materials and methods. All the materials required to conduct the studies were collected. The patients suffering from sharp, stabbing pain at the bottom of the heel, pain which is usually worsened with the first step in the morning or after long rest, localized tenderness seen at the middle tubercle of the calcaneus, and mild swelling at the heel region from last 3 to 4 months. Total 5 patients were registered for our present study in the OPD and IPD of Shalyatantra Department of SSRAMC Arogyashala Rugnalaya. On the basis of signs and symptoms, patients were diagnosed as a plantar fasciitis or Vatakantaka. The patients were treated with the Agnikarma along with the conservative Ayurvedic management for 6 months. Therapy was done 7 times at an interval of 7 days. Assessment criteria: pain, tenderness, Wendell's test, stretching the plantar fascia. That means by dorsiflexing the big toe, reproduces heel pain, local swelling, Nidan Parivarjana. Nidan Parivarjana in plantar fasciitis. Avoid overexertions, avoid improper footwear, avoid sudden weight gain and obesity, avoid cold and damp exposures, avoid improper gait and improper gestures, avoid prolonged rest immediately after exertions. Treatment plan: Purva Karma. Patient's concern were taken, parts preparations were done, patient explained about the procedure and all the details of the study. Pradhan Karma. Required materials for procedure of Agni Karma were collected. The procedure was explained in detail and concerns were obtained from the patients. Shalaka is placed on the gas stove to become the red hot. The selected part of the patient's plantar surface is cleaned. 5 to 6 points will be marked at a distance of 1 to 2 centimeters superiorly along and around the ankle joint or the plantar surface, wherever patients feel more tenderness during examinations. Agni Karma were done to the 5 to 6 consecutive points around the ankle and the plantar surface where there is more tenderness with the minimum distance of 1 to 2 centimeters. Paschat Karma. Kumari Pulpa was applied over the marked area for the 2 to 3 minutes for smoothing effect, and then Haridra and Ghees were applied over the burn part, and patients were advised to avoid the contact with the water over the burn part. Discussions. Discussion on disease. Vata Kantaka is predominantly caused by the violations of Vata associated with the kapha in the heel and cause pain, stiffness, and shota. In both the signs, the most commonly seen factor causing the disease is more pressure over the arch of the foot, leading to the inflammation of the plantar fascia. The main symptom is it is defined as a sharp pain on the plantar surface of the heel. Sharp pain in the heel is something like pricking pain. The word Kantaka creates correlates with the thorn, and Vata Kantaka there is a thorny pain in the heel. So on the base of these factors, it is appropriate to correlate the Vata Kantaka to the plantar fascia. Discussions on Agnikarma. Agnikarma is an important Anushastra karma. Parasurgical procedures mentioned in the Shushruta Samhita. While elaborating the benefits of this procedure, Shushruta mentioned that it is easy to perform, effective in many incurable disease, and which has no recurrence of the disease, including severe pain in Asthi and Sandhi Pradesh. Modes of action of Agnikarma in the study. Shalaka made into red hot and placed on the skin to meet the Samyak Dagda Binduvat Vrana, by which heat is transferred to the local site. The Ushna, Laghu, Tikshna, Sukshma, Vyavai, Vikasi, and Ashukari properties of the Agni helps to remove the Sruta Avrod. Obstructions of channels also help to pacify the Vitated Vata Kapha Dosha and ultimately help into breaking the Samprapti. By reducing the health to the ankle joint causes vasodilation, which increases the blood circulation and leading to the increase the blood flow to the ankle. Here is the discussion table of the examination patients in the study, which where we can see the results and decrease in the pain and tenderness. Result of Agnikarma were highly significant in relieving pain and tenderness. The procedure of Agnikarma, which is very simple, economical, and did not require hospitalizations of the patient and also cost effective to the patient. Here are my references of the study.
Thank you, Doctor, for the enlightening presentation. Next, I'd like to invite Dr. More Sheetal Nenoba for the poster presentation on the topic concept of Sudhikagara. Once again, I'd like to invite Dr. More Sheetal for the presentation.
Good evening to all of you. My poster title is Concept of Sudhikagara. Myself, Dr. Sheetal More. Guide name is Dr. Sachin More, sir. Definition of Sutika Gar. A woman after delivery of fetus and placenta is called as Sutika in Ayurveda text. Furthermore, a room or ward where a parturient woman, that is overseas prasava, becomes Sutika is called as Sutika Gar. It is specially constructed for the expectant woman to stay when she gets near term, and its design is optimized to help her for the process of labor, that is prasava. प्रवेश विधि प्राक्चैवास्य नवन्मासात् सुतिकागारं कारयेत्. Charak 8. The Sutikagar for the expectant woman should be ready by the end of 8th month of pregnancy. Introduction. It is a ward constructed for every Sutika and dismantled after her discharge. This ward is built to conduct the delivery and for placing the mother and child into it. A pregnant woman nearing to the date of delivery will be entering this ward and stayed there till the completion of Sutikakal puerperal period. Sutikakal Charak is not specified. Sushut, Ashtang Hruday, Bhavprakash, and Yog Ratnakar, 1.5 month until next Rajdarshan. Kashyap said it's 6 months. Need of study. Personalized approach to childbirth and postnatal. Sutika birth represent a holistic and caring Ayurveda. While its traditional form might not be entirely transferable to modern setting, studying the concept of Sutika gardening is relevant due to the following reasons: extensive postnatal care, preventing complications and improving maternal health, integrating traditional wisdom with modern healthcare, promoting well-being and mother baby bonding. requisites for construction of Sutikagar. A clean line for the construction of Sutikagar, Ud, Bilwa, Tindu, Indu, Bhallatak, Khadir for building walls and doors. Cowdung or line, coating to the walls, roof. Sutikagar should be constructed facing east or north as easy access to the sunlight and wind will be there and measurement should be 12 feet long and 6 feet wide. Um, it should be constructed with the wood as its bad conductor of electricity protect from the thunderbolt and it will be easy for dismantling after its uses. Thus, सर्वोपकरणं सन्निहितज्वलनं नवमे मासे सुतिकागारं प्रवेशे प्रशस्त तिथी आदौ शुश्रूषारेर 10. Don't avoid cold exposure, avoid crowded or noisy places, avoid excessive visitors, avoid stress or overexertion. Conclusion: Ayurveda texts explain the Sutikagar, that is labor room setup in detail, and principle applied in establishment of labor room are still found true and applicable. Discussion: Sutikagar is a wall constructed for pregnant lady for staying there and watching for labor onset. The Sutikagar Nirman Vidhi explain about the land, its qualities, color of soil, wood used for construction of Sutikagar. Sutikagar represents a traditional Ayurvedic approach to childbirth and postpartum care, emphasizing a holistic and personalized experience for the women. Thank you.
Thank you, Doctor. Thank you for the concise and comprehensive poster presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Saubhagya Apasal for the paper presentation on the topic Sharakarma and the management of hypertrophied nasal terminate. I would like to invite Dr. Saubhagya for the paper presentation.
Hello everyone, myself Dr. Shubhangi, second year PG Scholar, Department of Rachana Sharira, Rajiv Gandhi Education Society, Ayurvedic Medical College, Hospital, and PG Research Center, Rona. Today I am going to present a paper on the topic Sharakarma in the management of hypertrophic nasal turbinate, guided by Dr. Harshavardhan Daliya, Professor and Teacher with Department of Rachana Sharira, Rajiv Gandhi Education Society, Ayurvedic Medical College, Goa. Contents of the presentation are introduction, description, clinical feature, signs and symptoms, diagnostic features, treatment, complication, discussion, conclusion, introduction. Chronic allergies lead to symptoms of nasal obstruction, often by causing a condition known as hypertrophic nasal turbinate. Nasal obstruction due to hypertrophic turbinate is a universal presentation in the ENT. Every person experiences some degree of turbinate dysfunction at some point in his or her life, and persistent dysfunction is not uncommon, involving across 50% of the population. Our classical texts have explained 31 types of Nasaropas, of which Nasoplatinaria is significant. The characteristic feature of the disease is nasal obstruction, a very common condition in recent times. Owing to its abundance of its nidhanas, ecological factors such as Avashaya, Rajo, Dhuma, Vasatyagandha, and Dushita Sevana, nasal turbinates and dysfunction. The word turbinate means a top-like shape or a projection. Turbinate or concha is a long, narrow, and curved shaft, shaped like an elongated seal shell, which continues into the breathing passage of the nose. Turbinate home refers to any of the smooth, spongy bones of the nasal passage in vertebrates. Clinical features: signs: anterior rhinoscopy reveals hypertrophic turbinates. Diagnosis: mucosa is conjunctive or in the presence of allergy, it will be pale and luminous. Posterior rhinoscopy reveals characteristic mulberry-like appearance of the posterior ends of the inferior turbinates. Symptoms: nasal obstruction. This is due to hypertrophy of turbinates. Rhinorrhea. The nasal discharge is thick and viscous. Anosmia, loss of smell, no delosion, then headache, vertigo, inflammatoria, sore throat due to pharyngitis. Diagnostic features. The inferior turbinates are hypertrophic with the congestion of nasal mucosa. They have to be differentiated from nasal polyp by the following. One protein attachment to lateral nasal wall is detected. They are soft in consistency, but under the underlying nerves fed. On application of decongestant nasal drops or dilute renal solution to the surface of the turbinates, they will become pale and shrink temporarily. This is not seen in case of nasal polyp. Treatment: Ayurveda. Shara have been used for the centuries by Ayurvedic practitioners as a parasurgical procedure for a number of diseases with a tremendous success. That's on the property of Shara. It can reduce the body tissues apart from its other therapeutic functions. Efficacy of Shara in various disorders has earned it the supreme position among the all Shastras. External application of Shara is a wide range of disorders like hemorrhoids, tumors, rectal fistula, warts, skin lesions, etc. have yielded desired outcomes. Success of Charakarma in environmental pathologies has popularized it worldwide. Apart from treating the diseases included in the Ayurvedic classics, widespread regional application of Charakarma in modern times has resulted in derma consequences. The research work on the management of fully with the application of Shara was undertaken solely on the logic of properties and function of Shara, which turned out to be an innovation in the management of tonsillitis. Karma. Before that, it went work for the Shara procedure, glass rod, igniton gel, cotton scarves, one, when from Shara, Karma. All the instruments and materials mentioned earlier required for the procedure were kept ready and ready of proper sterilization. The patient was asked to wash his face, especially clean the nose by easing and wiping out any discharge from the nose. Patient was made to sit comfortably on a chair in a place with liquid ventilation and light. The cavity of the nose was examined thoroughly to exclude our measure using the nasal scapula. The nostril was cleaned by using the sterile gauze with the help of forceps. It was reassured that the area was dry before proceeding to the next stage. Pradhanakarma. After inspecting the nasal turbinate carefully, the kshara was applied with the help of shalaka rolled with the sterile cotton at the tip. Kshara was retained on the turbinate up to 2 to 3 minutes. Then examined for color change and bleeding of the applied area. Paschatkarma. After 2 to 3 minutes, the kshara was carefully wiped off using a forceps and sterile gauze, and the area was smeared with a nimbu usvarasa. Patients were strictly instructed regarding Pratyapatya. The kshara will be applied once and then observation will be done on the change in size and shape of the turbinate for 21 days, and it will be recorded. Complications. If a patient is not cooperative, improper taking care after applying kshara, not following the appropriate discharge karma, then it may cause ulceration or burning like condition around the nostrils. Discussion. The patients were revolved immediately after kshara karma and then after follow on 7th, 14th, and 21st day. The results of immediate kshara application and after each follow-up, the clinical features were documented for a comprehensive picture and assessment of practice of the kshara. Conclusion. Apatya viharas are the main ecological factors in the establishing the disease. Nidhana explained above initiating or precipitating factors have a significant role in causing a hypertrophic terminate. Nidana Parivarjana plays a very vital role in avoidance of the disease as well as to control the severity of the disease in due course of time. The Kshara application can be implemented easily and it is highly effective in providing relief to the patients of hypertrophic terminates. Kshara karma can be recognized as a potent and worthwhile procedure in the management of nasal obstruction due to hypertrophic terminates. Thank you.
Thank you, doctor. Thank you for the valuable insights. Next, we go to the another Panchakarma related paper presentation. I would like to invite Dr. Pallavi Ramesh Baraskar for the paper presentation on the topic Panchakarma, the 5 bio-cleansing therapies of Ayurveda. I would like to invite Dr. Pallavi Ramesh.
Good evening, everyone. Myself, Dr. Pallavi Ramesh Paraskar, and I am honored to speak with you today about a cornerstone of Ayurvedic medicine, Panchakarma, the five biocleansing therapies of Ayurveda, often translated as the five actions. Panchakarma is a powerful and systemic set of therapies for deep detoxification and holistic wellness. It's a profound journey to restore the body's natural balance. Now, introduction to Ayurveda. Ayurveda is a 5,000-year-old holistic science of life. It views every individual as a unique combination of five elements. Before we dive into the therapies, let's quickly establish the foundation. Ayurveda sees health not as the absence of disease, but as a dynamic state of balance. This balance is governed by three fundamental energies, Vata, Pitta, and Kapha. Think of it this way: Vata is the energy of motion, Pitta is the fire of transformation, and Kapha is the stability that holds everything together. When these energies are balanced, we feel vibrant. Next, but our modern lifestyle, with its stress, processed foods, and poor sleep, often leads to a buildup of metabolic toxins called as ama. It is this ama that is considered the root cause of most chronic diseases. This ama clogs the body's channels, preventing the flow of nutrients and energy. Ayurveda, the science of life, an ancient holistic system. Tridosha, Vata, movement, Pitta, metabolism, and Kapha, structure. Prakriti, also unique mind-body constitution. And Ama, undigested toxins blocking channels. This is where Panchakarma comes in. Now, understanding Panchakarma. The term Panch means five and Karma means actions or therapies. Therefore, Panchakarma is a five-step purification therapy. Purpose: the goal is not just to manage symptoms, but to systemically and safely remove deep seated toxins and waste from the body, therefore, restoring its natural state of balance and health. Significance: it is a root cause therapy, a deep cleansing that resets the body's systems from the digestive tract to the cellular level to dislodge toxins that have been accumulating for years. Think of it not as a quick fix, but as a complete spring cleaning for your entire being, resetting it to its original healthy state. It's the most effective form of preventive medicine in Ayurveda. Now, Purvakarma. You can't just jump into the main therapies. The process is a careful and deliberate one. The body cannot simply eliminate deep-seated toxins. They must first be loosened and moved to the gastrointestinal tract, the body's main elimination channel. This is the purpose of the preliminary steps known as Purvakarma. The main therapies are preceded by two essential preparatory steps. First, we have Snehan. Imagine the toxins as being glued to your tissues. The medicated oils act as a solvent, softening the tissues and loosening those toxins. This involves applying medicated oils either externally through a full body massage or internally by consuming ghee. The oily substance permeates the tissues and helps to soften and mobilize sticky toxins. Then, Sweden. This step involves inducing sweating through an herbal steam bath. The heat and steam open up the body's channels, also called as throtus, and liquefy the mobilized toxins, making them easier to move and expel. Pradhan Karma. Now, for the five main therapies, each one is a highly targeted method of elimination chosen based on an individual's specific needs and imbalance. Each therapy targets specific doshas for deep cleansing. Five therapies. First, woman, kapha disorders, virechan, pitta disorders, Basti, vata disorders, nasya, head or sensory issues, rakta mokshan, blood impurities. First, woman, a therapeutic emesis primarily for cough imbalances, cleansing the upper body, especially the respiratory tract and stomach. beneficial for asthma and sinus conditions. Then, Virechana cleanses excess pitta from the small intestine, liver, and gallbladder, highly effective for skin diseases and digestive issues. Third, and arguably the most important, is Basti, an herbal enema that targets the colon. Considered the most important therapy, it cleanses the colon and pacifies vata imbalances which affect the nervous, musculoskeletal, and reproductive system. Fourth, Nasya or nasal administration cleanses and purifies the head and senses, effective for headaches, allergies, and mental clarity. And finally, Raktamokshana, bloodletting, purifies the blood for specific conditions like chronic skin diseases, swelling, and localized pain. Paschat The process is not over after the therapies. The body's digestive fire is weakened and it needs to be gently rekindled. After the deep cleansing, the body is like a blank slate. It's crucial not to just go back to old habits. This final phase, called Paschat Karma, focuses on rebuilding and rejuvenation. The first step is specific diet to restore the digestive power, that is Sansarjan Krama. A gradual specific dietary regimen is followed to rebuild the digestive system without overloading it. After this, the body is now primed to absorb deep rejuvenation tonics known as rasayanas, which nourish the tissues and promote longevity. Next, to conclude, Panchakarma is much more than just a therapy. It's a holistic process that cleanses the body, calms the mind, and restores our natural ability to heal. It's an investment in your long term health, not a temporary solution. By understanding and embracing these ancient principles, we can achieve true, lasting wellness and prevent future illness. It's about returning to a state of balance and living in harmony with our body's true nature. It is a timeless and powerful tool for preventative health, offering a path to profound and lasting healing. Thank you for your time and attention. I hope this brief overview has given you a deeper appreciation for this ancient science. Thank you.
Thank you, Doctor. Thank you for the comprehensive presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Devaganya Navnath for the paper presentation on the topic role of Panchamrita Parpadi in Grahani Vyadhi. I would like to invite Dr. Devaganya Navnath for the paper presentation.
Good evening. My name is Devkanda Saure. I am second year PG student. My department is Rasashastra and Vaishajya Kalpana. Today's my topic is role of Panchamrit Parpati in Grahani Vyadhi. Content of this topic is introduction, Grahani Vyadhi, role of Panchamrit Parpati, benefits of Panchamrit Parpati, indications of Panchamrit Parpati, and discussion and conclusion. Introduction. In today's world, poor dietary habits, sedentary lifestyle, and stress are the major contributors to disease. All of this creates disruption in digestion and absorption, which leads to a variety of digestive disease. One of these disorders is Grahani Roga. It is a condition with a persistent chronic diarrhea as a most prominent characteristic. Grahani Roga is a disease with a high clinical importance in the modern period because to its direct link to poor eating habits and stressful lifestyle. Grahani is derived from Dhatu Graha, which means catch, hold, or obtain. Grahani is so named because its main function is Annagrahan. Its key function includes Grahan, Dharan, Pachan, Shoshan, and Munchan. According to Ayurveda, Grahani is the part of Jaఠragni responsible for the absorption of food. It subjects the ingested food to the action of Jaఠragni, absorbs the prasad bhav and pushes down the Kitta bhag for expulsion. In simple terms, it holds the undigested food and expels the digested food. When Manda Agni occurs, digestion becomes weak and leading to Grahani Roga. In Western medicine, there is no disease exactly equivalent to Grahani Roga. However, its symptoms such as a mucus and foul-smelling stools, chronic abdominal pain, loss of appetite, abdominal bloating, and frequent loose stools immediately after meals are seen in a many digestive disorder. Thus, the concept of Grahani Roga can be correlated with the several gastrointestinal conditions. Panchamrut Parpati is a highly beneficial in managing Grahani Roga. It possesses Dipan, Pachan, Grahi, Laghu, Ruchinashak, as well as anti-emetic and antidiarrheal properties. These qualities make it an important medicine for the treatment of Grahani Roga. Next, Grahani Vyadhi. Since Mandagni is the root cause of all disease, Grahani can be regarded as the Purvarup Avastha of many disorders. It is also described as a Nidanarthaka Roga. In Grahani Vyadhi, two major changes occur. First, functional and structural rearrangement of Grahani organ. Second, improper Grahankarma due to Agnidushti. The prognosis of Grahani Roga varies with age. Asadhya in elderly, sadhya in children, and future sadhya in young adults. According to Acharya Shushrut, the sixth Pitta Kala is called Brohani, situated between the Amasya and Pakvashe. In contrast, Charak Samhita it describes it as the portion located above the navi. Thus, anatomically, Grahani is situated above the umbilicus and lies between the Amasya and Pakvashe. Physiologically, Grahani is responsible for retaining ingested food during the digestion until the Kipta is propelled into the Pakvashe. Its primary function include Grahan, Dharan, Pachan, Shoshan, and Munchan. Regular consumption of improper food, especially in an individual with a weak digestion or those recovering from illness such as diarrhea or a gastroenteritis, disturb digestion and leads to a Grahani Roga. In today's fast lifestyle, stress and poor eating habits are common. Both contributes to Agni Mande, which is considered the root cause of all disease. Parpati is a medicine specially directed towards the Agnishthan, that is Grahani. Parpati is prepared as a thin, flake-like pieces through a process called as potbanda using parat, gandak and other ingredients. Its use has a proven beneficial not only in Grahani Roga but also in the conditions such as Prajakshma, Kushta, Gulma and several others. In chronic cases, the Grahani Roga Parpati prepared with the metals such as gold, silver, copper, or iron shows the particularly effective result. Next, role of Panchamrut Parpati. This is yet another treatment for the Grahani Roga, particularly in a chronic variety. Chronic diarrhea, chronic gastrointestinal disease, and chronic colitis can all be cured with this therapy. This cures the anorexia, intestinal problems, and anemia caused by the Grahani Roga. Panchamrit Parpati may also be used to treat the dysphagia, malabsorption syndrome, chronic cough, tuberculosis, arthritis, and skin problems. Then benefits of Panchamrit Parvati. This medication is mostly used to treat the digestive system problems. This medication is used to treat the disease Grahani. It is also beneficial in the treatment of the anorexia. This drug is utilized as a natural aphrodisiac and the resonator. Indications of the Panchamrit Parpati. It is used in the Grahani, Atisar, digestive problem, piles, Aruchi, Jwar, Chhadi, Raktapitta, Netra Rog, etc. Ingredients of the Panchamrit Parpati. First, Parad, Gandhav, Abragbasma, Lohabasma, Tamrabasma are the ingredients of Panchamrit Parpati. Then discussion. Grahani can be regarded as a syndrome in which persistent chronic diarrhea is the predominant feature. Its etiopathogenesis is mainly linked to the intake of an unsuitable diet by individuals recovering from diarrhea and having a poor digestive capacity. The clinical presentation includes frequent passes of stools of irregular consistency, most often liquid, but sometimes well formed, containing undigested food particles along with the pain and foul smells. The root cause of Grahani Roga is Mandagni. Therefore, the restoration of Agni is the primary goal in its management. The preparation of Parpati involves samskar through the application of Agni. With the influence of Agni, Ushna Gun and Deepan properties are imparted, which enhance the appetite and digestion. By pacifying the vitiated Vayu, the chief symptom Ati Pravritti is corrected into Samyak Pravritti. The Deepan, Pachan, Ushna properties of the drugs clear the intestinal channels, allow proper digestion and absorption of poshak ras. When nutrition is impaired, associated conditions such as Pandu, Shavadu, Gulma may develop in Grahani. The Deepan and Grahi properties of a Parpati improve the absorption of nutrients, while supplementation with metal like iron and copper gradually reduce these associated symptoms. Then conclusion. Parpati prepared in the form of thin flakes disintegrates in the body at the level of the Grahani Dhara Kala. Through its rasayan property and natural gamitva towards the Pitta Dhara Kala, it restores the normal functioning of a Pakvashay. Hence, it is specially indicated in the disease of the Grahani and is also effective in stimulating appetite. Research studies have demonstrated that in Kajali, sulfur and mercury remain in a free state compared to Parpati due to its effect of heat and the trituration. Therefore, Parpati is considered safer, more effective, and more beneficial for the therapeutic use. Thank you.
Thank you, doctor. Thank you for the comprehensive presentation. Thank you so much, doctor. Next, we go to the another paper presentation. I would like to invite Dr. Sachin Tetnabarki for the paper presentation. I would like to invite Dr. Sachin for the paper presentation.
Yes, sir.
Good evening,
Uh,
doctor.
Good evening, sir. Can you please share my PPT?
Sure, doctor. Just a moment.
Yes. Good evening, everyone. Myself, Dr. Sachin Ratnavarkhi. Today, I am presenting an effective comparative study between mesh repair and non-mesh repair in ventral strangulated hernia. My department is Shalya Tantra. So now let's start. Basically, a strangulated hernia is a life-threatening medical condition which is painful swelling with vascular compromise require urgent surgery, as we know, leading to formation of gangrene, strangulation commonly seen in small bowel obstruction or large bowel also. Occasionally, strangulated omentocele also can occur without any obstruction. So, in this fatty tissue or a section of the small intestine are pushed through a weakened area of abdominal muscle. The surrounding muscle then clamps around the tissue, cutting the blood supply to the small intestine. This strangulation of small intestine can lead to intestinal perforation, gangrene, also death of protruding tissue, which can lead to death. Irreducibility is a main factor actually. Obstruction, strangulation are the complication of the hernia. First, irreducibility occur could be primarily sutured for a defect larger than 2 centimeter in a diameter. Mesh repair is a recommended. This case study reveals the comparison between the operative of two patients having ventral strangulated hernia, one with a mesh repair and another with the non-mesh repair. So there is a photo for example, it's a ventral hernia or a epigastric hernia. We can see now. Introduction. As we know, what is hernia? It is a protrusion of the tissue from the abdominal wall. So basically, we have the idea about the hernia. So without spending much time on this, we can proceed for the next. We can presentation of the case we will see. 48 years female patient. Next slide. A 48 years female patient was with a complaints of pain in abdomen, swelling over abdomen, discoloration over swelling, vomiting since 7 to 8 days, pain in abdomen progressively worsen in 24 hours. With a presenting complaints, patient was presented in a surgery OPD. So past history, patient is known case of hypothyroidism since 2 years and she is on a regular medication for hypothyroidism. Patient has a surgical history of hysterectomy since 18 years, 18 years ago. No any family history or a drug allergy. On physical examination, patient was hemodynamically stable, blood pressure around 140 by 80, heart rate is 92 per beats per minute. There was a bulge present over the large lumbar region of approximate size 10 by 10 centimeter with a severe tenderness over the umbilicus. No any abdominal scars or herniation was present. Bowel sounds are present. There was no gardening or rigidity. Laboratory investigation we have done. Patient had a normal hemogram, renal function test, thyroid function test was normal. Other lab investigations and blood sugar was within normal limit. So we did a ultrasound and ultrasound of the abdomen. It reveals the parambilical hernia seen with the herniation of a bowel loops through defect measuring about the 10 by 10 centimeter and also gaseous distension of a colon noted. So basically, uh, surgery done, exploratory laparotomy done for strangulated left parambilical hernia with a resection anastomosis of mid-ileal perforation. There was a mid-ileal perforation due to strangulation. Frank pus in a hernial sac noted. We can see a frank pus. So the discussion optimal technique to cure strangulated hernia is a controversial. The use of mesh in a case of strangulated hernia in adult may be good option because of acceptable wound infection. But in case of old age patient, it may cause infection. In the setting of bowel resection, mesh repair might increase the incidence of surgical site infection. Abdominal wall reconstruction surgery is an advanced surgical procedure that strengthens weakened and damaged abdominal muscle and restores the normal function of the abdominal wall. It is procedure recommended for a patient with the advanced hernias. So conclusion is the non mesh repair technique is a good option for the treatment of strangulated umbilical hernias in a old, giving an acceptable wound infection rate. There is a least chance of infection, fewer recurrence. Mesh repair may give chance of infection of wound. My case presentation does not allow us to recommend the use of mesh in cases of bowel strangulation. We empathize that except the two, the result are predicted on patient selection bias by careful surgeon. Further, randomized control trials are required to obtain more powerful evidence based on data. So basically, my whole conclusion is mesh can be work as a foreign body, and it may create infection and recurrence. So non-mesh repair techniques is better than mesh repair techniques. Thank you. Thank you, sir.
Thank you, Dr. Sachin. Thank you for the well explained presentation. Thank you so much, Doctor.
Thank you, sir.
Next, we go to the another paper presentation. I would like to invite Dr. Sheda Bindu Pandare for the paper presentation. It is a case study. I would like to invite Dr. Sheda for the presentation.
Good evening everyone. Myself Dr. Shweta Bandu Pandre. I am PG scholar for Shalyatantra department JR2. I am from Dr. VJD Gramin Ayurved College, Patur, Akola. Today's topic for my paper presentation is an Ayurvedic approach to management of Granthi with special reference to cyst. It is a case study. Introduction about my paper presentation is Granthi is a broad term which covers the condition under modern science as cyst. The Pratyatma Lakshan of cyst is Vrutta Unnata Shofa, which means round elevated swelling. In Granthi, vitiated dosha affect Mansa, Rakta and Meda. Epidermal inclusion cyst can arise from any type of trauma or surgical procedures because epidermal parts are implanted in dermis. Any skin puncture, laceration or incision has potential to implant epidermal elements into the dermis and subcutaneous tissue, where continuing production of keratin and other epidermal products generates a thick-walled cyst filled with white cheesy material, which is known as epidermal inclusion cyst. These cysts are frequently found in young and middle-aged adults with no significant difference in men and women. That is, prevalence rate of epidermal inclusion cyst is usually same in men and women. Here, case report shows 45-year-old female patient who is a tailor by occupation came to OPD presenting with a lump in the right palm for past 6 months. Local examination of lump was done. Site of the cyst is in the middle of third metacarpal of the right palm with small wound on the proximal end of the lump. Shape was globular, size 3 cm in diameter, smooth surface, no redness over the lump. History revealed that she had a thorn prick in the middle of right palm, noticed a lump in the right palm after 3 months of thorn prick, and which was small and painless at the onset and was gradually increasing in size. Lump was movable and mild painful. She took modern medicine for the pain and swelling, which results into temporary relief but not cured completely. There was no history of any major illness like diabetes, hypertension, ischemic heart disease, tuberculosis, etc. The family history was also not significant with the patient disorder. General examination was done, which determines there was no general examination abnormality present. Nidan was trauma, which is thorn prick, history of any surgical procedure, and 3 dosha. संप्राप्ति घटक are dosha, kapha pradhan, dusha, mamsa, rakta, and meda. Agni is madhyam. Prakriti of patient is vata kapha. Treatment selected for this case was Abhyantar Chikitsa along with Bahya Chikitsa. Abhyantar Chikitsa, Kanchanar Gugul 250 mg, 2 tablet twice a day with Koshna Jala, and Dashmula Ghana 250 mg, 2 tablet twice a day with Koshna Jala. Bahya Chikitsa was ligation with Apamarga Kshara Sutra. Results: Kanchanar Gugul shows effective results in reducing cystic mass size, while Dashamula Ghana proves effective in pain management and reducing inflammation. Ligation with Apamarga Kshara Sutra shows effective results in the management of recurrent epidermal cyst in a period of 1 month. Patient got complete relief from the symptoms and the wound got completely healed. Here we adopted Shara Sutra therapy for the management of Granthi, which is Chedya Bhedya Vyadhi. This image shows before treatment, after Shara Sutra ligation, and after treatment images of the patient. Mode of action: Kanchanar Gugul exhibited a cytotoxic effect by inhibiting cell division, anti-mitotic effect, and reducing cell proliferation, which results in reducing cystic swelling. Kanchanar Gugul is effective in reducing cell division. Dashamula Ghana, they acts as anti-inflammatory, analgesic, diuretic, and soothing agent. Dashamula Ghana particularly act on Vata dosha, and Vata dosha is responsible for pain, which is ultimately results into pain management for the cyst. Apamarga Kshar have qualities aid in the removal of undesirable tissue. It functions as a sclerosing agent locally. Kshar possesses the qualities of Bhedana, Lekhana, and Chedana in addition to Vranashodhan, wound purification, and Dropana, that is wound healing. Symptoms related to epidermal inclusion cyst are mainly related with localized growth of epidermal tissue, which leads to cystic swelling and pain. Ayurvedic perspective of this case, presenting with mild painful cystic swelling, has been established with Kafaj Granthi. As pain is the feature of Vata dominancy, the treatment was planned on the basis of dosha and dusha involvement. Therefore, Kanchana Gugul, Dashamula Ghana, and Apamarga Kshara Sutra combinedly helps to reduce the symptoms of Granthi and significantly decreases its recurrence rate. This case study shows that recurrence rate of epidermal inclusion cyst can be significantly managed to reduce with Ayurvedic intervention. No adverse effect pertaining to the prescribed drug was reported. No recurrence was noted. The limitation of this study is that this is a single case study and need to be studied in more number of cases for its concrete conclusion. Thank you.
Thank you, doctor. Thank you for the presentation. One more poster presentation is there. We are all aware that fissure nano is a painful and distressing condition that requires effective management. The next presentation focuses on an integrated Ayurvedic approach to Parikartika with reference to fissure nano, highlighted through a case study. I would like to invite Dr. Sheda Bindu for the poster presentation.
Good afternoon, everyone. Myself, Dr. Shweta Bandu Pandre. I'm PG Scholar for Department of Shalyatantra, JR2. Today's topic for my poster presentation is an integrated approach to Ayurvedic management of Parikartika with special reference to Fisher in Anno, which is a case study. Need for this study is Parikartika in Ayurveda refers to conditions affecting anal region characterized by anal sphincter spasm, cutting pain and burning sensation and occasional bleeding at anal region. While defecation. Modern lifestyle factors like poor dietary habits, sedentary lifestyle, low fiber intake and stress contribute to the formation of fissure in anal. Keeping all these facts in mind, it is need of an hour that if anal fissure patient receives treatment in initial stage of disease, then surgical intervention can be avoided. Different Ayurveda and modern textbooks, journals, research papers and articles are referred to this study concept of Parikartika and its correlation with fissure in anal. Here case report shows a 35-year-old female housewife with case of constipation, pain while defecation, burning sensation after defecation since 1.5 months. Before 7 days, she had severe cutting pain at anal region and streak of bleeding with stool. After PR examination, she was diagnosed as fissure in anal. Now, how Parikartika and fissure are correlated? The resembling features of Parikartika and fissure in anal have correlation. Parikartika comes under Virechan Ganpat, under Atiyog of Virechan. In Ayurveda, general line of treatment of fissure in anal is Pichha Basti, Siddhatel Anuvasan Basti, Avagaha Sved, topical application like Dhrita, Taila, Malahar, Pichu, Gudavarti or Gudabasti. Gudabasti is a type of Siddhatel Matra Basti in which medicated oil introduced in anal canal for relieving symptoms of fissure in anal. The interpretation of efficacy and probable mechanism of action of therapy can be extended by combined result of action of drugs. Mechanism of anal fissure. The main cause for anal fissure is constipation. Due to constipation, it is difficult to pass stool due to sphincter spasm at the anal region. This leads to wound formation at the anal verge, leads to anal fissures. Here, picture presentation of Matra Basti and Avgaha Sved is given. Hetu or causes of Parikartika and fissure in anal have similarity. This Hetu results into Vata Prakopa. Parikartika or fissure in anal is classically treated with Snehan Svedan and Pichha Basti or Siddhatel Basti. Abhyanga Chikitsa with Trifala Churna helps in resolving constipation by its laxative effect. Nishatel Matra Basti is helpful for healing fissure by Ropan properties of Haridra and Tiltal helps to soothe lining of anal region and Vata Prashaman. Avagaha Sved is effective for pain management and reducing inflammation. Hetu or causes of Parikartika and fissure in anal causing Vata Prakopa have similarity. They have potential to cause constipation, which later on results into pathophysiology of Parikartika or fissure in anal. Due to all causative factors of Vata dosha gets vitiated and lodged at mass present at anal region. Combined result of action of drugs like Trifala Churna, 5 grams after dinner with lukewarm water at night for 7 days along with Nisha Siddhatel Matra Basti and Avgaha Sved, that is hot sis bath, have shown good results in relieving symptoms of pericarditis. Thus, similarly, control studies with comparative drugs can be performed to prove better therapeutic efficacy and management of pericarditis. References for this study are Sushruta Samhita, Charak Samhita, and Ashtanga Hridayam.
Thank you, Doctor. Thank you for the insightful presentation. Next, I would like to invite Dr. Rashmi S. Nair for the paper presentation. Dr. Rashmi, are you there? Dr. Rashmi S. Nair, are you there? Dr. Rashmi, please unmute, Doctor. Dr. Rashmi, please unmute, Doctor.
Hello.
Good evening, Doctor.
Am I audible, sir?
Yes, Doctor, audible.
Yes, sir. Can I share my screen?
Sure, Doctor. Your screen is visible, Doctor. Please start the session.
Yes, sir. Good evening. Myself, Dr. Reshmi S. Nair, postgraduate scholar from Sri Sri College of Ayurvedic Science and Research, Department of PG Studies in Kaumara, Pritya. The topic I've chosen today is shaping the infant mind, breastfeeding, and neurodevelopmental bonding. So, breastfeeding is usually considered as a physiological and an emotional bridge that is bound between the mother and the child. So, when we talk about an neurodevelopmental bonding here, we must consider it as an emotional attachment that is developed between the baby and the mother, and it is considered very vital for brain development. Both the sciences, the Ayurvedic and the modern science, both emphasizes that early nurturing of the baby is very essential for lifelong well-being. So it says that stanyam jivanam balavardhanam medhyam cha. When we talk about it in a global health perspective, it says that about 8,20,000 child deaths annually can be prevented by breastfeeding, and WHO also recommends exclusive breastfeeding for 6 months. There's a study which says that 95% of brain growth occurs in the first 2 years, which shows that the critical window for brain development, neurodevelopment, is this period, and breastfeeding through this period is very essential. We also have UNICEF, which has a campaign which says breast is best, which says that breastfeeding is very essential. When we talk about the composition of breast milk here, it is very rich in proteins, lipids, lactose, and growth factors. It contains very essential DHA and ARA, which are also found in the formula milk these days, which shows the essential range of it for brain development. Immunoglobulins for preventing from or protecting from infections, hormones, probiotic support for gut brain axis, etc., are provided through breast milk. Even infant brain development and breastfeeding, when we consider, we must know that it is very crucial for growth, as we have long chain PUFAs present in breast milk, and it enhances the myelination and synaptogenesis also during the breastfeeding. It helps in improved cognitive outcomes, and higher IQ is seen in children who are exclusively breastfed as infants. When we speak about the neurodevelopmental impact, breastfeeding infants show a higher cognitive score, enhanced memory, attention, and language development. They also secure a greater maternal infant attachment than the children who are given top feeds. So, a better emotional regulation can be seen here. There is a reduced risk of ADHD, the autism spectrum diseases, anxiety kind of conditions in kids, and long-term effects also. There are studies which shows that long-term effect shows better academic performances in these kids. Modern evidences here. The Lancet 2016 is a series of studies which shows that breastfeeding improves IQ by approximately 3.5 points. And even the Harvard study shows that breastfeeding children, they perform better in school. This was conducted for the age of 7 years of students or children. WHO in 2022 has also shown that breastfeeding is linked to lower emotional behavioral problems in children like ADHD, ASD conditions, where because oxytocin here increases, which develop a better bonding, and when cortisol levels are decreased, the stress levels are reduced. When we speak about the mechanism of neurodevelopmental bonding here, we must understand that when there is suckling process that happens, it ignites the hypothalamus. When oxytocin is released, prolactin is released, at the same time cortisol is reduced, and this way we can see the hormonal neural pathways here, and neuroplasticity is enhanced during breastfeeding. Also, Acharya Kashyapa in Lehana Adhyaya has said that breast milk is most suited and wholesome for the infants. That is from the mother itself than the animal milk, which in turn shows us that species to species milk, which is very essential. So though all breast milk is desirable, the mother's own milk is more especially beneficial. The relevance here also, as I spoke, species specific nutrition and emotional attunement is attained through mother's milk. Sensory inputs and bonding, skin to skin contact activates tactile and thermal receptors. Olfactory memory of mother's smell help with limbic stimulation. Eye contact, voice regulation, suckling, etc. helps with emotional attunement. And it is very critical for right hemisphere development, which is for emotional processing. When we speak about the psychological integration here, as we know the Erickson 7 stages, the first stage, that is trust versus mistrust here, which is developed during the first 0 to 1 year of age. When the breastfeeding is done, it builds this first experience of securing trust with the mother, who is the first person to give you trust, and lack of this maternal bonding could lead to emotional dysregulation in the future. Ayurveda also says here as matru sattva impacts the manasa vikaras. So Ashtanga Hridaya also, in Ashtanga Hridaya also, we have a reference which says as mother's milk is life-giving and it enhances the strength and complexion. It is pleasantly warm, light to digest, sweet in taste, helps eliminate vitiated doshas, especially kapha. So here the relevance is that it shows both nutritive as well as therapeutic properties. It supports in immunity, digestion, and mental clarity. Emphasizes that subtle effect on ojas and mental vitality is also present, which is parallel to the modern views of immunoneural developmental links. Hormonal benefits here, as we spoke earlier, oxytocin aids in the ejection of the milk, that is the let down reflex here. It promotes in uterine involution post delivery, postpartum bleeding, and risk of anemia is also reduced here. And the feeling of the goodness and emotional bonding is developed with oxytocin. Parallel concepts in oxytocin here is in Ayurveda we say sneha, matrasattva, the hridayasthana, etc. That is bonding and nourishment. Skin to skin touch here is Sparshagnana and Pranavardhana. And mother's calming down of the mind and refreshment can be related with the Sattva gunas increase with breastfeeding. Oxytocin and Apana Vayu also here, it helps in promoting Shuddhi and Yoni Shuddhi specifically, ejection of milk and uterine contractions, balanced Vata for healthy lactation and involution. Mother's mental state, as we said, because of increased oxytocin and reduced cortisol, it develops a healthy mental health for mother. Then speaking about the bonding here, though affection, warmth, nourishment, and love filled breastfeeding is provided through the mother to the child receives the greatest benefits, that is the body is gratified and the soul is delighted. Here the relevance could be understood as the holistic effects of the breastfeeding, where touch, warmth, emotional love, the nutritional coverage here, that is the child which achieves it, all of this reflects that both modern attachment theory and Ayurvedic psychosomatic nurturing, confirming that breastfeed is not just food, but it is an act of love and emotional imprinting. It is about the maternal confidence, bonding with the baby, the calmness, and maternal skill building. Moving on, to the causes of stanya dush, or the role of Ayurvedic pediatrician here. So, early identification of lactation failure could help us to understand and help find out the measures for treating this bonding issues. Respecting cultural beliefs while promoting science should be done, and empowering mothers through education, empathy, and traditional values are very essentially to be provided by an Ayurvedic pediatrician. To conclude, breastfeeding is a sacred bridge. It is not just physiological connection, but also an emotional, hormonal, and a spiritual one. Modern science shows how oxytocin touch stimulates the brain, while Ayurveda speaks about stanya and manasa poshaka as nurturing of the psyche. The future of pediatrics lies in respecting both the wisdoms, and when nutrition meets nurturing, true neurodevelopmental bonds begin. So these are the references. Thank you.
Thank you, Dr. Reshmi, for the well articulated, energetic presentation. One more poster presentation is there. We will share the screen, Doctor.
Yeah, thank you, sir. Myself, Dr. Reshmi Nair, postgraduate scholar from the Department of PG Studies in Kaumara Pritya. For today's poster presentation, the topic I've chosen is Milk Matters, Milk, the Myths versus Facts Unlatched. So here, considering the recent Breastfeeding Awareness Week, this topic was taken, and here I shall be talking about the myths and the facts that states. So starting with the first one, formula milk versus breast milk. It says that the formula is as good as breast milk, but the fact here is that breast milk is a living fluid. It is customized with all sorts of antibodies and enzymes and hormones that is required for babies' improvement in immunity and overall health, which formula feed cannot completely replicate. It can be used, but it cannot be replaced, or it cannot replicate breast milk. The second myth here is colostrum is a misconception, because it says that colostrum is dirty. But the fact here is it is to be considered as liquid gold, because it has a lot of, or it is considered rich to be with immunoglobulins, and it is vital for newborns' immunity. The third one is that baby needs water in the summer, that is water requirements for the baby. But the fact is that breast milk already contains almost 88% of water, which is perfectly sufficient to quench the baby's thirst. The next myth that is considered is mothers with small breast could give out or feed baby only less milk. But the fact is that it does not depend upon the size of the breast, but it mostly depends upon the glandular tissue and the feeding demand of the baby. The third thing is about the next thing is about the pain that is experienced during breastfeeding, that breastfeeding is considered to be hurtful always. But the fact here is, if the baby is properly latched or taught to latch in the initial phases itself, this could prevent the pain to a greater extent, and it could also help ensure smoother experience and bonding between the mother and the baby. The next myth here is sick mothers should not feed the baby. So the fact here is most illnesses are not usually spread or transmitted, but the antibodies or the protective antibodies, they pass on to the baby. So avoiding direct contact or sneezing and coughing in front of the baby's mouth or face is definitely to be avoided, but breastfeeding can be continued. The next fact or myth here is that after 6 months the milk loses its value. But the fact is, that if it is continued, if breastfeeding, the nutritions and the essential immunity that is gained in the baby is continued, even if complementary or weaning food is started in the baby. So continuation is recommended. The next thing is that working mothers cannot continue with breastfeeding, but the fact is that whatever expressed milk is there, that could also allow in improvement in the baby's nourishment, in the baby's immunity similarly, and it need not be stopped. If working mothers can continue by expressing the breast milk and feeding the baby throughout the day when they are away. The next myth is that considering breastfeeding as a contraception. That is, you cannot get pregnant while breastfeeding. But the fact is that it can only delay the periods, or in some cases initially, and it should not be considered as a foolproof contraception. So, to close my poster here, I would like to say that every drop counts, and the nature's first vaccine is breast milk. So, we must encourage the mothers and families to seek support from healthcare providers for breastfeeding challenges, if any, and help latch the baby, teach to latch the baby, so as the mother and the child bonds well. Thank you.
Thank you, Dr. Rashmi, for the paper and poster presentation. Thank you so much, Doctor. Next is a Mutrashmani related paper presentation. I would like to invite Dr. Bhavana MN for the paper presentation. Dr. Bhavana, are you there?
Yes, sir.
Good evening, Doctor.
Good evening. Can you share my PPT?
Okay, Doctor, just a moment. Please start the session, Doctor.
Okay, thank you. Good evening, everyone. Myself, Dr. Bhavana, second year PG scholar from Department of Shadyatantra. Today, I'll be presenting a paper presentation on topic understanding of Mutrashmari. So coming to the contents, this slide contains introduction, Nidana and Samprapti, Purva Rupa, Veda of Mutrashmari, Lakshana, which includes Samanya Lakshana and Vishishta Lakshana, which has been explained by Acharya Shushruta, Upadrava and its Chikitsa. Coming to the introduction, Ashmari is one of the Mutravaha Srota Vikara. Root meaning of Ashmari, it includes Ashma, which refers to store, and Ari, which refers to enemy. That is, when there is Ashmari, it gives severe pain as given by enemy. And as Acharya Shushruta mentioned, Ashmari as one among the Ashtamahagada. He has mentioned due to its Tridosha in origin, and Vektasthana is Basti, which is one among the Pranayatana. He has mentioned in Shushruta Nidana Sthana, 33rd chapter at 4th sloka. And Acharya in Sushruta Nidana, 3rd chapter, 3rd sloka, Dalana has given a simile that Shleshmadhishtanaha, Shleshma Upadana Karanaha, Shleshma Upadanam, Upadaya Bhavanti Atyartaha. Where he explains that both Acharya Dalana and Madhava states that even though Tridosha is involved in formation of Ashmari, Kapha plays an important role in pathogenesis of Ashmari. And Acharya Shushruta explained the formation of Ashmari by giving the simile as Apsu Swachaswapi Yatan Nishiktasu Navegatte Kalantarena Pankaha Syat Ashmari Sambhavastataha in Shushruta Nidana, 3rd chapter, 25th shloka, where simile is given as when water is kept in a pot and for some long duration undisturbedly, it becomes turbid and precipitates will be formed. So similarly, Ashmari is formed in the Basti. And coming to Nidana and Samprapti, in Nidana Sthana, in Shushruta Nidana Sthana, Ashmari Nidana chapter, Acharya Shushruta has explained, Tatra Asamshodhana Shilasya Apatyakarinaha Prakupitaha Shleshma Mutra Samprukto अनुप्रविश्य बस्तिम् अश्मरि जनयन्ति. Due to nidana sevana and samshodhanashilase and apatyakarina etc. Kapha gets prakupita, it reaches Basti and Mutra gets Dushita. Further Ashmari will be formed. And in same chapter, Acharya has explained that Ashmari is common in children in Bala due to these causes like Divaswapna, Asa, Samashana, Adhyashana, and Snigdha, Guru, Madhura, Ahara, and all. Ashmari will be more occurring in the Bala individuals. And he has also explained that it will be easy to remove in case of Bala individuals due to Alpa Bastikayat and Anupachita Mamsa. Sukha Grahana will be there in case of Bala. Coming to Purva Rupa, Acharya has explained Purva Rupas like Jvara, Basti Pida, Arochaka, Mutra Krucha, Basti, Shira Mushka, Shefam, Vedana, Krutra Vasado, Bastaganditvat, Mutra Syati, Yata Asveda Swavedana Varna, Dushtam, Sandram, Atavilam, Purva Rupe, Ashmanaha, Krucham Mutra, Srujati Manavaha. These are the Purva Rupa explained in Sushruta Nidana, 3rd chapter, 5th and 6th shloka. Coming to classification of Ashmari, Acharya Sushruta has explained 4 types of Ashmari, that is Shleshmaja, Pittaja, Vataja, and Shukraja Ashmari. Coming to Samanya Lakshana, these are the general Lakshanas seen in case of Ashmari, that is Atta Jatasu, Nabi Basti, Sevani, Mehaneshu, Anyatamam Asmin, Mehate Vedana, Mutradara Sangaha, Sarudira Mutrata, Mutra Vikirina, Gomedaka Prakasham, Atyavila, Sasikata, Visrujati, Davala, Langana, Plavana, Prushtayana, Ushna, Advagamanascha, Asya Vedanam Bhavati. Next, coming to Vishishta Lakshana of Ashmari, Acharya has explained according to doshas, that is Vataja, Pittaja, Kafaja, types of Mutra Ashmari. Here we can classify into certain aspects like Vedana, Varna of Ashmari, and Ashmari Akruti and other Lakshanas. In case of Vataja Ashmari, Vedana will be like a patient will be experiencing severe pain, that he will be clenching the teeth, and Nabi Pidayati, Medram Pradumnati, and Payam Sparshati. In case of Pittaja, Chushyate, Dahyate, and Pachata type of pain will be there. In case of Kafaja, Dalyate, Vidyate, and Nisthitate type of pain will be there. And coming to Varna of Ashmari, in case of Vataja, Shava Varna will be there. Pittaja, Madhu Varna, Sarakta, and Pitava Basa, Krishna Varna will be there. Coming to Kafaja, Madhuka Pushpa Varna will be there. Ashmari Akruti, in case of Vataja Ashmari, it will be resembling to Kadamba Pushpa Kantakavat. In case of Pittaja Ashmari, Ballataka Asti Pratima will be there. In case of Kafaja, Kukutanda Pratikasha type of appearance will be there. And other Lakshana of Vataja Ashmari includes Vidahati, Vata Mutra Purishani, Kristrena Nisarati. In case of Pittaja, Mutra Pratigata, Basti Rushna Vata. In case of Kafaja, Basti Guruta, and Shitata will be seen. Then fourth type of Ashmari explained by Acharya is Shukra Ashmari. Here he explains Mahatam to Shukra Ashmari, Shukra Nimitta Bhavati. Here Maituna, due to Maituna Vigata Ati Maitunat, Shukra Chalitam Anirgachat, Vimarga Gamanat, Anilo Abitaha, Sagruhya, Medra Vrushayorantaram Samharati, Samroha cha Upashoshayati, Sa Mutra Margam Avranoti, Mutra Krutra, Basti Vedana, Vrushanayoscha Shavatum, Apadayati, Pidayata Matrecha, Tasmineva Pradeshe, Prabilayam Apadyate, Shukram Ashmariti Vidya. And one more type of Ashmari that can be seen is a Sharkara Ashmari. Sharkara Ashmari refers to Ashmari in presence of Vata. It breaks into smaller pieces resembling that of Sharkara. So it is known as Sharkara Ashmari. The symptoms, Lakshana and Vedana will be similar to that of Ashmari here. Coming to Lakshana of Sharkara Ashmari, there will be Rutpida, Shakti Sadana, Kukshishoola Cha Vepatu. तृष्णा ऊर्ध्वगो अनिलः काष्ण्य दौर्बल्य पाण्डुगात्रता अरोचक विपाकौ तु शर्करार्थे भवति च. Coming to Upadrava, there will be Mutra Marga Pravata Sakta Kuryad Upadravat, Daurbalya Sadana Karsha Kukshishula Arochaka Panduta Ushnavata Trishna Rutpida Vamin. These are the Upadrava that can be seen in case of Ashmari. Then coming to Chikitsa, Acharya has explained in Sushruta Chikitsa Sthana, 7th chapter. He has explained the Chikitsa based on the duration. That is, in case of Purva Rupa, Snehadi Krama should be given. In case of Taruna Avastha, Aushadhi Chikitsa should be given. In case of Pravruta Avastha, Chedana Karma should be done. And these are the some of the drugs that has been given by Acharya Sushruta in case of Beshara Chikitsa. In Ashmari, like different formulations like Shara, Yava, Guyusha, Kashaya, Paya that can be prepared using the below mentioned drugs in that type of which dosha is involved. In case of Vata, Pashrana Beda, Shatavari, Yava, Kulata, Swadamshra, Ashmantaka, Bruhati, Kantakari, etc. drugs can be used. Coming to Pittaja, Kusha, Vidari, Trikantaka, Punarnava, Pata, etc. can be used. In Kafaja, Varunadi Gana Dravyas, Kushta, Maricha, Chitraka, Ushakadi Gana Dravyas can be used. And Acharya has given importance for Pani Akshara in case of Mutra Ashmari. He has also explained Pani Akshara as one of the indication of Pani Ashmari in Pani Akshara in Shushruta Sutra Sthana 11th chapter. And Dravyas mentioned for preparation of Gruta should be taken and Kshara is prepared, which is mixed with Avi Mutra and Kshara of Gramya Vasta Shakrut added with Ushakarji Gana Dravyas and Trikatu. Tikshara taken internally cures Ashmari, Gulma, and Sharkara, which has been explained in Shushruta Chikitsa Sthana, 7th chapter, 20th to 22nd shloka. And in same chapter, Acharya has given one more preparation that is this is prepared using tila, apamarga, kadali, palasha, kalka, along with avimutra is said to be sharkara nashaka. And similarly, other dravyas like patala, karavirakshara can also be used. Even in recent studies, it has been proved that kshara like yava, palasha, uh, Kadali taken along with Varunadi Gana Kashaya, Bruhatyadi and Virataradi Kashaya as Anupana helps in treating the Ashmari successfully. And coming to Chedana Vidhi, Acharya has explained Purva Karma, that is Abhyanga and Svedana should be done, performing Bali, Mangala and Swasti Vachara. And patient should be taken in lithotomy position, legs should be flexed at knee, supported by hands and tied with bandages. Then Abhyanga should be done in on Adonavi Pradesha. Avapidana is done using Mushti, such that the Ashmari should be allowed to pass down. When Ashmari is thus fixed while carrying out this process, Vaidya will be held handling Basti, which is also Sadhya Pranahara Marma. Later, Pradeshini and Madhyama Anguli of Vamahasta should be introduced into Guda Pradesha, and attempt should be made to bring down the store, and it is made to attain the shape of Granthi, due to which patient may develop symptoms like Vivrutaksha, Vichetana, Nirvikara as that of dead person. Due to which the patient this will be if these lakshanas will be present, then nidharana should be stopped. If it is absent, then it can be continued. Then to the left or right side of the sevani, leaving one yava matra pramana space. Using shastra, incision should be taken, which is of Ashmari pramana. Ashmari extracted using agravakra shalaka without breaking it and leaving a particle behind. After removing, avagaha svedana should be given using ushnodaka, and basti should be cleansed using kashaya of kshiri ruksha. If Shukrashmari or Sharkarashmari causing obstruction to the Mutra Marga, it should be removed. If not possible to remove by this method, then Vidarana should be done and Ashmari is extracted out using Badisha Yantra. Coming to Patya in Ashmari, therapeutic procedures like Basti, Virechana, Vamana, Avagaha, Sveda can be given. Ahara Danya like Eva Kulata, Prapurana Shali, Danya, Purana, Kushmanda Phala can be used in Aushadha Dravya, Gokshura, Varuna, Adraka, Pashana, Beda, Yakshara are useful. Coming to apatya, mutra and shukra vegadharana should not be done. Amla, Vishtambi, Ruksha, Guru, Annapana should not be given. Viruddha Ahara Sevana should be stopped. Thank you.
Thank you, Dr. Bhavana. Thank you for the enlightening presentation. Next, I would like to invite Dr. Anand Dangi for the paper presentation. Dr.
Good evening,
Anand,
sir.
can you hear me? Good evening,
Good
Doctor.
evening, sir. Sir, can you kindly please share my PPT, sir?
Just a moment, Doctor. And please start the session, Doctor.
Yes, good evening, everyone. I welcome everyone for my paper presentation. So, topic of my presentation is Introduction to the Abhyantara Vidradi and description of the Yakrat Vidradi under the guidance of Dr. Vishwanath sir. So, contents of today's presentation is Introduction to Yakrat Vidradi, derivation and all. So, introduction. Here, the word Vidradi is derived from the root word Vidra, which implies to the painful conditions like pricking, stabbing, or cutting sensation on the skin. Vidradi is a Rakta Dushti Vikara which undergoes rapid separation followed by Puya formation. Acharya Sushruta has explained the 10 adhishtanas of Antar Vidradi. Among these, Yakrat Vidradi is also mentioned. Acharya Charaka has explained Vidradi under the Rakta Pradesha Vikara, in which Rakta Dushti and Paka takes place predominantly. The aggravated Vata Pitta Kapha vitiates Tvak Rakta Mamsa Meda. Modern concepts in modern context, Vidradi can also be correlated to abscess. Nirukti of the Vidradi is Tat Shigra Vidayatata Vidradi Itabidiyate. The one which undergoes the stage of rapid separation is known as Vidradi. Coming for the definition, Takrak Mansa Mera produces Siramanga Shudha, Dosha, Shafa Saner Garam, Janetu Satya Varsam. The reference for this Shushutanadana 9 chapter 4 sloka. Vidradi next Duktaraka Matrapa Survey Shigram Vidayate due to excessive vitiation of Rakta Dosha, rapid separation takes place. This is known as Vidradi. Chapi Ashvidahitvat Vidradi, so the one which undergoes a stage of rapid separation is also known as Vidradi. Next, coming for the Samana Samprapti, here Kupita Tridoshas will produce the production of Takrakta Mantra Meda because of there will be acidation and Shota. Finally, it will lead to the stage of Vidradi. And types of Vidradi, there will be two types, Bahya Vidradi and Abhyantara Vidradi. Next, coming based on the dosha classification, there will be Vataja, Pittaja, Kaphaja, and Sanipataja, and Kshataja, and Ashraja. Next, 6 types of Vidradi has been explained by Acharya Sushruta and Acharya Vagbhata, and 4 types of Vidradi has been explained by Acharya Charaka. Next, Samana Lakshana of Vidradi are Mahamulam, Rujavantam. Mahamula means Vidradi are which are deeply seated, Rujavantam means which are painful, Vrittam or Ayatam which are round and elongated. Next, the avasthas of Vidradi are same explained in the Ama Pakvashan Adhya, which are in Amavastha, Pachamana Avastha, and Pakva Avastha. Similarly, the Lakshanasa has been explained according to Amavastha, Pachamana Avastha, and Pachavastha. So here Pachamana Shofa Lakshanasa Suchibarva Nistudate, Daheteva Pepilkabi, Chidateva Shastrena, Gattateva Cha Angulya, Dahete Pachateva Cha Agnisharabhyam, Admata Dostiriva Angana, then Pakwa Shofa Lakshana, Vedanopa Shanti, Panduta Alpa Shofata, Vali Pradurbhava, this and all can be seen in the Pakwa Shofa Lakshanas. Next slide. Vataja Vidradi Lakshana, Krishna Arunava Parasho Bhisham Attartha Vedana, Chitrotmana Prapakascha Vidradi Sambhava. This reference are Shushutanadar 9 chapter 7 shloka, and Pittaji Vidradi Lakshana, Pakva Dumbara Sankasha, Shavava Jvaradahavan, Chiprotmana Prapakascha Vidradi Pitta Sambhava. This is Pitta, then Kafaja, Sharav Sadrshaha Pandu, Shita Stabda Alpa Vedana, Chitratana Prapakascha, Sakandusha Kafochitaha, then Sannipada Vidradi Lakshana, Nana Varna Rajos Rava, Gatalo Ishmahan. Vishama Vidradi, Sanipatika. This is Sanipatika Vidradi Lakshana. Next slide, please. Okay, this in brief, I have mentioned all the Lakshanas of Vataja, Pittaja, Kafaja, Raktaja, and Sanipataja, along with the Kshataja also. Here, as whatever I told in the previous shlokas, that I have just mentioned in the table format. Then when you come for Chikitsa, Samana Chikitsa, in Apakva Avastha, Shofara Chikitsa can be taken in Rakta Shodaka and Rakta Pitta Prasadaka. In Pakva Avastha, you have to go for Shodhana, Visravana, and Ropana. In Abhyantara Vidradi, definition goes like this: Goda Basti Mukyan Abhyam, Kuksha Vankshana Vastata, Vrakko Rekritir Plihin, Hridaya Klomina Vatata. According to different acharas, Abhyantara Vidresar, according to Shushruta Achara 10, according to Vagbhat Achara 10 in number, according to Sarakachara 9 in number. These are the nidanas for Abhyantara Vidradi. Guru Satmaya Viruddha Anna Shushkumamsa. In the next slide, I have mentioned clearly Aharaja Nidanas and Viharaja Danas. For example, excessive intake of Guru Anna, Asatmaya Anna, Viruddha Anna, Shushka Anna. These are Aharaja Nidanas. In Viharaja Nidana, Ati Vayama, Ati Maitana, Vega, Sandharana, Ati Shayana, Ati Bhara, and Ati Adva. These are the Viharaja Nidanas. And the Samprapti of the Antarvidradi, due to Nidana Sevana, there will be Mandagni leading to formation of Rama, Tridosha Prabhapa, and Sana Samshaya and Raktamamsa Nidana Sedato, formation of Shofa and Shigra Vidayatam, Shonitamamsa Pakam, which leads to Puya Sanchayam forming Pakwa Shofa and Antarvidradi. Lakshanas of the Abhyantara Vidradi, all this because of all this vitiated dosha, with a single dosha or in a three doshas, will form a gulma lake and large abscess internally, which is shaped like an ant hill. Similarly, this all the Abhyantara Vidradis along with their Lakshanas and according to different acharas, I have given a gist in this table. Coming for the Ekrit Vidradi, Ekrit is formed by the Matrajari Shadbhavas. Ekrit Vidradi is one among the Abhyantara Vidradi. Sthana Vishesha Lakshana of Ekrit is Swasa. The discomfort in this condition is continuous and acute due to the inflammation of pus collection. Ekrit Vidradi can be correlated to the liver abscess. So Sadhya Sadhyata Amava Yadi Pakva Mahanya Vadi Vetara Sarva Marma Vidradi Kashta Uchate. When it is situated in Varmasthana, it will be difficult to cure. Avastha Visheshadi Sadhyatvat, the abscess located in the organ situated above the umbilicus, for example, Pliha, Ekrit, Kukshi, and Hridaya, Pakva Urva Yanti Pravanti. If attains Paka and expels the Puya and upward root, patient will not survive. If the abscess located in the organ below the umbilicus, when it attains the plaque, expel the pus downward the root. If abscess located in the parts other than Hridaya and Abhi Basti, if the Vidradi burst outwards, patient will survive. The patient does not survive if the Vidradi burst inwards. Next, Abhyantara, Apaka Abhyantara Vidradi, Kashaya for Varanadigana with Ushakadigana, Sarpi prepared with Varanadigana and Ushakadigana to be taken, Thaila prepared with above the ganas along with the Vilechakagana can be used for Anvasana and Astapanbasti, Madhushaguri can be used for the Pana Lepana and Bojana, and for Paka Abhyantara Vidri, which are Bahirunada and Vedana and Pranava Chikitsa can be done. Then for Vodana with Siddharthaka and Shigurumula Jara can be taken along with Evakola and Kulata. Balanasara Tilvakagarta Prayoga in Pratakala. Sarpi prepared with Tivatadivana can be taken. Some formulations for this one: Trayamanadigrata, Drakshadigrata, Eva Goduma Lepa, Dashamuli Lepa, Trayantadipata, Shobhanjana Kota, and Punaramadi Gugul. Abscess, when comparing to the modern, a circumcised collection of pus or a cavity formed by the electrification necrosis within the solid tissue. There are three varieties of abscess can be seen: pyogenic, pyemic, and cold abscess. Classification of pyogenic and pyemic and cold abscess. In a pyogenic abscess, a localized collection of pus in a cavity lined by the granulation tissue and dead tissue covered by a pyogenic membrane. The commonest form of an abscess and subcutaneous deep, it can occur within the viscera such as liver, kidney, spleen, etc. Pyemic abscess, it occurs due to circulation of pyemic embolism in the blood. Multiple abscess develop from infected embolia and pyemia. Cold abscess. In cold abscess, cold are non-reacting in nature. It does not produce hot or any painful abscess as seen in the pyogenic abscess. Organs gain, like in Samprapti, as I explained here, direct infection from outside due to penetrating wounds or local actions from adjacent focus of infection, lymphatics, bloodstream or hepatogenesis. These are the organs will take entry. The clinical features will be of rubor, impairment of function, scalar or heat, dolor, tumor, and investigation, blood investigation, X-ray, USG, MRI, CT scan of the consent part can be taken. In the general management, where there is pus, they let it out. If it's localized, surgical management to drain and send the sample for pus CNS and suitable antibiotic. For non-localized, conservative treatment and suitable antibiotic can be given. Coming to the liver abscess, a liver abscess is a space-occupying suppuration lesion in the liver resulting from the invasion of microorganism entering directly from an injury through blood vessels or through the bile ducts. Generally, when bacteria or protozoa destroy the hepatic tissue, the cavity produced will be filled up with infected organisms or liquefied and leukocytes. The necrotic cells will fall off the cavity from the rest of the liver. Classification of the liver abscess: the pyogenic abscess, which is most common polymicrobial, accounts for 80%, and amoebic abscess due to intermediate histologic accounts for 20% of cases. General signs and symptoms: pain in the upper right part of the abdomen, just below the ribs, a cough or feeling tired and weak, fever and night sweats, nausea, vomiting, or loss of appetite, yellowing of the skin. Pyogenic liver abscess, male is to female ratio is 1:1, average age between 40 to 60 years. Coffer cells act as a filter for the clearance of microorganisms in the liver. These organisms reach the liver via bloodstreams, the biliary or by direct extension, and hampers the normal function of the liver. The most common infecting agents are E. coli and Klebsiella, Streptococcus faeces, and Proteus vulgaris, Staphylococcus, and Staphylococcus species. Etiology are like there are 6 etiologies like biliary causes, portal venous roots, and hepatic arterial causes, and traumatic causes, and direct extension, and cryptogenic abscesses. Signs and symptoms. Symptoms: there will be pain in the right hypochondrium, fever, chills, and sweating, nausea, vomiting, and anorexia, weight loss. In signs: hematomegaly, liver tenderness, splenomegaly, sepsis, and ascites. Investigation findings: in the laboratory investigation findings, there will be leukocytosis, hyperalbuminuria, LFT, there will be LP high, and bilirubin more than 2 gram per dl, and SGOT will be high. In the chest X-ray findings, there will be right lower lobe bacteriolysis and right pleural effusion, elevated right hemi diaphragm. In ultrasonography, abscess as small as 1 centimeter in diameter can be detected easily, can be guided needle aspiration after abscess can be done. These are the some images to show the USG of the pyogenic liver abscess. Then coming for the CT, computed tomography. Here sensitive 90 is more sensitive to 95 to 100% than in ultrasonography detecting the hepatic abscess. The double target sign and the cluster sign will be more evidently seen in the computed tomography. Here we can see you can appreciate the and this one. Treatment for the pyogenic liver abscess. Here antibiotics, aminoglycosides, clindamycin, ampicillin, vancomycin, metronidazole, third generation cephalosporins can be given, and percutaneous drainage where US guided and CT guided aspiration can be done, and or else when the more abscess is more, we can go for laparotomy, surgical method. Antibiotic therapy, the first choice is monotherapy with beta-lactam inhibitors such as piperacillin, tazobactam, and ticagrelor along with clavulanate, and third generation cephalosporin, that is ceftriaxone plus metronidazole. Along with that, we can also give ciprofloxacin or levofloxacin along with the metronidazole. Duration of the antibiotic therapy: if the abscess is single, then do need percutaneous or open surgically. If the multiple abscesses are there, then it will take around 6 to 8 weeks. Then percutaneous pigtail by using pigtail catheter we can drain this also. When to drain or not to drain: when it's more than 5 cm, single abscess, neither aspiration catheter. When it's more than 5 cm, catheter or surgery is indicated. Here are some images. Then prognosis: poor prognosis as a factor when the patient is more than 70 years, multiple abscess are there, pylomicrobial infection is there, presence of associated malignancy or immunosuppressive disease, or evidence of sepsis is there. Second one, amoebic abscess. It is also called as topical abscess or caused by due to entomoebic history. Raised portal vein, mesenteric lymphatics, and interperitoneal spirit. Incidence male is to female 10:1. Mode of transmission is to large intestine through portal vein. Pathology, as same explained in the this one. Here also after this, the entomoebic passing through after reaching the liver causes destruction of the hepatocyte, causing cytolytic enzyme and liquefaction necrosis, causing necrosis of the liver tissue, formation of anchovic ulcers. This is the anchovic process, which you can see. Here also signs and symptoms: symptomatic abdominal, thoracic, and due to complication, some symptoms we can see. Fever, chills, and all we can see. And the investigation, coming to investigation, increased WBC, altered abdomen, altered SCOT and SCPT, stool examination of overseas and can be seen. In USD abdomen, local site of obsession confirm the diagnosis, and chest X-ray, pleural effusion, CT scan. These are the findings we can see. These are some images to showing the amoebic liver abscess. Next slide, please. Okay. Coming to the discussion, whether there is a Rakta-Dushti Vikara caused due to the impairment of the thyroid surgeries undergoes rapid separation formation of fluid takes place. Sushruta, while explaining the symptoms of thyroid, mentioned about the Visheshana doshas and Tokmansa Rakta and Vedas. Satish, whereas the same pathology, hematogenous spread is the main source of infection in the abscess. Sushruta mentioned that symptoms of Abhantari should be understood as similar with those of Vahavidari by means of their Tokman process, but the Vasta Beda of Antarvidari is difficult to rule out practically. Antarvidari needs to be diagnosed and managed. Adveshta practice Vedanakarma and Panyakshara Prayoga and Seravedan Antarvedra as a measure in order to treat the disease with highlights the importance of Chikitsa. In liver abscess, the space occupying separate region in the liver resulting from the invasion mechanism entering the deadly from injury through blood vessels surrounding to the bile ducts. Advanced technology for diagnosing of liver abscess like USG, Kushta, and MRI CT practiced with the help of these tools. Ectotherapy can be made precisely on the evidence based on investigation, which may be helpful to correlate the liver abscess. Conclusion: in symptoms, Yukti of Vaidya has made to treat the patient by means of doshic predominance in the early stage and itself. Now, the modern era investigation made diagnosis easier. Pani XR plays a role in management of Abhyantara since Kara has properties like Agnidipana, Tridoshigna, Doshapachana, and Ropana. Eclipse is one among the Abhyantara and it can be managed with the Shastra Karma, where Beza and Slan are indicated in the management of Ayurveda. The main aim of treatment is adequate drainage and antibiotic regimen. Thank you.
Thank you, Dr. Anand. Thank you for the presentation. Next, I like to invite Dr. Maitreyi for the paper presentation. Dr. Maitreyi, are you there?
Yes, sir, I'm there, sir.
Good evening, doctor.
So, good evening, sir. Good evening, everyone. Myself, Maitreyi, final year PG from the Department of Shalyatantra. Now, here I'm here to present the case presentation. Can I share? Everyone can see my
Your screen is visible, doctor. Please
visible,
start the
right?
session.
Thank you.
Yes, doctor.
I'm going to present the case on the clinical case presentation of recurrent ear keloid treated with Vibhitaki Kshara Sutra and Ayurvedic approach. Introduction. Firstly, definition of the keloid. Keloids are abnormal fibrous growth resulting from an overproduction of the collagen during the wound healing. They often recur even after the surgical excision or corticosteroid injections like Kinocort injection. In the Ayurvedic point of view, such growths can be correlated with Vrana Granthi, where Kshara Sutra therapy is mentioned as minimally invasive and effective modality. In this case, we are using the Vibhitaki Kshara Sutra. This is case presents with the successful use of Vibhitaki Kshara Sutra in managing a recurrent keloid on the ear. Here, I have prepared the slide according to the IMRD side protocol. So next, coming to the methods. Patient data. A 25-year-old female presented with pain and swelling in a keloid on her left ear. She had a history of similar keloid 2 years prior, for which she underwent excision and injection therapy. However, recurrence occurred after the 2 years. On examination, the keloid was firm, mildly tender, and cosmetically distressing. Here you can see the image when the patient has approached us after informed consent. Vibhitaki Kshara Sutra was carefully transfixed through keloid mass, and the patient was monitored weekly. And along with that, internal Ayurvedic medications were administered to promote healing and to prevent further infection. This is prior to the application of the Kshara Sutra. On the operative procedure, like by injecting the LOX 2% at the for the base of the keloid, we have transfixed by giving a small incision. We have taken through a straight needle. We have put a Kshara Sutra. We have transfixed and ligated. In the first picture, we have transfixed, and the second picture, you can see the Kshara Sutra along with the keloid. This this image shows you have taken after the 3 days of after the application of the Kshara Sutra. First image. In the second image, after the 7 days after the application of the Kshara Sutra, and this image is around 10th day. The fourth image means the keloid or the growth has come out. This image was around 14th day. Here means Kshara Sutra will be having chemical cauterization. So in which it shows like a slow chemical cautery. So it gradually cuts and destroys the excessive fibrous tissue in the keloid, and along with the controlled tissue necrosis, and you can see the color change and tissue necrosis and fibrolysis has taken. Due to the scraping action of the Kshara, all the skin and it has reduced collagen and excess fibroblast activity has seen in this. Due to the anti-inflammatory and in Chara Sutra, which contains Haridra and other components, so further infection was prevented. In the Kshara Sutra also helpful in reducing the recurrence rate. Results: keloid mass shed off completely after the 14 days of Kshara Sutra application. Wound healed well without any signs of infection or recurrence during the follow-up period. Healing was attributed to specific properties of Vibhitaki due to its Kashaya Rasa, aiding in wound margin binding, and Vruksha Guna, which promoting to slough removal, and Madhura Vipaka, supporting the tissue regeneration, and Krimigna Guna prevents the infection. Additionally, Vibhitaki Kshara has a Shotahara, that is anti-inflammatory property. Vibhitaki lightly contributed to reducing the recurrence risk. Along with this, after the application of the Kshara Sutra, we have given prophylaxis antibiotic Taxim 200 mg after food 1 BD, tablet PAN 40 mg before food 1 OD, and tablet Zurolol P after food 1 TID, 1 BD for 3 days. Discussion in this case highlights the potential of Vibhitaki Kshara Sutra as a safe, minimally invasive, and effective alternative in treating the recurrent keloids. Its multifaceted pharmacological properties not only promote wound healing, but also it prevents the recurrence rate. Further studies with large sample size are needed to validate its efficacy in chronic and recurrent fibrotic conditions. Coming to the conclusion, Kshara Sutra, which offers minimally invasive and it's cost-effective, relatively safe approach for the management of keloids. Controlled chemical cauterization, that means the mode of action of the Kshara Sutra I have mentioned, like controlled chemical cauterization, gradual excision of abnormal fibrous tissue. So it helps in it helps to reduce the keloid bulk, and it also helps in reducing the recurrence rate. Additionally, due to its properties like anti-inflammatory, antimicrobial properties, wound healing properties, it is supportive to our face. Follow-up done and monitored for any chance of regrowth, but it was not there. Thank you. Thank you, sir.
Thank you, Dr. Maitri, for the valuable insights. Thank you so much, Doctor. We are aware that plastic use in daily life, especially in children's products, is concern about hidden health risks. The upcoming presentation will highlight how such exposures can be understood through the Ayurvedic concept of Dushisha. I would like to invite Dr. Pushpa H for the paper presentation.
Hello, sir. Am I audible, sir?
Audible, Doctor. Good evening, Doctor.
Very good evening, sir. Shall I share my PPT, sir?
Sure, Doctor. Please.
Yes, sir. We'll share. Sir, PPT is visible, sir?
No, Doctor, not visible.
One second, sir. Sir, now, sir?
No, Doctor, not visible, Doctor. Doctor, if you have any trouble, we will share for you, Doctor.
Sir, will you please share, sir?
Okay. Please start the session, Doctor.
Okay, sir. Om Shri Dhanvantari Namaha. Let us start the presentation with the blessings of Lord Dhanvantari. A very good evening to everyone. Here in the image, in the hands of a child, first previous child, in the hands of a child lies a bottle of care. In the hands of a child lies a bottle of care, but hidden within a silent threat may stare. Bright boxes that bring lunch and smiles, bright boxes that bring lunch and smiles could be carrying poison across the miles. Next slide, sir. It's what looks harmless and colorful in child's tiny hands may silently become a carrier of poison. Between innocence and illness lies an unseen enemy, that is plastic. So let's uncover the hidden dangers of daily use items in our children's world. So the title of my presentation is Plastic Perils in Pediatrics, Feeding Bottles and Lunch Boxes as Dushi Visha. Myself, Dr. Pushpa M. Rudragowda, Assistant Professor, Department of Dravya Guna. Coming to the introduction, next slide, sir. In Ayurvedic toxicology, Dushi Visha, it refers to a type of poison that is denatured, attenuated, or latent poison. Means a poison that is not immediately harmful but can remain dormant in the body, potentially causes delayed or cumulative health issues. In today's lifestyle, many materials which we use for childcare, especially plastic feeding bottles and lunch boxes, it can act as modern equivalents of Dushi Visha, which can subtly affecting the health and development of children. Next slide, sir. Dushivisha as per Ayurvedic insight, definition is Dushanam Shanai Shariram Gachati iti Dushivishaha. Means Dushivisha, it refers to latent poison, means those that persist in the body, become active under certain triggers like heat, indigestion or stress and affect dhatus over the time. Next slide, sir. These are the contents of these plastics, or it contains the toxic components like phthalates which link to hormone disruption and reproductive hormones in the baby's body, and it contains the BPA and BPS. These are the hormone disruptors which link to breast cancer, early puberty and infertility. Then apart from that, styrene, heavy metals like lead, cadmium and melamine is present in these plastics. Next slide, sir. Okay, now let us see what are the probable mode of action of these plastics in the child's body. By plastic usages like bottles, lunch boxes or toys, when heated or microwaved or reused often, it releases the chemicals like BPA, phthalate, styrene. These are microplastics and endocrine disrupting chemicals. So when it is ingested through milk or water or food which is stored in plastic, it can enter into the baby's body, most commonly ingested particles which can pass into the baby's intestine. So let us see at the action at the intestinal level. Microplastics and toxins bypass the intestinal barrier or affect its tight junctions, and they may disrupt the gut flora and trigger the low grade inflammation. And these toxins enter bloodstream from gut. So once it will enter into the bloodstream, these toxins, it will reach the cells. So now let us see at the cellular level what can happen. They cause oxidative stress. It can affect the mitochondria, the energy center of the cell, and it can disrupt the normal cell signaling and gene expression. So causes toxic effects in the body like hormonal imbalance, developmental delay, neurotoxicity and immunosuppression. These causes a long-term health risk like obesity, diabetes, learning disabilities, early puberty, etc. Next slide, sir. So let us see what are the symptoms which can manifest in the children. Chronic digestive issues, recurrent colds and allergies, constipation and ADHD like signs, delayed milestone, and sometimes rashes, eczema or urticaria. These are the symptoms which usually manifest in the children. Next slide, sir. Okay, and now the question arises, why children are more vulnerable? Because due to immature liver and kidney detox symptoms, because of higher metabolic rate, frequent use of plastic items, and greater absorption of lipophilic toxins. Next slide, sir. Okay, let us see what are the preventive measures for this. Instead of using the reuse old or colored plastics, we can go for glass or steel feeding bottles, and serve food in the stainless steel and should avoid heating plastic containers, and educate caregivers about the plastic toxicity. And we should not encourage to store milk or food long term in the plastic. And sometimes we can't ignore minor symptoms like poor appetite, and we should prefer the wooden toys and teethers, and should avoid plastic toys and teethers for babies. Next slide, sir. And for the remedial measures is we should use the detox practices like we should use the tikta rasa dravyas like guduchi, nimba, patola for cleansing. Panchakarma, especially Virechana and Vamana in older children, because it was Tikta Dravyas, which usually know it is best in detox and inflammation, and it is one kind of artificial poison. For it was mentioned in our classics like Garam Visham Virechana Sadhya Nirate Tataha, means the toxins from plastics or lipophilic. Which are usually stored in liver and fat tissue. These virechana, it will causes, it clears the ama and garavisha from gut liver axis. So it will enhances the agni and improves the skin health, hormonal balance and immune function. And Nasya I have told because it clears the head and upper channels, especially when plastics affect the brain or sinuses. The microplastics and BPA affect hypothalamus, pituitary or pineal glands. So these Nasya helps in detoxifies brain and sinuses. It balances Vata Pitta in Urdhva Jatru. It helps in symptoms like a disturbed sleep, behavioral issue, and allergic rhinitis. And apart from that, we can also support Rasayana supports like administer Chavanprash, Brahmi Gruta, Swarna Prashana for immunity and cognitive development. Next slide, sir. Coming to the discussion, plastic feeding bottles and feeding tools and boxes, although which is sterilized and labeled BPA free, they can still pose risks due to residual toxins or microplastics. So children are particularly vulnerable due to immature detoxification systems and rapid developmental phases. So early recognition and steps which we are taken for remedial protocol, which I have explained earlier, has done in such cases. Next slide, sir. Coming to the conclusion, from the Ayurvedic lenses, plastic feeding bottles and lunch boxes, it can fulfill the criteria of Dushi Visha, slow poisons that pollutes the child system over the time. So, a conscious return to natural, non-toxic material and Ayurvedic preventive care, which can protect the vulnerable pediatric population from the chronic disorders. Next slide, sir. So, finally, I would conclude my presentation with the saying, ditch the plastic today for a healthier child tomorrow. I would like to thank Adveshta 2025 for giving me an opportunity to present my topic over here. Thank you, sir. Thank you, one and all.
Thank you, Dr. Pushpa, for your clear, energetic, and highly informative presentation.
Thank you, sir.
Thank you so much, Doctor.
Okay, sir.
We now move forward with a paper presentation on bacterial toxicity through the lens of a Vishavaidya, followed by a poster presentation on the role of Visha in the manifestation of male infertility. Both highlight the relevance of Agatatantra in understanding modern toxicological challenges. I would like to invite Dr. Sheetal Raj for the paper and poster presentation. Good evening, Doctor.
Good evening, sir. Am I audible?
Yes, Doctor, audible.
Can you please share the slide?
Sure, Doctor. First, we go to the paper presentation.
Yeah.
Please start the session, Doctor.
Good evening, everyone. I am Dr. Sheetal Raj, Associate Professor from Enapai Ayurveda Medical College and Hospital, presenting before you bacterial toxicity through the lens of Vishavaidya. Every food we eat, every drink we consume, and every bit of air we breathe in contains the presence of thousands of bacteria. Most of them are harmless, but some of them are deleterious to health. Bacteria are minute organisms which can produce useful and harmful effect in our body. Those which are deleterious to our body can produce two types of toxins, exotoxin and enterotoxin. Exotoxins are toxins which are produced outside the body, and enterotoxins are toxins which are produced inside the body. The bacteria which can produce a toxin include Yersinia pestis, Bordella pertussis, Staphylococcus aureus, Staphylococcus perfringens, Clostridium tetani, Clostridium botulinum, etc. Moving on to the materials and methods. Sukshma Visha, a concept in Kriya Kaumudi, is studied in detail and is compared with the bacterial toxin, and Vilwadhyagada is analyzed to know its efficacy in bacterial toxin. Yersinia pestis is a bacterium which can cause a plague, which is a zoonotic disease that spread mostly from rats to human beings. In most of the cases, death in plague occurs due to ecchymosis and gangrene formation, and in other cases by toxemia. It can be considered as an exotoxin. Bordella pertussis causes a disease called whooping cough, which is a highly contagious respiratory infection in which a heat-stable enterotoxin is produced. Staphylococcus aureus produce enterotoxin, which causes toxic shock syndrome. And toxic shock syndrome is a condition in which toxins enter into the bloodstream by the use of tampons of a certain brand by menstruating women. Staphylococcus aureus can produce toxin type of food poisoning. This results from toxins produced by a multiplying organism that has gained access into the prepared food, which produce enterotoxin. Clostridium perfringens is a bacterium that causes gas gangrene, and this is an illness produced by myonecrosis of previously healthy skeletal muscles due to elaboration of myotoxins. This is a gangrene which is formed when an open wound is exposed to the bacteria, which produce an enterotoxin called the alpha toxin by the muscles. Clostridial perfringens can also produce clostridial food poisoning, especially when undernourished children who suddenly indulge in overeating of contaminated meat that produce alpha enterotoxins in stomach. Clostridial perfringens also leads to necrosis, enterocolitis, previous slide itself, in infants by the beta enterotoxin produced by the bacteria. Clostridium tetani causes tetanus or lockjaw, which is a severe acute neurological syndrome caused by tetanus toxin. Tetanospasmin, which is a neurotoxin and exotoxin elaborated by the bacteria. And Clostridium botulinum is a bacterium that causes a food poisoning called botulism, caused by the ingestion of preformed botulinum toxin, which is an exotoxin, into served food. Moving on to krimi, bacteria can be considered as a Shonidaja Purushaja krimi, which is very minute or sukshma in nature. The toxin generated by it can be considered as sukshma, that is Sukshma Visha, which is a concept from Kriya Kaumudi. According to Kriya Kaumudi, a Malayalam textbook on Visha Chikitsa, Visha is classified as Stula Visha and Sukshma Visha. Stula Visha is subclassified into Stavara and Jangama Visha, and the Sukshma Visha is classified on the basis of route of administration into Halahalam, Kalakodam, Kakolam, Garam, and Visham. Halahalam is a toxin which reaches the body through sound and air. Kagolam reaches the body through water, food, wound, or ulcer. And Kalagodam is spread through waves or rays. Gera through all the 9 orifices, and Visha through bites, injection, or through an orifice. A mature, next slide please. Manifestation of diseases by bacteria. A mature immune cell figures out body's own cell from a foreign body, and when thymus shrinks in response to toxin exposure, there is diminished production of T regulatory cells, which has an important role in regulating the immune system. If the thymus shrinks and T regulatory cells gets diminished, there is greater potential for immune dysfunction. Next slide. Vilwadhyagada is a classical antitoxic formulation which is indicated in all types of toxins and also in diseases like Vishujika, Ajirna, Jwara, etc. It can be used both by the deceased and healthy person. It is used in different forms like Anjana, Pana, Nasya, and is widely used for Aleba. And this formulation contains the ingredients like the Villamoola, Tulsi Pushpa, Karanja Phala, Tagara, Rasna, Haridagi, Vibhidagi, Amlaki, Shundi Pipale Maricha, Haridra, Dari Haridra, which are triturated and made fine with the goat's urine. Among these ingredients, Tulasi, Karanja, Marija, Haridra, Devadaru, and Haridagi are Krimihara, which can be considered as antimicrobial. Drugs like Haridagi, Amalagi, Pippali are Rasayana, which can be considered as immune boosters. Moving on to the discussion, Kalakotam of a Sukshma Visha can be considered as a bacterial toxin, since both bacteria and Kalakotam enters into the body mostly through food, water, ulcers, or wound. Moreover, both are minute in nature, and bacterial toxins are produced by bacteria, and Kalagoda is a type of Sushma Visha. Certain ingredients of the antitoxic formulation Vilvadyagada are Krimihara, which is antimicrobial, and certain drugs are Rasayana, which are considered as immune boosters. Bacterial toxins can lead to immune dysfunction, so it is thought to be beneficial in this perspective too. Conclusion: all Agadas are by default Rasayana, as they are Ojavarthaga, and Ojas can be considered as immune boosters. So it is imperative to use Vilvadi Agada in bacterial toxin, which can act as antitoxic, antimicrobial, and immune boosters. Several studies were carried out to know the presence of toxins in human infection. Similarly, the role of Vilvadi Agada in different bacterial toxins need to be analyzed properly. Future efforts should concentrate in the development of in vitro and in vivo studies in this frame of reference. This is all I have to share with you. Thank you.
Thank you, doctor. Next we go to the poster presentation.
Yes.
Just a moment, doctor. I will share the screen. And please start the session, doctor.
Yes. So continuing with my poster presentation on the title, Role of Visha in the Manifestation of Male Infertility. Visha Chikitsa is one among the Ashtangas of Ayurveda, which deals with the different types of poison, its diagnosis and treatment. Dushi Visha is a poison which is either devoid of all 10 gunas, or the poison which is present with the 10 gunas but is devoid of the actual potency. Here the Kapha reduces the virya of gunas, and because of Kaphavarana, the digestion is impaired, which makes the poison to stay in the body for years together. This shows the cumulative effect of poison, that is, poison in low dose get accumulated in the body and produce its action in the form of diseases. These diseases include Shabech Shukram, which means oligospermia, and Dadu Prabhavan Vikaran, which means vitiation of Dadu, and vitiation of Shukra Dadu leads to infertility. Shukra Sanshaya, which means oligospermia, is considered as one of the complications of this issue. Endocrine toxicity results when a chemical interferes with the synthesis, secretion, transport, and metabolism, binding action, or elimination of poison, which is necessary for endocrine function, resulting in loss of normal tissue function, development, growth, or reproduction. These chemicals are called endocrine disrupting chemicals, EDC, and it includes various pesticides like endosulfan and DDT, polychlorinated biphenyls seen in e-waste, bisphenol A, that is BPA, and phthalates, which are seen in plastics, flame retardants, which are seen in furniture and fruits. Failure to achieve consumption by a couple of mature age having normal coitus during appropriate period of menstrual cycle regularly at least for 1 year is termed as infertility. Endocrine system is closely related to male reproductive system. And testicular dystenosis syndrome, which occurs as a result of gonadal development disruption during fetal life, is mainly due to adverse environmental exposure like exposure to EDC. Endocrine disruptors effect on male individuals include compromised development of androgen-dependent sex organs due to impaired testosterone production, as well as disruption of sperm motility and fertilizing ability at adulthood. Dichloroethane, that is DDE, is a potent androgen and decreases testosterone, but also can accumulate in the testis, impairing spermatogenic epithelium in humans. Lindane increases FSH, LH, and decreases testosterone, but also can accumulate in the testis, impairing germinal epithelium and Sertoli function. Exposure to environmental estrogens increase the risk of prostate cancer, and phthalates reduces testosterone, causing hypospadiasis and agenesis of epididymis and testicular atrophy. Prenatal or early life exposure to EDCs like phthalates, BPA, perfluorinated compound may negatively affect immune system development, resulting in type 1 diabetes, and sexual dysfunction in all its form is an accompanying phenomenon of diabetic disease. EDC interfere with the thyroid hormone function at different levels like thyroid hormone production, its transfer, bioavailability, and metabolism. It leads to many symptoms of infertility like decreased sperm count, decreased sperm volume, delayed ejaculation, decreased sperm motility, erectile dysfunction, etc. The concept of Dushi Visha is very similar to endocrine toxicity. Both of them are artificial poison. They act as slow poison. EDC, after entering the body, especially during the developmental period, gets accumulated and affect the target tissue to produce infertility later in life. EDC can function at a very low dose in tissue-specific manner, and Dushi Visha, after remaining in the body for a longer period of time, vitiate the dhatu and leads to the manifestation of infertility. Both endocrine toxicity and Dushi Visha are produced as a result of environmental impact, which results in infertility. Based on the innumerable studies which are carried out during the past few decades, it is found that infertility is a disease which occurs not only due to genetic factor, but also due to environmental impact. This is all I have to share with you. Thank you.
Thank you, Dr. Sheetal Raj. Thank you for your energetic and clear presentation. And your points were conveyed in a simple and impactful way. Thank you so much, Doctor.
Thank you, sir.
Next, we go to the another presentation. We know that in Ayurveda, Rakta has been given unique importance, sometimes even considered as the fourth dosha. The upcoming presentation will explore its significance and deeper clinical understanding. I would like to invite Dr. Jambavati for the paper presentation.
Hello, sir.
Good evening, Doctor.
Good evening. Whether my screen is visible, sir?
Yes, Doctor, screen is visible. Please start the session, Doctor.
Okay. So today, myself, Dr. Jambavati, from the Department of Shalyatantra. Today, I am going to present on the topic Rakta, the fourth dosha, exploring its significance in Ayurveda. Rakta, we all know that Rakta is the second among the 7 dhatus mentioned in Ayurveda. And Utpatti of Rakta will take place in Yakrit Pliha by the Ranjaka Pitta. Even according to modern, blood is a connective tissue, okay, and it is considered as fluid of life because it carries oxygen from lungs to all parts of the body. Also, it helps in expelling the carbon dioxide from all parts of the body to the lungs. Rakta is considered as Chaturtha dosha according to Acharya Sushruta. In this presentation, and understanding the implication of Rakta as Chaturtha dosha is explored. Nirukti of Rakta. Rakta is derived from the Sanskrit term Ranj Dhatu, that is Ranjate Angam Anena iti, which means which imparts color to the body. Pramana of the Rakta is 8 Anjali, and origin of the Rakta takes place from Yakrit and Pliha, and Upadhatu of Rakta is Sira and Kandara, and Mala of the Rakta is Pitta. There are many functions attributed to Rakta, that is, it nourishes Mamsa Dhatu, it is one among the Dasha Prana Ayatana, it is one among the Sapta Kala, it is one among the Srotas, it is Matruja Bhava, it is also responsible for the formation of organs, that is Shonitaja, Yakrit and Pliha, Shonita Fena Prabhava, we get Pupusa, Shonita Kitta Prabhava Unduka, and in Marmagata, Adhika Rakta Srava will lead to Marana. Importance of Rakta. We get a shloka in the Sushruta which quotes that Dehasya Rudiram Moolam Rudirenaiva Dharyate Tasmat Yatnena Samraksha Raktam Jiva iti sthiti. Here, in this shloka, Acharya is telling Moola of the Deha itself is Rudira or Rakta. From Rakta only Dharana of the whole Deha will occur, and Rakta is called as Jiva. And one more beauty of Rakta is that all the Panchabhautika elements can be attributed to the properties of Rakta. That is, Visrata to Prithvi Mahabhuta, Dravata to Jala Mahabhuta, Raga to Agni Mahabhuta, Spandana to Vayu Mahabhuta, Laguta to Akasha Mahabhuta. And one more quotation we get which explains the importance of Rakta. Tesham Kshayaruddhi Shonita Nimitte. Here Tesham Acharya is referring to the dhatus. That means the increase and decrease of all the dhatus takes place because of the Rakta. And one more reference, Acharya is directly telling that तदेभिरिव चोणितचतुर्थैः संभव स्थिति प्रलयेषु अपि विहरितं शरीरं भवति. That is, for Sambhava, Sthiti and Pralaya, Rakta is responsible and Rakta should be considered as fourth dosha. In this regard, various points we have to take into consideration to understand whether Rakta is fourth dosha. Few of the points which are telling Rakta as fourth dosha are, most of them are references from Sushruta Samhita itself. Acharya Sushruta tells in all the type of diseases, he will get Raktaja variety. That is, we get the reference of Raktaja Vranashofa, Raktaja Vidradi. So, Rakta is given importance is equivalent to other doshas. And another quotation I already quoted, that is Kshaya Vritti Shonita Nimitte. That also gives the importance to Rakta. And we know that Acharya Sushruta will tell about the Pancha Shodhanas, where Rakta Mokshana is considered as one among the Pancha Shodhanas. And Siraveda is considered as Ardha Chikitsa and Purna Chikitsa, just like how Basti is considered as Ardha Chikitsa in Kaya Chikitsa. In Sushruta Sutra 21, in Vrana Prashna Adhyaya, he will tell about the Utpatti, Sthiti, Pralaya for Vata, Pitta, Kapha and also for the Rakta. In the same chapter, in the context of Kriya Kala, Acharya is also explaining 15 types of prasara in which Rakta is included. And then Sthana, Guna, Karma, Karana, Dosha Vruddhi, Dosha Karaka Bhava, Vikara, Chikitsa of Rakta is well explained in the Samhitas. And of course, we get the quotation. Dehasya rudiram moolam rudirenaiva dharyate tasmat yatnena samraksha raktam jiva iti sthiti. Which are the points which are against for considering Rakta as fourth doshas are? Rakta can get vitiated by the other doshas. So that is one thing. Another one, there is no concept of Raktaja Prakriti. And then in the same chapter itself, that is Sushruta Sutra 21, we get for Vata Vagati Gandanayoho, Pitta Tapasantape, for Kapha Shlishalingane, but we don't get any Nirukti for Rakta dosha. And then by all the acharyas, other acharyas, well, they are telling about the sthana of doshas. That is for Vata Shroni Guda, Pitta Ama Pakvashaya Madhya, Kapha Amashaya. We don't get the reference of Rakta. And then certain properties, like for Vata, it is attributed to Anila, Pitta for Surya, Kapha for Soma. We don't get the reference of Kapha, Rakta here. Tristuna in Ayurveda is Vata, Pitta, Kapha. Rakta is not included here. Only Acharya Sushruta is giving importance for Rakta. Other Acharyas like Acharya Charaka, Acharya Vagbhata, Sharangadhara, nowhere they have considered Rakta as dosha. And then in context of Triguna also, Rajo Bahulyo Vayu, Tamo Bahulyo Kapha, Sattva Bahulyo Pitta, here also Rakta is not considered. And we don't get any reference in regarding to Agni or Kushta. Only we get its reference in respect to Tridoshas. Nowhere Raktaja, Agni or Kushta, that is never mentioned. And we all know Vata Pitta Shleshmana Eva Deha Sambhava Hetaha. So by these quotations, we can understand that Rakta cannot be considered as fourth dosha. And in the modern, if we take, they will tell for Rakta many functions such as respiration, nutrition, transportation of waste products, transportation of heat, acid-base balance, water balance, thermoregulation, immunity, transport of hormones like vitamins, hemocoagulation, everything is attributed to function of the blood. So now how to understand whether Rakta should be considered as dosha or not? So Arunadatta in the commentary he will tell, even though Rakta has been given Moolasthana, Guna, Karma, Vruddhikshaya, Dushtikarana, Lakshana and Chikitsa, there is nothing called as Raktaja Prakriti or Raktaja Jvara. And Tridosha we know that early morning Kapha, in midday Pitta, and towards the evening Vata will get vitiated, but Rakta involvement is not seen. So how to understand this is like Krita Nadi Nyaya. Whenever Grita is burning, it is due to the Ushna Guna of Agni present in the Gruta, not Gruta itself. In the similar way, Vagbhata gives that is Ashrayi Bhava between Pitta and Rakta. So conclusion is Raktam Jiva iti sthiti, Acharya rightly quoted. That means in one single shloka, all the modern functions, whatever attributed to the blood, everything the Acharyas are having the knowledge. So in one single line, Jiva, they have quoted, understanding, attributing all the functions of the Rakta. So whether Rakta is fourth dosha or not, Rakta cannot be considered as dosha. But why Acharya told then it is fourth dosha? we have to understand that Rakta is having so much importance that it cannot be considered as dosha, but Rakta is given as importance equivalent to the doshas. Hence, they have quoted Chaturtha dosha of the Rakta. Thank you.
Thank you, Dr. Nimbavali. Thank you for presenting the topic with such clarity and depth. And your detailed explanation was truly commendable, Doctor. Thank you so much. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Onkar Deshram Jadhav for the paper presentation. Dr. Onkar, are you there? Dr. Onkar, are you there? Next, we go to the another paper presentation. I would like to invite Dr. Adulya PK for the paper presentation related to Grihani Dosha. I would like to invite Dr. Adulya.
Good evening, everyone. I'm Dr. Atulya PK, Assistant Professor, Department of Prabandhana at Ayurveda Medical College, Bangalore. Today, I be presenting a topic on contemporary scientific evaluation of Grahini dosha. These are the contents of my presentation. Grahini is the seat of Agni. Grahini dosha shabdena, Grahanyashrito Agni dosha iti grahyate. So, Grahini is the seat of Agni, which is responsible for digestion as well as assimilation. Its dysfunction leads to Grahini dosha, which is characterized by irregular digestion and digestive stool, as well as loss of strength. This can be correlated with malabsorption syndrome, irritable bowel syndrome, chronic diarrhea, as well as celiac disease, depending upon the presenting complaints. Roga sarveapi mandeyagno. Almost all diseases are caused by Agni Dishti. Agni is supported by all the three doshas, Vata, Pitta, as well as Kapha. Here, Pachaka Pitta stimulates Agni, whereas it's Clearal Kapha that decreases the intensity of Agni. Samanavata makes sure that Agni is regulated and optimized well. The enteric nervous system, often referred to as the second brain, is a vast network of neurons embedded in the lining of the gastrointestinal tract. It generally operates independently, but it also communicates with the central nervous system. There is a very clear relationship between Samanavata as well as enteric nervous system. The functions of Samanavata include Sannam Grihnati, Pachati, Vivechati, as well as Munchati. Here, the functions of enteric nervous system also includes it will hold the food till it gets digested as well as propelled out. And it will also make sure that the biochemical environment is maintained clearly. That is by keeping the pH as well as chemical composition needed for the digestive enzymes to work properly. Absorption, elimination, all these belongs to the functions of enteric nervous system. And there is a relation between Pachaka Pitta as well as digestive factors. Pachityanam and Sarakita Vibhajana is holding as the function of Pachaka Pitta. So what happens is the digestive hormones, enzymes and secretions will convert the macro particles, which are macro particles which will be converted into micro, which will be facilitating in the absorption and assimilation to occur properly. And then Kleber kapha has a direct link with the mucus that is present. Annasangata as well as Kledana is the function of Kleber kapha here. So what happens is the immune cells that is embedded in the mucous membrane will secrete the histamine and it will lubricate the wound. So that is how Pachaka Pitta, Kleber kapha as well as Samanavata is related to enteric nervous system, digestive factor, as well as mucus. So this Agni that is supported by all these three doshas, it needs to be in the optimal level to make sure the digestion is taking place properly. There are mainly three types of Agni Dushti or dosha as which are Vishamagni, Tikshagni as well as Mandagni depending upon the involved dosha that is present. So what happens in Vishamagni is there will be Vata dominance here, which will lead to the altered functioning of enteric nervous system. Hence, since the function is altered, there may not be proper functioning. So, stasis of food will be there, as a result of which there may be Jatra Gaurava as well as Atmana. And since it is stasis is taking place here, the body will try to forcefully remove it with the help of forceful contractions of muscles of the gut. As a result of which, there may be Shula, Udhavarta as well as Andhra Puja. Since the gut motility is altered here, as a result of this, Atisara and Pravahana may be present in the patient. What happens when the patient is having Tikshnagni is Tikshnagni occurring as a result of Pitta predominance here. So there will be hyperactivity of secretory glands concerned with the digestion. There may be Pakante, Galadalva, and Oshtashosha and Daha, which can occur as a reflex of hypersecretion. As a result of hypersecretion, there can be Shosha as well as Daha. And since there is an increased metabolic rate, Santapa may also be seen in the patient. In case of Mandagni, which is of kapha dominance, excessive mucus secretion as well as histamine production will be taking place, as a result of which malfunctioning of GIT, that is gastrointestinal tract, will be taking place. Hence, the patient may have Udara Gaurava, Shiro Gaurava. Since the GIT is malfunctioning, there may be malnourishment, which can lead to Gatra Sadhana. And then excessive histamine production will be there, as a result of which Kasa, Shwasa, Prasega, as well as Chakti will be seen in the patient. So, to conclude, Vata, Pitta, and Kapha has got pivotal role in the physiological as well as pathological state of Agni. The disturbance in the equilibrium of Vata, Pitta, and Kapha results in altered nervous stimulation, digestive as well as mucosal secretions, and this results in Agni Dushti, leading to the pathogenesis of spectrum of diseases related to Grahani. The presence of optimized Agni doesn't allow the formation of ama, stasis of food, or accumulation of end product. Agni not only digests but also metabolizes, converts, or transforms, and thus helps in the excretion aspect as well. Therefore, irrespective of the presentation, one should start treatment by correcting Agni and by observing the following points, which is Udgari Shuddhi, Utsaha, Vegotsarga on time. Thank you.
Thank you, Doctor. Thank you for the well explained and wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Aishwarya Hemant for the poster presentation. I would like to invite Dr. Aishwarya for the poster presentation.
Okay, good evening everyone. Myself Dr. Aishwarya Kagat. My poster name is Garbhasandha Samak. Introduction. तुम्हां चतुर्मन समितेतम गर्भजाते विधिपूर्वकम ऋतुक्षेत्रामध्ये जाना सानुग्रहण करो यथा. Need of study. Increasing infertility in modern purpose lifestyle diet mental stress affecting conception. Need for best traditional Ayurvedic wisdom with modern reproductive science for preventive and promotive healthcare. Importance of creating awareness about preconception health for the progeny. Maternal method, Ayurveda classical tests, Sanhitas, modern literatures, books. Neither regular devoted, observe attention, keep the reproductive track, positive tested, Panchakarma yoga meditation. Don'ts. Incompatible for mental stress, exposure to toxin, late marriages, smoking, alcohol. Nothing. Discussion. I read the text of a very systematic description about the concept of Gurupasandha Samagri. These are very essential for conception and ultimately the better upstream. All the people responsible for infertility discovery in modern science can be included in this factors. So the concept of Gurupasandha Samagri is just further to bring healthy upstream into the society. Conclusion. Gurupasandha Samagri provide a holistic framework for the healthy conception. This study demonstrates the relevance of Gurupasandha Samagri in promoting the healthy fetal development emphasizing the need of holistic prenatal care, future research can explore its application in modern healthcare, integrating traditional knowledge with contemporary medical practice. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, I would like to invite Dr. Komal Jaising Deshmukh for the paper presentation. I would like to invite Dr. Komal Deshmukh for the paper presentation.
Myself, PG second year Shiltani department from late Kedai Redikar, Ayurveda Mahabharata, Gadimits. My guidance, Dr. Harimkar sir. My topic for case presentation is Efficacy of Durga Tail picture on the pain management of post-op pericarditis patients with special reference to fisher and eye. Introduction. Time is a great healer, but it is equally important and true that without proper and complicated and fast resolution, the art of surgery remains incomplete. In Ayurveda, pericarditis can be defined as a condition with Tigrashul, Daha, Vibandha, Sapikshastra, that is bloody mucous discharge, Rucha, and Aruchi. This is the patient information. This is the table showing 5 post-operative patients of anal fissures, underwent revascularization or lateral internal splenectomy. This table shows the 5 patients which got trial on assessment of pain. Reading scale 0 means no pain, 1 means mild pain, which analyze interfering in daily activity, which leads to 1 year after application. And second means 2 means moderate pain, interferes significantly with regular activities, which lasts for 1 to 3 years. And third is severe pain, unable to perform daily activities for more than 3 years. These are the clinical findings which I found after the trial. These are the 5 patients and their present complaints, the duration of illness, and the pain score they were. Now we will see the post-operative pain timeline and Durga tail picture therapy. Patient observed after complete elimination of anesthesia after 4th hour, then 8th hour, then 3rd day, and the 8th day. Now the diagnostic assessment, we have calculated the mean and the standard deviation. The diagnostic challenge was that no advanced imaging needed. Diagnosis lastly was clinically. Prognosis is short-term prognosis excellent. All patients responded well to Durvatal physiotherapy within 7 days. Long-term outlook, no sense of recurrence, chronic complication observed during following up to 7 days. Patient is advised on diet, hydration, and bowel habits to prevent recurrence. Now the therapeutic intervention. Physiotherapy, we use sterile cotton or gauze. It's soaked and we live from Durvatel. Apply locally to the anal region, post 6 hours, retain place for 1 to 30 minutes, dry steady, and it was continued for 7 days post op surgery. And the supported meals were set by preferable orally, to fill a powder at night, Patya dietary regimen. Another component, dietary modifications were helped in warm like easily covered spicy dry and fat food. The patients to have 2.5 to 3 liter daily. Next advice was to have regular bowel habits, avoid long sitting or strained notification. Follow-up and outcomes. Effective clinical response observed, it reduced pain, significant decrease in VS scores, healthy wounded, no infection observed, identification. The quantitative findings of pain significantly decreased over time after solvation. Statistical analysis showed p-value less than 0.05 straws and indicating that the pain reduction over time is statistically significant. The overall follow-up summary was patients improved steadily post-surgery, was reported complete and near complete relief by day 7, enhanced quality of life, better sleep, reduced anxiety, and improved the control. Now discussion. Discussion of the strength and limitations. Reducing Shastrapathanti Vedna, where Sakshma and Sopagami nature, exerting Vedna Sthapan and running property which directly acts on nerves and energy. Reduction in pain support the reproducibility. Conventional treatments like topical aesthetics of the outcome of pain relief. And the conclusion is that the study concluded that Durvatal pitch application can be a better alternative in pericarditis. These are the references. Thank you so much.
Thank you, Doctor. Thank you for the insightful presentation. Next, I would like to invite Dr. Purva Kulkarni for the paper presentation on the topic Eshtigrita Piju in Management of Pitta Jivani Vyapat. I would like to invite Dr. Purva Kulkarni.
Good evening, everyone. Today I'll be presenting my clinical study on Yashti Pichu in the management of the worker. This work is Professor and HOD, Department of Prasuti Tantra and Siroga at Healthcare Health College, Carinias. Pittashani Vapor is a common gynecological condition described in Ayurveda. It presents with symptoms like burning sensation or daha, itching, redness, pain during intercourse, and abnormal vaginal discharge. When we correlate these symptoms with modern gynecology, they closely resemble with vulvovaginitis. Our classical Ayurvedic texts emphasize local therapy for such disorders. In this study, I have used Yashti Pichu. Yashti Madhu has Madhur Rasa, Shita Virya, while Gulta is an ideal Snehadravya. So together they possess Pitta Shama, Ranarupa, and Shuddhavira properties, making them very suitable for this condition. Next. The primary objective was to evaluate the efficacy of Yashtigrutha in Pitta Joni Vapor. This was an open label, prospective, observational study conducted on overall 30 patients, out of which 28 completed the study. The inclusion criteria were women aged 18 to 45 years with classical features of Pitta Joni Vapor, such as burning, vaginal pain, pricking sensation, or abnormal discharge. He excluded pregnant women, menopausal women, patients with systemic disease, and those with sexually transmitted diseases. Now, the preparation of Yashtigrutha, it was prepared by classical Snehapak Vidhi. Yashtimadu root powder was processed with cow's ghee and water for decoction. The preparation was tested for classical parameters like odor, color, and consistency, which found to be characteristic and suitable. Now, the Pichu Dharana procedure, sterile cotton swab were dipped in lukewarm Yashtigrutha and then placed intravaginally in dorsal lithotomy position. The Pichu was retained for 4 to 6 hours and treatment was given once daily for 7 to 14 days, depending on the severity of symptoms. Now, the patients were assessed before treatment, after 7 days, and after 14 days. The symptoms were graded like burning sensation, vaginal pain using the VAS scale, pricking sensation, and abnormal discharge assessed for quality and quantity. The results were very encouraging. By day 14, there was almost 65 to 80% overall symptom relief across all the parameters. Patients reported marked reduction in burning pain and discharge. Importantly, there was no adverse effect reported. So, how does Yashtigrowth exactly work? Yashtimadu has Madhur Rasa and Shitavirya, which pacifies aggravated pitta. Its ingredients like glycyrrhizin and flavonoids have proven anti-inflammatory properties. Cruta act as a vehicle with mucoadhesive properties, ensuring better absorption and local healing. So together, they reduce inflammation, heal mucosal lesions, and restores the vaginal lymph. Now, in modern gynecology, we usually prescribe antifungals, antibiotics, or corticosteroids. While effective, they often disturb the vaginal flora, carry the risk of resistance, and symptoms may recur. So, in contrast, Yashtivrut addresses the root cause by balancing the Pitta dosha. It has natural healing action also, and it doesn't disturb the vaginal flora. So, this makes it safer and long term option. Of course, this was a primary study. For longer evidence, we need larger randomized controlled trials. The histopathological studies are also needed. Microbial culture analysis and long term follow ups are very important. So, the limitations of my study includes the small sample size and short follow up period. But all in all, to conclude, the Yashchitra Pichu demonstrated significant efficacy in Pitta Joni weapon, giving 65 to 80% symptomatic relief without side effects. So it is safe, simple, and cost effective therapy. It can be easily integrated into gynecological practice either as an adjuvant therapy or an alternative treatment, especially in patient with recurrent symptoms or intolerance to modern drugs. Thank you.
Thank you, doctor. Thank you for the very clear presentation. Next, we go to the another paper presentation. I would like to invite Dr. S. Prarthana for the paper presentation. Good evening, doctor.
Good evening. I'm sharing my screen.
Okay, doctor. Your screen is visible, doctor. Please start the session.
Good evening to one and all. Myself, Dr. S. Prarthana, final year PG scholar in the Department of PG and PhD Studies in Shalyatantra, JSS AMC Mysuru. Today I am presenting on the topic of the management of rectovaginal fistula through an Ayurvedic surgical approach, transrectal approach, and posterior vaginal wall repair, followed by Ksharasutra ligation, a clinical study guided by Dr. Siddhaya Aradhyamat, Professor and HOD at Department of PG and PhD Studies in Shalyatantra, JSS AMC Mysuru. So these are the contents of my presentation. So introduction. So what is rectovaginal fistula? It is an abnormal communicating tract line between an unhealthy granulation tissue between rectum and vagina. It is a very rare condition with an incidence of 0.3 to 2%, and it is very complicated. It's uncommon but resulted due to the trauma, inflammatory disease, surgical event, and radiation, etc. So having a significant morbidity and have high risk of proctectomy. So Acharya Shushruta quoted Bagandhara as one among the Ashtamahagada, which is difficult to cure. Among all types of Bagandhara, rectovaginal fistula can be correlated to Unmarki Bagandhara. So how it can be compared as fistula is defined as an abnormal connection between two hollow spaces, that is in between intestine, vagina, bladder and skin. So our Acharya Shushruta have been mentioned same like as Tetu Bhaga Guda Basti Pradesha Dharanascha. So which can be correlated as fistula. So coming to the rectovaginal fistula, it is a abnormal communicating between a rectum and vagina, mainly resulted due to the trauma, inflammatory disease, surgical event, and radiation. As Unmargi Bagandhara is one among the Agantuja Bagandhara, so it is mainly due to the Kshata. So results to the resulting in Puya Rudira, Srava as well as Krimi, Vata, Mudra, Purisha, Reta. So coming to the general management in general, that is managed through conservative as well as surgical intervention. Conservative treatment mainly to treat infection, associated symptoms like UTI, local irritation, as well as site infection. So coming to mainly to treat the cause like a Crohn's disease, diverticulitis, and other inflammatory conditions. Non-operative measures in the case of high-risk patients who are unfit for surgery and failed prior surgical attempts by using fibrin glue and occlusive material. Coming to the surgical intervention, it depends upon the complexity recurrent of the disease. Approaches like draining set-on, perineal approach, and laparotomy. The techniques like flap procedure, gracilis, regional myocutaneous flaps are in use. Okay. So coming to the patient medical history. So a disoriented 50 years old female with a known case of type 2 diabetes, hypertension, hypothyroidism, and had a recent seizure attack came up with the complaints to our OPD with the complaints of bleeding per rectum and blood mixed stools passing through vaginal route since 10 days, which was informed by an attender. Hence, they approached to our hospital for further management. So coming to the patient general examination, like systemic examination, patient was conscious but disoriented with the time, place, person with GC score of E4, B3, M3. Other systemic like CVS and RS was no abnormal detected. So coming to the non-local examination, in perianal region, on inspection, there was an external opening seen at the posterior vaginal wall and along with the mucosal skin tag seen at the external opening. There was no evidence of scar and sentinel tag. So coming to the pervaginal examination, external opening which was felt at the posterior wall of vagina along with the induration and mucosal tag. Coming to the distal rectal examination, the sphincter tone was normal. Tenderness was present at the anterior wall of the anal canal and posterior vaginal wall. Discharge was present along with the stools, and there was no evidence of polyp and growth as well as ulcer. On proctoscopy examination, there was an internal opening at anterior wall, that is 12 o'clock, and there is no evidence of polyp and growth. So coming to the investigation, there was no such raised limits in the investigation. But coming to the CT scan abdominal pelvis, there was a suspicious fistular tract communicating in between the vagina and rectum. And there was a mild circumferential wall thickening of rectum, which was likely to inflammatory. So to rule out the cause, we have did the sigmoidoscopy. We are advised to go on to undergo sigmoidoscopy. There was rectovaginal fistula along with the stercoreal ulcers. So coming to the differential diagnosis, as per the patient's complaints and investigation, we were diagnosed as rectovaginal fistula, which can be differentiated by blunt vaginal trauma, diverticulitis, enterovesical fistula, inflammatory bowel disease. The treatment which we adopted as transrectal approach with posterior vaginal wall repair followed by Ksarasutta ligation. So coming to the operative procedure, pre-operative procedure, the informed and written consent for surgical procedure and spinal anesthesia was taken. Patient was advised for NBM for 6 hours and prophylaxis like TT and was given, and injection xylocaine test dose was given. Proctoclysis enema given for a bowel preparation and followed by part preparation was done. Coming to the main procedure, under spinal anesthesia, patient was positioned in lithotomy. Under aseptic precaution, part was painted and draped. Lord's forefinger dilatation was achieved, and rectal plug with a gauze was placed and with a stay. Antegrade probing from internal opening, that is from anterior rectal wall, was done, followed by set-on placement for appropriate remnant drainage of contents. After draining, set-on was removed. Then after labia majora was retracted for well exposing the posterior vaginal wall. Then skin tag at the posterior vaginal wall was excised and partial fistulectomy followed by debridement was done, and suturing was done at the external opening with absorbable sutures, that is Vicryl 20. Then tract diversion 5 cm was done on antegrade probing from anterior rectal wall and ramification was defined. Then incision was taken at 1 o'clock from the external opening, followed by barber thread ligation. Then tract was irrigated with a betadine and normal saline. Then Lenin thread was replaced by Sharasutra by railroad method. Hemostasis was achieved. Anal packing with Mahanarayana Thaila was done. Patient was catheterized and shifted to post-operative ward. Coming to the post-operative care, post-operative NBM was advised for 6 hours. Foot and elevation was done for 6 hours. Anal pack was removed. There was no evidence of bleeding. So then after patient was administered by an attendant with a sips of water followed by liquid diet after appreciating the bowel sounds. The patient was ambulated by an attendant done after 6 hours. The fluid management was maintained. So this is the steps which was done. Before OT, there was rectal opening at and posterior vaginal wall with mucosal tag. And during operative procedure, first we defined the extension of fistula tract from the anterior rectal wall to the posterior vaginal wall. Then after the labia majora was retracted for exposing the external opening. Then coming to the then a mucosal excision of mucosal tag was done. Then after posterior vaginal wall repair was done by suturing. Then tract diversion done by antegrade probing from the anterior rectal wall, which was opened at 1 o'clock to the external opening, and barber thread ligation followed by Ksharasutra ligation was done. So this is the follow-up after 28 days. The tract was healed within the 28 days with minimal scar, and external opening at posterior vaginal wall was closed by secondary intention. So these are the post-operative medication which was advised, like Abhyarishta, Drakshasava, Trifalagugulu, Gandhaka Rasayana, Anil, and patient was advised to take every day 6 baths with Panchavalikala Kashaya followed by wound dressing with Jatyadi Taila. So the total hospital course of the patient was 10 days. The condition at the time of discharge, that is the length of tract, that is fistula tract, was reduced 5 centimeter to 4 centimeter. The tract was healthy and healing, and there was no pus discharge, and general health of the patient was improved. So coming to the results and outcome, the fistula tract was reduced and healed within 28 days with the follow-up of Ksharasutra changing for every week. So the sutures at posterior vaginal wall was dissolved within 4 weeks with minimal scar. The case was treated successfully with a good prognosis and without any complication. So coming to the discussion, the rectovaginal fistula is a challenging clinical condition with a poor prognosis, considered one among the Ashtamahagada according to Ayurveda Acharyas. Understanding the cause and pathology, that is samprapti of disease, is essential for effective treatment of fistula cases. A proper approach with a well-defined line of treatment that prevents recurrence, as this condition has a high tendency of complication and relapsing. So the management of fistula involves a conservative treatment plan along with the Ksharasutra procedure as described by Acharya ensures the better outcome. So there should be, it is important to have a regular follow-up. It's necessary to monitor the patient's progress until the complete healing. So this is often, this is one of the challenging process. In this specific case, the fistula present with an opening at posterior vaginal wall, which adds an complexity to the treatment. Moreover, the patient lack of orientation makes the situation even more complicated. However, a science-based approach focusing on safety and efficacy has led to successful outcome in this case. So coming to the conclusion, in general, rectovaginal fistula are difficult to manage, and the evidence for better evidence for surgical approaches to this disease remains poor. So the proper understanding of Nidana, Samprapti, Sadhya, Sadhyata of disease, expertising in the practice of Ksharasutra procedure, along with regular follow-up for Ksharasutra changing and following Patya by the patient, end up with a good prognosis and successful outcomes. Thank you.
Thank you, Dr. Pratik. Thank you for the well-articulated presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Pranita Prashant Admane for the paper presentation. Dr. Pranita, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Myself, Dr. Pranita Prashant Admane, while Yashwant Ayurved Medical College, Kodoli, Kolhapur. I would like to present the presentation on dental caries. Okay, I would like to start. Please change, sir. My topic is dental caries. We'll start it. Krimidanta is a significant topic in the field of Shalakya Tantra, one of the specialized branches of Ayurveda dealing with the disease of the head, eyes, nose, throat, and related structure. The term Krimidanta refers to a condition characterized by the presence of parasitic infestation, particularly in the oral and dental regions, leading to various pathologies. This review critically examines the description, pathogenesis, clinical features, and treatment strategies for Krimidanta. In classic Ayurveda, tastes like Charak Sahita and Surshru Sahita, Krimi refers to a wide spectrum of parasites, including helminths, bacteria, fungi, and other microorganisms. Krimidanta is described as a condition where parasitic infestation lead to dental caries and oral disorders. The disease is often linked to armor accumulation, vata imbalance as a poor oral hygiene. This test suggests that Krimi are not just external invaders but also a manifester of internal imbalance. Please change. Introduction. Oral health and dental problems in Ayurveda and modern science. Oral health is very important for our overall health and quality of life. It includes many problems like tooth decay, mouth cancer, gum disease, etc. People have concern about oral health since ancient time. Change. In Ayurveda, ancient scholars have explained disease related to the teeth and mouth. These old texts help us understand current dental problems. One such disease is Krimidanta, which includes both the symptoms and treatments. Please change. Modern science also explains how to decay delays and how to decays appear. Uh, there are three main categories: acidogenic theory, proteolytic, and proteolysis. Acidogenic is suggests that it says that bacteria in the mouth turns sugar into acid, which damage the teeth. Proteolytic theory says it focuses on how bacteria break down the protein by the part of teeth. Proteolysis means chelation theory. This combines both acidic damage and breakdown of proteins. Dental caries is a disease that permanently damages the hard part of the teeth. It mainly caused by bacterial lactobacillus, actinomyces, viscus, and nococordia. Ayurveda also says that tiny living organisms are the cause of Kriminanta. This is very similar to how modern science explains the bacteria cause today. Ayurveda review. What is Kriminanta? In Ayurveda, Krimi means tiny organism like germs or insects, and then the tooth. So Kriminanta means a tooth disease caused by germs. It is very similar to what modern science called dental caries or tooth decay or tooth decays. Causes of Kriminanta. According to Ayurveda, Krimidanta is mainly caused by imbalance of Vata dosh. Signs of Krimidanta include black spots on teeth, holes in the teeth, loose teeth, swelling and pus, paining in the gums or teeth. One main reason for Krimidanta is food stuck between the teeth, especially old or stale food. When food gets stuck and it is not cleaned properly, it starts to rot. This allows germs to grow, which leads to tooth damage. A lack of calcium and vitamin D in the body can also make the teeth weaker. Please change. How it happens? Eating wrong or stale food, imbalance of vata dosh, germs in mouth, tooth decay begins Krimidanta. Ayurvedic treatment. Acharya Sushruta described two types of Krimidanta, movable and immovable. Movable, like the tooth moves or become loose. Immovable, the tooth is damaged but stays in the place. Treatment for movable, Svedana, Swedan, warm therapy or steaming, Raktamokshan, removing of impure blood, Vatagna of Pidan, Gandush oil pulling, eating soft and oily foods. Please change. Treatment for immovable Krimidanta, tooth removal, extraction, cauterization, burning the infected area, nasyap, putting medicine into the nose, other herbal treatments, using herbs like hingu, kaya phala, surgical shar, kushta, maricha mixed in medicated oil for kavala or gandush. Please change. What to avoid? Pathya, apatya. What to avoid? Apatya. So, sour fruits, cold water, dry and hard food. Please change. Modern science. In modern times, tooth decay means damage to the hard part of the teeth. It happens because bacteria in the mouth feed on sugary foods and create acid. This acid harms the tooth enamel and also form holes. Common bacteria is Lactobacillus actinomyces viscus nocodia. Tooth decay is one of the most common dental problem in India and almost all around the world. Please change. Etiological factor, unhealthy eating habits. Eating too many sugary food increases acid in the mouth, which can damage the layer of teeth enamel. Sticky food stay on the teeth for a long time and cause more harm. Eating a lot of food with carbohydrates increases the risk of cavities. Not getting enough calcium and vitamin D can make teeth weaker. Germs in the mouth. Certain bacterial streptococcus mutants, lactobacillus acidophilus, and actinomyces viscus grow in the mouth and causes tooth decay. Health condition. Some people are more likely to get cavities due to hereditary reasons or pregnancy, which can affect oral health. Personal habits, poor oral hygiene, using the wrong brushing technique, weak tooth structure. Some people are born with enamel hypoplasia, where the outer layer of the tooth is not fully developed, making it easier for cavities to form. Fluoride protection, crowded or crooked teeth, crowded. These are too close together are or not straight are harder to clean properly, allowing food and bacteria to stay stuck. Fluoride protection. Teeth have more fluoride, are stronger and less likely to get cavities. Dental devices, things like braces, dentures, or space maintenance can trap food and bacteria, which increase the risk of tooth decay if not cleaned properly. Please change. Saliva. Both thick and thin saliva can affect the way of mouth clean itself. Some types of saliva do not wash away food well, increases the chances of cavities. Types of tooth decay treatment, filling. This is the most common treatment for cavities. The dentist cleans the decayed part of the tooth by drilling it out. The empty space is then filled with a special material. Composite resin is a common filling material, especially for front tooth because it matches tooth color and looks natural. For back teeth, stronger material are used because they need to handle more pressure from chewing. Please change. Crowns. If a large part of tooth is damaged, a crown is used to cover and protect it. Crowns are made from metal, porcelain, or both. This helps keep the tooth strong and prevents from cracking or breaking. Root canal treatment. If decay reaches the center of the tooth and affects the nerves and blood vessels, root canal is needed. The dentist removes the infected tissue, cleans the area, and fills it. A crown is often placed on top afterwards to protect the teeth. Please change. Tooth extraction. If the tooth is badly damaged and cannot be saved, the dentist will remove it. This is done to stop the infection from spreading to the jaw or other teeth. Prevention is maintain good oral hygiene, keep your mouth and teeth clean every day, visit the dentist regularly, go for dental checkups even if you don't feel any pain. Early detection helps prevent bigger problems. Brush twice a day. Use toothpaste, rinse, or gel that contains fluoride, which helps protect teeth from decay. Brush in the morning and before going to bed. Floss. Daily flossing helps clean between the teeth when a brush can't reach. It's especially important if you eat a lot of sugary food or drink, as sugar feeds the bacteria that can cause tooth decay. Floss once or twice a day and use a fluoride mouthwash to rinse afterwards. Please change discussion. A common and silent problem, dental caries. Krimidanta or dental caries is very common problem around the world and affects people of all age group. This is mostly due to oral hygiene, lack of knowledge about proper dental care, and harmful habits like chewing, tobacco, and smoking. Tooth decay usually develops slowly and silently. Most people ignore it in early stage until it becomes serious and hard to eat. Many patients also avoid dental treatment because they think procedures like cleaning, filling, or root canal take too much time and effort. When early signs of tooth decay are not treated properly, disease can become long lasting and lead to tooth loss. The risk of crimidenta is high between the age of 15 to 20, even though scientists have suggested many theories to explain how tooth decay happens. The exact cause is still not clear. We do know that dental caries is a disease caused by bacteria which damage the hard part of the teeth by removing minerals and breaking down tooth tissue. Conclusion: Krimidantam, which closely resembles modern dental caries, presents with symptoms such as tooth discoloration, cavity formation, loose teeth, pus, swelling, and pain. Ayurvedic test provides effective treatment approaches like Gandusha, Raktamokshana, Vatagna, Avpidana, which are still relevant and beneficial today. In addition to this treatment, maintaining proper oral hygiene and avoiding acidic foods play a crucial role in preventing the onset and progression of Krimidantam. Early awareness and timely management are essential to protect oral health and prevent complications. Thank you. Finish. Thank you, sir. These are all references.
Thank you, Doctor. Thank you for the very detailed and well explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Sneha Hargavan Karhade for the paper presentation. I'd like to invite Dr. Sneha Hargovind Karhade for the paper presentation.
Good evening, everyone. I am Dr. Sneha Hargovind Karade, postgraduate third year student of Department of Striroj Evam Prasuti Tantra, Matoshi Astavedharari Ayurvedic College, Babulga, Taluka Yeola. Here I am going to present a paper presentation on Garbhini Chhati, Ayurvedic and Modern Management. Introduction about the topic is pregnancy is the most sensitive and important part of every woman's life. Our Acharya Sharaka has explained Chhati as the Vaktagarbha Lakshana after pregnancy. There are many physiological as well as hormonal changes which are seen during this phase of life. As this is Vaktagarbha Lakshana, there is no harm to the growing fetus as well as the mother. But when it's seen in excess, it becomes problematic. If proper care is not given, then it may lead to severe dehydration, tiredness, weight loss, etc., which may affect the mother as well as the growing fetus. Ayurveda emphasizes on both preventive as well as curative measures of the Garbhini Chhati. In Ayurveda, there are 8 types of Garbha Vidrava explained that are Sosha Ulla, Chhati, Shoka, Dwara, Tatha Aruchi, Ati Taro, Vivarnatvam, Ashtav, Garbhasya Upadrava. Among these, one of the Garbhapadras is the Chhati. So what is Chhati? Chhati is मुखावाटे दोष उंचंबळून बाहेर पडतात त्याला छर्दी असे म्हटले जात असते. गर्भावस्थेमध्ये लक्षण स्वरूपात व्यक्त गर्भलक्षण ही छर्दी म्हणण्यात येतं. त्याचे वेग 1 ते 2 वेळा सामान्यतः राहतं. गर्भिणीच्या 3ऱ्या महिन्यानंतर जे लक्षण कमी होऊन नाश पावतात त्याच व्यक्त गर्भलक्षण असे म्हटले जाते. विकृती छाती अधिक काळ गर्भावस्थेत टिकून राहून इतर लक्षणांसोबत गर्भोपद्रव गर्भिणी छर्दी हे व्याधी उत्पन्न होतो. गर्भिणी छर्दी ही 3 प्रकारे वर्गीकरण करण्यात आलेले आहे. त्यात पहिले आहे वातवर्जन्य बिकॉज ऑफ पॅथॉलॉजी, दुसरे आहे गौरव अवमान नॉन फुलफिलमेंट ऑफ गौरवदा, अँड तिसरं आहे गर्भनिमित्त बिकॉज ऑफ fetus जनरली कॉल्ड एज मॉर्निंग सिकनेस. संप्राप्ती, निदान भवन, नीलांकवन म्हणजे गर्भपीडा, अतिद्रव, अतिस्निग्ध, अति आम्ल, अरुद्ध सेवन, विविध दर्शन, स्थिर अन्न व असाधने यांचं सेवन केल्यास एका प्रकारे उदान आणि व्यान प्रकोप होतो. त्यामुळे वाताची गती विलंब होऊन वाताची गती ही ऊर्ध्व होते आणि त्यामुळे छर्दी उत्पन्न होत असते. दुसऱ्या त्याच्यामध्ये की कफ आणि पित्त प्रकोप होऊन आमाशयाचा क्षोभ होतो आणि त्याच्यामुळे छर्दी उत्पन्न होत असते. गर्भिणी छर्दीमध्ये चिकित्सेमध्ये वर्णित आहे की मृगमधील औषधांचा प्रयोग करायला पाहिजे. By giving desired foods, providing agreeable attendance that is edibles, management done considering relative dominance of different doshas. यामध्ये विविध प्रकारचे औषधांचे संयोजन वर्णित आहे. त्यामध्ये एक आहे भूनिंब कल्प व शर्करा. दुसरं सांगण्यात आलेलं आहे की शुंठी व बिल्व वय व सत्तू. आणि तिसरं धान्य कल्प, तांदूळ व शर्करा. आता छर्दीची दोषानुसार चिकित्सा बघूया. वातच छर्दी चिकित्सा त्यामध्ये वर्णित आहे मातुलिंग रस, राजा, गोलमज्जा, सांजन, डाळिंबा व शर्करा व मधु यांचा अवलेह देण्यात येतो. पित्त छर्दीमध्ये याजा चूर्ण, शर्करा, मधु, चतुर्जातक यांचा लोह. आणि दुसरं वर्णित आहे की लाजा पेय, शर्करा व मधु मिश्रित सेवन. कफच्छर्दी चिकित्सामध्ये वर्णित आहे आम्र, जामुन पत्र, क्वाथ, शर्करा व मधु मिश्रित. आणि दुसरं आहे मुद्रयुष, डाळिंब लवणासहित. पित्तछर्दी चिकित्सेमध्ये वर्णित आहे पुनर्नवा मूळ, देवदार, क्वाथ व मधु. दुर्लास चिकित्सा सांगितलेली आहे भूनिंब कल्क व मधु. आता डे टू डे लाईफ मध्ये काय आपण यूज करू शकतो तर फ्रिक्वेंट स्मॉल मील, छोटे छोटे प्रमाणात अन्न घेणे, हायड्रेशन, मोर इंटेक ऑफ वॉटर. त्याच प्रकारे एक संयोजन म्हणजे डाळिंब, शर्करा व धान्य आणि लिंबू यांचं पेय. More carbohydrates and less fats, balanced diet, assurance and physiological counseling. Many studies have shown the effectiveness of ginger in the prevention of nausea and vomiting during the pregnancy. Now we'll see about the Garbhini Shardi, that is the vomiting in pregnancy. Depending upon the severity, it is classified into two types. That is, one is the simple vomiting, which is called as the morning sickness, and second is the hyperemesis gravidarum, which is most fatal to the system. Simple vomiting, it is considered as a symptom of pregnancy. When here vomitus is small and clean or bile stain, features disappear at 12 to 14 weeks of pregnancy. Now management is taking dry toast and biscuits, avoid fatty and spicy food, vitamin D 100 mg daily, promethazine and ondansetron, plenty of fluids, that is 2 to 2.5 liters, and fruit juices. Now we'll see about the hyperemesis gravidarum, that is severe type of vomiting of pregnancy which has got adverse effect on the health of mother or incapacitate her in day-to-day activities. There are three sides, that is the adverse effect, that is 75%. First is 75% loss of pre-pregnancy weight. Second is the dehydration, and third is the electrolyte imbalance. What are the theories of the hyperemesis gravidarum? First is the hormonal, that is the higher biological activity of HCG. Second is the increased progesterone level. Second is the psychogenic surrounding, dietary deficiency, that is decreased carbohydrate resources, vitamin B6 and B1 deficiency, decreased gastric motility. We'll see about the clinical features of the hyperemesis gravidarum, that is early vomiting throughout the day, day-to-day activities further. There is no evidence of dehydration or starvation. And what are the late clinical features? The moderate to severe symptoms are evidence of dehydration and starvation are present, increased vomiting frequency, oliguria, epigastric pain, and constipation. And signs are features of dehydration plus ketoacidosis, dry coated tongue, sunken eyes, acetone smell in breath, tachycardia, hypotension, increased in temperature, jaundice in the late features. Now, what are the complications which are seen on the maternal as well as fetal side? Maternal, there are neurologic that are wernicke encephalopathy, peripheral neuritis, Korsakoff psychosis. Next is stress ulcer in the stomach, esophageal tear and bleeding, hepatic failure, conversion, as well as renal failure. In fetus, they mostly it remains unaffected, but some are low birth weight, return birth, and IUGR. What are the investigations that reflects confirmation of pregnancy by USG? Next is urine analysis, that is quantity which will be small, color dark, acetone will be present, and chloride absent. Increase blood urea level, decrease serum electrolyte, ophthalmoscopic examination will reveal retinal hemorrhage as well as detachment. Now, what is the management of this? That is nothing but the oral anti-emetic hospitalization for the woman with the hyperemesis gravidarum. The fluid that is total IV fluid is of 3 liters plus equal amount of vomiters which has gone and urine, and there is no oral for 24 hours. And drugs are antiemetic, promethazine, stamitil, doxylamine, succinate, and pyridoxine. Now we'll see about the book question, that is in Garbhini Parichaya, Acharya have mentioned Madhura Shita and Drava Ahar should be given. Even though ingredients of Bilvadi available like Bilva, Tvaka, Ela, Maricha, Naga, etc. are having Katu as a Pradhan ras, here Katu ras is the minimal quantity, so it will not affect the growing fetus. The drug which has Katu rasa have Laghu Ruksha Guna, Ushnavirya and Katu Vipaka. Due to Ushnavirya and Katu Vipak, it is a Vata Pitta Hara. The ingredients of Bilva avloha like Kvaka, Jiraka, Mariko, Shunthi, Pippali, Deepak, Pachak, and Rupswar, and have Vata Shamak property, thereby reducing the Chalti Vita. The drug of Bilva avloha like Tvaka, Tela, Ghana, Arudya, and Balya, this helping increasing the Pachakagni and Dhatavagni and helping in proper digestion, absorption, and increase in weight. So, what is the conclusion of that? It can be concluded that in our Vedic text, various simple and safe herbal formulations have been explained for the Garbhini Chalti, which can easily be formulated in day-to-day life with pregnant women, and they are easy to prepare if they are easily available. Thank you.
Thank you, doctor. Thank you for the well-explained presentation. Next, I would like to invite Dr. Sankamitra Shivajirao for the paper presentation. I would like to invite Dr. Sankamitra for the paper presentation.
Hello everyone, myself Dr. Sanghamitra Khope, second year PG scholar student of Chikitsa department, Vidarbha Mahavidyalaya. My case study titled A Case Study of Management of Vata Kantaka with Ayurvedic Approach with special reference to calcaneal spur. My HOD and guide name is Dr. Vaishali Wankhade. Abstract: Vata Kantaka, commonly known as heel pain or calcaneal spur, on the basis of clinical features, which include sharp pain in the heel or ankle, especially during initial steps after rest. Modern medicine offers conservative management in the form of NSAIDs, steroids, and some procedures such as injection of steroids at the local site. All these measures provide temporary relief and are associated with proven side effects. Ayurveda management in such cases provide complete cure. In this case study, we are going to see the efficacy of Ayurvedic medicine and procedures on the Vata Kantaka. A 50 years old male patient came to outpatient department with chief complaints of pain in left heel since 2 months. According to him, pain was severe during first few steps after waking up from bed. He was given Agnikarma, 3 settings at interval of 7 days at local site and Dashma Kada and capsule Barkar. Ashtang Hridaya explains 8 sections, of which Chikitsa is one of the principal branches. Charak describes conditions where aggregated Vata dosha due to missteps or uneven walking lodges in the ankle region, causing pain. This is interpreted as Vata Kantaka. Vata Kantaka can be correlated with calcaneal spur or plantar fasciitis. A calcaneal spur is a bony outgrowth from the calcaneus. It typically forms at the point where tendons or ligaments attach to the bone, most commonly at the bottom of the heel or the back of the heel. Charak Samhita. While the term Vatakantaka is an explicitly named, it is discussed under the broader category of Vatavedi in Chikitsa Sthana, chapter 28. Shushruta Samhita. Acharya Shushruta provides a more direct reference to Vatakantaka under Vatavedi. He associates it with improper foot placement and repetitive strain, leading to pain in the heel. This is often linked with calcaneal spurs or plantar fasciitis. Agnikarma Charak Samhita. Deepika commentary. This commentary elaborates on the condition and its management, including therapies like Snehana Svedan, Agnikarma, and Raktamokshan. A case report. A 50 years old male patient came with chief complaints of pain in left heel since 2 months. History of present illness. Patient was alright before 2 months. After the patient was started feeling pain and stiffness in left heel, generally pain was severe in the morning. Hence, he came to the OPD of Chikitsa department, Vidarbha Ayurveda Mahavidyalaya, Amravati. Past history. No history of hypertension, DM, and thyroid dysfunction. No any surgical history found. No history of fall. Personal history. Occupation farmer, Ushapan no, Divaswap and Jagran yes, Mansar yes. Addiction, tea 3 times a day. Family history. No evidence of this type of disease in the family. Physical examination. All vitals are normal. Diagnosis is made on the X-ray. X-ray of left heel lateral view reveals bony outgrowth on the left heel. In this case, we have given Shaman Chikitsa, Dashmul Kada 3 tablespoons 3 times per day with half cup of lukewarm water. Capsule Barkalvin 1 BD. Snehana with Mahanarayan Tel and Saindhava. Svedana with lukewarm water for 7 days. This was done before 7 days prior to Agnikarma. Agnikarma. Material and methods. Panchadhatu Shalaka. Aloe vera pulp. Pranaropan Tel. Purva Karma. Sterilization of all equipments was done. Informed written consent of patient was taken prior to procedures. Demarcation of points of maximum tenderness was done on left heel. The gap of 1 centimeter was kept between the points. Panchadhatu Shalaka was heated to red hot. Then Pradhan Karma, position supine, cleaning of local site was done with distilled water. Agnikarma was done on 4 demarcated points with the help of Panchadhatu Shalaka. Application of aloe vera pulp was done. In Paschat Karma, dusting of Haridra Churna was done at site of Agnikarma. Same procedure was repeated after every 7 days for 3 weeks. Assessment criteria. Scoring of signs and symptoms. Symptoms heel pain. There was criteria 0, 1, 2, 3. 0 no pain. 1 mild discomfort. 3 distressing pain. 3 severe excruciating pain. Stiffness. No stiffness, mild stiffness, moderate stiffness, severe stiffness. Tenderness. No tenderness, mild stiffness, moderate stiffness, severe stiffness. Observation and results. Symptoms before treatment, after treatment. Heel pain 2 before treatment, after treatment it has reduced to 0. Stiffness and tenderness before treatment was 2, it is also reduced to 0. Discussion in this study, observations were made based on the gradation pattern of symptoms both before and after treatment. Conclusion, it is concluded that this treatment completely relieves the symptoms of Vata Kantaka. This therapeutic management can be used in treating Vata Kantaka. It reduces both the signs and symptoms and shows the effectiveness in Vata Kantaka. And below there are the references. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Rahul Popat Takare for the paper presentation. Dr. Rahul, are you there?
Yes, sir.
Good evening, Doctor.
Good evening, sir. Should I start now, sir?
Sure, Doctor. Please start the session.
Okay, sir. Thank you. The screen is visible, sir?
Your screen is visible, Doctor.
Okay, okay, sir. Good afternoon, everyone. My name is Dr. Rahul Thakre, PG Scholar, Department of Shalyatantra, Vidarbha Ayurved Mahavidyalay, Amravati, Maharashtra. My guide and HOD is Dr. Manjusha Kalmek, which is who is Associate Professor, Department of Shalyatantra, Vidarbha Ayurved Mahavidyalay, Amravati. Today I am going to present a case report, successful management of an infected wound, that is a Dustavran, with Nimba Patra Dilep and Madhu. Abstract. Ayurvedic medicine treats the both illness using both internal and external application. For medication are prepared in the form of paste, ointments, and poultices. A lap is a specific type of medicinal paste applied topically. This method is commonly used to reduce inflammation, clean wounds, and promote healing. To prepare the lap, fresh herbs are ground into fine paste, while dry ingredients are ground into powder. Both then mixed with liquid create final application. This mixture is then topically applied as a lap. One such formulation, Nimba Patradilep, is cited in the classical text Chakradatta Samhita for managing skin conditions like Vishop, Koth, Shitpitta, Kandu, and Raktapitta. The present study conducts a consequential review of Nimba Patradilep by compiling information from various traditional texts and modern research. Additionally, it reviews standard analytical parameters required quality assurance of this formulation. Introduction. The management of infected wound possesses a significant challenge in clinical practice. While antibiotics and debridements are mainstream treatments, there is a growing interest in Ayurvedic tropical therapies known for their Shodhan and Ropan properties. Aims and objective. Here we document the clinical presentation and management of case of Dustavran caused by the chemical burn traditional marking nut application. Second, to evaluate the therapeutic efficacy of tropical intervention using Nimbapatradilep combined with Madhu, that is honey. To highlight the role of Ayurvedic Purana Shodha protocol in managing modern clinical presentation. A case report is a 55-year-old male who is work as farmer presented with painful, swollen, and purulent wound on the left foot since 1 week duration. The condition developed after he applied a paste of raw marking nut on minor traumatic wound as an home remedy. Eventually, minor wound gets worsened due to patient's laxity and their misconception in just few days. The patient had no any known case of diabetes, STL, or thyroid dysfunction. Patient also had no any addiction of tobacco, smoking, etc. Patient had no any history of medication ongoing. Admission to the male surgical unit ward for additional care has been advised to patient and relevant investigation are performed. Local examination. Here we can see an image of purulent discharge, slough discharge, unhealthy granulation. Surrounding skin is hyperpigmented and dry, thickened. No obvious cellulitis around the margins. Edges are irregular, sloping, and most areas of wound deepen and exposure to underlying tendinous structure. Red granulation can be seen. Whole was present. Tenderness was also present. Here, materials and methods were used: intervention, topical application, Nimbapatra Churna lap mixed with Madhu in the ratio of 2:1. The lap was prepared freshly for each dressing by mixing sterile Nimbapatra Churna with pure natural honey to form a semi-solid paste. Procedure: the wound was first cleaned with normal saline. Medicated lap was then applied eventually over the entire the wound bed and covered with sterile gauze pad, and dressing will be done. Duration: the dressing was changed once daily for a period of 6 weeks. Assessment: progress was monitored weekly through clinical observation. Reduction in size, exudate, slough, and presence of healthy granulation and photogenic documentation has been recorded. Here we have applied the lap over the wound for the several days. Result: the intervention show remarkable results. Within a week, significant reduction in pain, swelling, and purulent discharge was observed. Healthy granulation tissue developed, and wound shows progressive epithelialization, leading to complete healing without any adverse effect. The Nimbapatradi formulation has Shodhan, Ropan, and Vishagna properties can be noticed. Conclusion: this case demonstrates the efficacy of Nimbapatradi with Madhu as a potent and safe topical treatment for Dushtavrana. It underscores the potential of Ayurvedic wound care protocols as an effective standalone or adjacent therapy. Further large-scale studies are warranted to validate these findings. Here are some references we have given. Thank you so much, everyone.
Thank you, Doctor. Thank you for the insightful and enlightening presentation.
Okay, sir.
Next, we go to another paper presentation. I would like to invite Dr. Rahul Sonkar for the paper presentation. Dr. Rahul Sonkar, are you there? Dr. Rahul Sonkar, are you there? Please unmute, doctor. Dr. Rahul Sonkar, are you there? Okay, next I would like to invite Dr. Shijal Bhujangrao Inkar for the paper presentation. I would like to invite Dr. Shijal Bhujangrao Inkar for the paper presentation.
Good morning everyone. Myself Dr. Sejal Inkar, PG Scholar, Department of Chikitsa, Vidarbha Ayurveda Mahavidyalaya, Amravati. My guide name is Dr. Vaishali Wankhede ma'am, HOD Guide and Professor, Department of Chikitsa, Vidarbha Ayurveda Mahavidyalaya. My topic name is Ayurvedic Management of Vata Shirashula with respect to tension, headache, a case study. Abstract: head, that is Shira and Uttamanga, is the most important part of the body in Ayurveda. Shiroga refers to head-related disorder commonly presenting as a pain but excluding the brain diseases. Among headache, tension type headache is the most frequent, affecting about the 75% of the population. Modern management relies on painkiller giving only the temporary relief. Ayurvedic correlated with tension type headache with Vata Shura caused by stress, fasting, night vigil, grief, and suppression of the natural urges. Treatments include Snehan, Svedan, Nasya, Dhumpan, Lep, Parishek. Nasya with Anutem is specially effective for Vata disorders. A 23 years old male patient with a TTH, that is tension type headache, was treated with Shirashula Vajraras, Hingvashtak Churna, Gandharva Haritaki Churna, Anutel Pratimarshanasya, and Shirodhara with a Siddhakrita. After 1 month, marked improvement was observed with only mild recurrence on follow-up. Introduction: in Ayurveda, the head is considered the Sadhya Pranhar Marma and the seat of the Pran. Shirashula denotes the head pain, often used for Shiraroga. Acharya Shushruta classified 2 types of Shiraroga, among which Vata Shirashul is the most commonly seen today. This may due to the modern lifestyle factors that are also mentioned in Ayurvedic texts such as the Vegavdharan, Ratri Jagran, Upavas, Ati Uccha Bhashan, Bharya. These factors are very commonly in today's busy, stressful lifestyle, leading to vata imbalance, which causes headache. In Ayurveda, Nasya is considered a key treatment for head diseases because the nose is gateway to the head. Acharya Shushruta recommends very external techniques, that is Bahya Upakrama, for such conditions: Snehan, Svedan, Nasya, Shirolepa, Shiroabhyanga, Dhumapana, Parisheka. Internal therapies, that is Abhyantar Upakarma, include Snehapan, Anuvasan Basti, Niruva Basti. From a modern medical perspective, tension type headache is the most common type of headache. It affects about 90% of headache sufferers. The pain often starts at the back of the head, neck, or eyes, can spread across both the side of the head. It feels like a tight band around the head. Common causes include stress, lack of sleep, poor posture, irregular eating habits, teeth grinding, eye strain, neck and the shoulder muscle tension. The World Health Organization classifies tension type headache into episodic tension type headache and the chronic tension type headache. Episodic tension type headache happens less than the 15 days a month, affects over the 70% of people in some population. The pain usually lasts few hours to several days. Chronic tension type headache happens more than 15 days a month, affects 1 to 3% of adults. It starts in teenage years and is more common in women. It can be continuous and more disabling than the episodic type. The pain in both types of tension type headache is described as pressure or the tightness, often like a tight band around the head, sometimes extending from or into the neck. Modern management, detailed diagnosis and explanation to the patient, physiotherapy, muscle relaxation techniques, stress management. In some cases, low dose medications like amitriptyline may be necessary. Case study: a 23 years old male came to the Chikitsa OPD at GNT Ayurvedic Hospital, Amravati, with headache for 1 year. Symptoms: pain mainly on forehead, vertex, and both the temporal region. Dull, continuous aches throughout the day. Worse during stress or disturbed sleep. Sensitivity to light and sound. Associated complaints: reduced sleeps and anxiety. Past history: no significant past illness, no family history for similar complaint. Diet and habit: mixed diet, non-veg weekly, irregular appetite, disturbed sleep, no smoking or alcohol. Examination: general condition is good. BP 130/80 mmHg. Pulse 70 to per minute. Systemic examination: RS, CVS, CNS, per abdomen normal. Prakriti Vata Pitta. Nidana: कटु आहार, irregular food times, रात्री जागरण, stress. संप्राप्ती: निदान सेवन, वृक्ष उष्ण गुण increases, ventilation of vata and pitta, leads to rasakshaya, that is depletion of the nutrition in tissue, finally results in shiroshula, that is headache. Treatment: shiroshul vajralus 500 mg adho bhakta with a koshtachal, hingvashtak churna 2 gram, prag bhakta with a grit, गंधर्व हरितकी चूर्ण 5 ग्राम, निशा कालभित कोष्ण जल, then snehan and the tapasvedan, then pratimrsha nasya daily 2 bindu, and daily shirodhara with a siddha gruta. Result: after 1 week of Nasya and Shirodhara treatment, the patient felt much better and the headache reduced and sleep improved. Discussion: the patient symptoms correlated with a Vata Shiroshula, that is tension type headache due to the stress, irregular meal, poor sleep, constipation causing the Vata Pitta aggravation. Management focus on the dosh balance, better sleep, digestion, relaxation using the Shiroshula Vajraras, Anutel Nasya, Shirodhara. These combined internal and the local therapy provide both the root cause management and the symptomatic relief. Conclusion: Vata Shiroshila is a psychosomatic disorder that can be correlated with tension type headache. Nidan such as Vishamashan, Ratri Jagran, Ruksha Ahara, Mansik Nidans play major role in its manifestation along with Nidana Parivarjan. The use of Snigdha, Madhur, Bruhana Aushadis helps to pacify Vata and providing the relief. In this case, the patient showed marked relief from all the symptoms with Ayurvedic treatment. References: these are references. Thank you.
Thank you, doctor. Thank you for the enlightening presentation. Next, we go to the paper and poster presentation. I would like to invite Dr. Divya Pradeep Chowdhury for the paper presentation. I would like to invite Dr. Divya Pradeep Chowdhury for the paper presentation.
Good evening, all. Today, I, Dr. Divya Chaudhary, PG Shalyatantra Department student of Ashwin Rural Ayurved College Sangamner, presenting a paper on systemic review of lifestyle management in anorectal diseases. So, first of all, anorectal diseases are very common inside the well-known population due to faulty dietary habits, lifestyle modalities such as late night awakening, shift obligations, so forth to pathogenesis of these anorectal diseases. Keeping positive health in healthy people and treating the disease once are the main ambition of the Ayurveda. Keeping this in view of Acharya, have emphasized the significance of preventive elements and distinct record about Dinacharya, Charya, and this text particularly makes a specialty on preventive measures of anorectal illness with appropriate dietary recommendations and everyday regimens. Patyanapatya Ahara Vihara is also important in this. So, introduction. Illness occurring within the anus and rectum, collectively known as anorectal illness. Arsha, Budagati Vidradi, Bhagandar, Parikartika, Budagramsha. These are normally going to anorectal issues because of the defective nutritional habits and lifestyle. Due to lack of time, human beings select a smooth to made and effortlessly to be had meals like junk food, which could be very low in nutritive cost and include a high amount of calories, together with a long-term sitting day and the night shift and followed unhappy sleep are the common scenario of maximum character. So, what the Acharya said, the conduct purpose violations of Vata, Pitta and Kapha dosha. This causes the Mandagni. In the state with the Vagbata, the foundation reason of illness is Mandagni. Prajnaparad is also one of the main positive factors in anorectal issue. In Ayurveda, the concept of Patya Apatya concerning Ahar Vihara and Sadrutta has been given. Ahara is one of the Traya Upastambha, as mentioned by Acharya. Ahara acts the Indana for the Jatha Agni inside the frame. This suggests the mission relationship between Ahara and Agni. Vihara consists of Dinacharya and Ritucharya. So the balance of three dosha in our body has been mentioned, which allows to alter the personal biological clock and synchronize to nature, nature's circadian rhythm. These are very beneficial to prevent any type of alignment. Causes of anorectal diseases. So what are the causes of anorectal diseases? Are dietary causes mainly, lifestyle causes, and there are some other causes. In dietary causes, consumption of processed junk, bake and dairy products, intake of highly spicy and oily food, extra tea and coffee intake, consumption of extra non-vegetarian weight reduction plan, lack of fibrous food diet, viruddha ahara, irregular diet plan, lifestyle causes such as pravahana, utkata asana, poor hygiene and lack of cleanliness, extra coitus or anal intercourse, lack of sporting activities, increased stress, disturbed sleep, addiction of smoking, alcohol habits, etc. Intake of food regimen in hurry, curry, and worrying manner. What are the different causes? Like a ruksha durbala deha, roughness and loss of fats in ischiorectal fossa, agnimandatva, heterogenic causes damage at perianal region, perianal tear during the delivery or surgical fault. Ayurvedic control via safety measures are eating regimen modification, lifestyle amendment, smooth domestic methods, and yogic physical activities. So, what to do? Eat increase fiber and roughage in food plant like makhana, like fruits, like green vegetables. What not to do? Keep away from speedy and junk food. Uh, Keep away from non-vegetarian food regimen. Ayurveda has given the idea of Agni, that is digestive energy. When the doshas and dushas are combined with ama, can be known as a sama dosha, which cause for production of sickness. In an effort to preserve the health, one should have to balance digestive strength. So, Samprapti of Buddha is all about the causes linked to violation of Mata dosha and slightly dully or all related to blood reason, Mandagni, which further causes constipation, and then lengthy time constipation can cause Pisharinano, which further results in Arsha. So, Utkatasana is also the cause for Arsha. Buddhavat Kandu, Bhagandara. In worse condition, it causes Buddha Bhransha too. So, lifestyle modifications. In lifestyle modifications, we can take Ushna Jala Avgaha, that is hot seeds bath, almost little quantity of spatika or tunkan powder is introduced to lukewarm water 2 times in a day at night or in the morning after defecation. Advice Matra Basti. Some yogic exercises like Yogasana, like Vajrasana after meal. Then Dhanurasana, Halasana, Surya Namaskar, mudras like Ashwini Mudra, Bandha, Mula Udyan, Mahabandha, Pranayam, Anulam Vilam, Nadi Shodhana is important in this. Diet management is Snigna Sara Pichila, Lagu Tikshna Guna Ahara, Vedagnis, Vedana or Sangrahi Karma consuming food. Follow Ashtarida Ahara, Vidhi Visheshayatana while preparing cooking and Vatanuloman spiritual health. So lifestyle modification follows Dinacharya, Ritucharya, Sadripta and focus on Ahara. So what is conclusion? To succeeding right guidance of prevention, it has been discovered to comply with all the patients cured earlier. To delay the progression to delay the disease progression. The principal purpose of anorectal issue is mandagni due to ahitakara ahara and vihara, suitable following of individual dinacharya and ritucharya make the person disciplined about his each day routine. So these are some references which have been used to prepare the paper. Thank you so much.
Thank you, doctor. One more poster presentation is there. Next, we go to the poster presentation.
Good evening, all. Today, I, Dr. Diva Chaudhary, PG Shalyatantra Department, student of Ashwin Rural Ayurvedic College, Sangamner, presenting a poster on prevention and management of renal calculi. So, first of all, what are the symptoms for renal calculi? Pain during maturation, fever and chills, nausea and vomiting, bloody and cloudy foul-smelling urine, inability to pee or difficulty in peeing. Background occurs when there are excessive of crystal forming substances that can't be dissolved in urine. Contributing factors: disturbances in urine pH, low urine volume, low fluid intake, and dietary habits. So we see the crystal forming substances that can be dissolved in urine, right? So the substances are the types of kidney stones are phosphate stone, urate, xanthine, oxalate, cystine stones. So the stones are usually calcium stones are 75% occurring. Cystine stones 1%, uric acid stones 5 to 10% in a patients. Steroid stones 10 to 15% in a patients. So what are the diets in kidney? What are the diet in kidney stone? What to have and what to avoid? To have bananas, papayas, low milk yogurt, plenty drink of water, then green tea, coffee, broccoli, and what to avoid? The salty food, cold cuts, processed meats or processed cheese, more amount of vitamin D, vitamin C supplements a day. High oxalate food like beans, wheat bran, then black tea, then potatoes, spinach, tofu, etc. So, what is the management to this? For renal calculi, there are stones like renal calculi, ureteric calculi, urinary bladder calculi, or urethral calculi. For renal calculi, medical conservatives we use if the size of stones less than 0.5 centimeter, no hydronephrosis, no distal obstruction, and no infection. We should use ESWL when there is a radio opaque stone greater than 2 centimeter. Then calicial or pelvic stones, no distal obstruction, no infection. We should go for surgery, PCNL, percutaneous nephrolithotomy. When there is size of a stone greater than 2 centimeter, cystine stone, or it obstructs urinary obstruction, open surgery, contraindicated or failed. If PCNL and EWSL fail or contraindicated, then only we should go for open surgery. Then uretary calculi, medical conservatives as above. Intervention, ESWL and open surgery. ESWL for less than 1 centimeter, open surgery for 1 centimeter. We nowadays we use URSL surgery for uretary calculi if there is a mild hydronephrosis, secondary infection, persistent pain, and failure of the conservative. Then urinary bladder calculi, that is cystoscopic lithoplexy. Cystoscopic lithoplexy we used if the size is less than 2 centimeter. It extraction of resulting the fragments by Elk's evacuator. Open surgery, that is cystolithotomy, if only size is greater than 2 centimeter, multiple stones in diverticuli, very hard stone in children, or failure to crush. Then urethral calculi such as prostatic, membranous bulbopenile, and fossa navicularis or meatus. So prostatic stones, metal buggy dislodge the stone to bladder, open surgery, cystolithotomy. Membranous or bulbar cystoscopy, we should do by wire basket method or open surgery we can do. For penile gentle milking, no surgery needed. Fossa navicularis or meatus, gently milking or neotomy we should do. Thank you.
Thank you, Dr. Divya. Thank you for the informative and well explained paper and poster presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Muktai Madhav Chowdhury for the paper presentation. I would like to invite Dr. Muktai Madhav Chowdhury for the paper presentation.
Myself, Vaidya Muktai Madhav Chaudhary. My subject is Kaumar Vritya. I am PG second year student. My college name is Late Kirari Redekar Ayurvedic Mahavidyalay, Gadinglas. My guide name is Vaidya Uday Kumar Ashok Kuri sir. Today's paper presentation topic is Efficacy of Trifaladi Vata Parisechan in the management of Ahiputana, that is napkin rash. Abstract. Management of Ahiputana, which is mentioned for the Pitta Jrana, can be used. Sushruta has mentioned Shodhan, Ropan Chikitsa or Lepa Chikitsa for all types of Vrana. Trifaladi Vata Parisechan having properties like Vrana Shodhan, Vrana Ropan, Vrana Pachan, Kandugna. Therefore, it is indicated and useful in the management of Ahiputana. Trifala is easily available, cost effective, affordable, hence this drug has been selected for the management of Ahiputana. Acharya Sushruta has mentioned Ahiputana as itching at perianal region, papulovesicular lesion, discoloration of skin and secretions are symptoms of Ahiputana which are similar to napkin rash mentioned in modern science. Trifaladi Kvata Parisecha. Trifala Badira Plaksha Tvaka Kvata Parisechitam. This reference is from Ashtang Sangraha. Kvat Kalpana is most significant and widely used, is acquired by boiling of herbal drugs with water in specific proportion and reduced to desired quantity provided. The heat is moderate. This type of drug preparation is called as Kvata Kalpana. Trifaladi Kvata Parisechan is used for 30 minutes on rash area for 7 days for the management of Ahiputana. Criteria for assessment during treatment: Kandu, that is itching, area covered by rash, Strava, that is secretions, color, erythema or Guda Pradesh, Pidika, papulovesicular region. Over the period of 7 days, according to the symptoms, we can assess the patient for the management of Ahiputana. During my thesis, I assessed on this topic, and hence this is the observation. Patient got relief by 75 to 80% after using Trifadiquatavan in Ayurveda. These are some of the references that I use. Thank you so much.
Thank you, doctor. Thank you for the insightful presentation. Next, we go to another poster presentation. Before that, I would like to invite Dr. Rahul Songar for the paper presentation. Dr. Rahul Songar, are you there? Dr. Rahul, can you hear me? Dr. Rahul Songar, can you hear me? Dr. Rahul Songar, can you hear me? Dr. Rahul, we can't hear your voice. Can you hear me, doctor? Please unmute, doctor. We can't hear your voice. Please unmute, doctor. Okay, next I would like to invite Dr. Komal Anandravu Gutte for the poster presentation. I would like to invite Dr. Komal Anandravu Gutte for the poster presentation.
Myself, Dr. Komal Gutte, PG Scholar, Shalyatantra Department, student of Dr. Dhanashree Lilke, Associate Professor and HOD, Shalyatantra Department from Government Ayurvedic College, Dharasur. Today I am going to present poster of bilateral femur head AVM treated with leech therapy and Panchatikta Kshir Basti. Patient history: 30-year-old female having complaints of onset bilateral hip pain and progressive difficulty in walking, reduce the range of movements since 8 months. Diagnosis: bilateral femur head AVM based on the MRI and evaluations clinically. Clinical presentation for the treatment: local therapy for Shaman and Shodhan Chikitsa, Jalopaucharan, that is the leech therapy. It's given for the every 7th days, one setting for the one leg, helping to reduce the pain relief, reducing the local inflammation and improving the circulation. And oral medications given are Astiposhak Vati, Panchatikta Gruta Gugul, 2 tablets BD. Systemic therapy, that is Panchatikta Kshir Basti, that was the medicated milk enema given for the 15 days as a Kala Basti Kram, which helps in nourishing the Ashtadhatu and helps to reduce the whited Vata doshas and promotes the regeneration and strength of the bone. For after the 15 days, Clinical outcomes noted in the patients are reduction in the heat pain intensity, improve the joint mobility and walking capacity, decreases the stiffness and enhance the quality of the life. Conclusion. Avian femoral head is progressive and degenerative condition with limited conventional treatment, but Ayurveda offers a promising integrative approach to delay the disease and progression and improve the functional status of the patient. Thank you.
Good evening.
Thank you, Doctor. Thank you for the simple and consistent presentation. Next, we go to the another paper presentation. Sorry, it's a poster presentation. I would like to invite Dr. Onkar Dishant Jadhav for the poster presentation. Next, I would like to invite Dr. Onkar Dishant Jadhav for the poster presentation.
Good evening, all of you. Myself, Dr. Onkar Jadhav, final year PG student. Now I am going to represent in front of you Agnikarma in calcaneum spur, an Ayurvedic parasurgical procedure. Calcaneum spur heel spur as a bony outgrowth on calcaneum bone, causing heel pain and difficulty in walking. In Ayurveda, correlate with the Vatakantaka. Agnikarma is mentioned by Acharya Susruta as the best line of treatment for such painful conditions. Now, procedure: identify point of maximum tenderness, heat Panchadhatu Shalaka till red sore. Apply the heated tip in a bindu dot pattern. Each contact steadily lasts only a fraction of a second. 5 to 7 dots are usually applied depending on the severity. Now, post-operative care, application of Ghruta, aloe vera, pulp, or Shatadhot Ghruta. Avoid walking barefoot, long standing, or hard footwear. Use soft soles or heel pads. Rest for 1 to 2 days. Now, what are the benefits of the calcaneum, Agnikarma calcaneum spur? Immediate pain relief, reduces inflammation and stiffness, improves circulation, prevents recurrence, and cost-effective and minimally. Now, what are the precautions? Avoid in diabetic with poor healing, contraindicated in the bleeding disorders or skin infection. Thank you.
Thank you, Dr. Onkar Jadhav. Thank you for the simple and insightful presentation. Next is a paper presentation. I would like to invite Dr. Ravindra Shinde for the paper presentation. I would like to invite Dr. Ravindra Shinde for the paper presentation.
Good evening, everyone. My name is Dr. Shingde. Today, I will be presenting review of Kapha Yoni Vyapa with special reference to vaginal devices. This work was carried out under the guidance of Dr. Sarita Kamte, reader in late Kedari Redekar Ayurveda Mahavidyalaya in Prasuti Tantra and Stree Rog Department. Abstract. Yoni Vyapat is a group of gynecological disorder described in Ayurveda, classified based on predominance of dosha. Among them, Kapha Yoni Vyapat is characterized by Pichil Shvetistrav, Yoni Kandu, Gaurav, and Mandavini, resulting from Kapha Dosh Prakop. In modern gynecology, this feature closely resembles vulvovaginal candidiasis, a common fungal infection caused primarily by Candida albicans. Vulvovaginal candidiasis presents with curd-like discharge, intense itching, and vulvovaginal irritation, often associated with predisposing factors like diabetes, antibiotic use, pregnancy, and immunosuppression. The Ayurvedic management of Kapha Yoni Vyapat emphasize Kapha Shaman, Kled Shodhan, Krimigna Chikitsa, to Nidan Parivarshan, Shodhan, Yoni Prakshalan, Dupan, teaching, and internal administration of Kapahar Rasayan Dravya such as Tripala, Nimba, Haridra, and Guruchi. Modern treatment primarily involves antifungal agents like clotrimazole, fluconazole, though recurrent remain common. This paper attempts to establish a correlation between Kapha Yoni Vyapat and vulvovaginal candidiasis, while highlighting the comprehensive role of Ayurveda in providing effective management and prevention. An integral approach can offer sustainable results and improve women's reproductive health. Next, introduction. Women reproductive health has been prime concern in Ayurveda under the domain of Yoni Vyapat. Acharya Charak, Shushru, and Bhagavad describe 20 types of Yoni Vyapat, each occurring due to vitiation of dosha individually or in combination. Along with Kapha Yoni Vyapat is caused by aggravated Kapha dosh leads to specific gynecological disorder. In modern science, vaginal candidiasis is a common fungal infection of vulva and vagina, most commonly caused by Candida albicans. It manifests with thick curd-like discharge, itching, irritation, and burning sensation, which closely resembles the description of Kapha Japur. Next, aim of the study to correlate Kapha Vapor with vaginal candidiasis and explore the role of Ayurvedic principle in its effective management and prevention. Next, Nidan, excessive intake of guru, snigdh, madhu, food, lack of physical activity, excessive daytime sleep, suppression of natural urge, and poor vaginal health are the causes of Kapha Vapor. Samprapti. Kapha प्रकोप due to निदान सेवन, कफ accumulation in yoni marmasthan leads to स्त्रोतरोध and kapasthan samshara, produce symptoms like ati snigdha, pichil, shvet, strav, itching, and heaviness. Lakshan. Yoni kandu, pichil strav, gaurav, avilya shvet strav, Mandavedan. These are the Lakshans of Kapha Yoni Vapor. Clinical features as per modern intense vaginal itching and burning, thick curd-like white discharge, vulval erythema and edema, dyspareunia and dysuria. Sometimes are the symptoms of vulvovaginal candidiasis. Correlation of Kapha Yoni Vapor and vaginal candidiasis. Similarities are white curd-like thick discharge, Kandu, Gaurav, and Velapin. Both conditions arise due to cough predominance and local stotorod. Chikitsa. According to Ayurvedic principle, Kapha dosha shaman and shodhan, Kled shodhan, Krimigna and Kapagna dravya are used with the formulations of Yoni Prakshalan, Yoni Dhupan, and Yoni Pichu with appropriated drugs. Chikitsa Sutra. Nidan Parivarjan. Avoid excessive sweet, curd, fermented food, and inappropriate hygiene. Shodhan Chikitsa. Virechan with Trivrit Leha and Abhipattikar Churna. Local treatment. Yoni Prakshalan with Tripala Kashai and Panchvalkal Kwa. Yoni Dhupan with Nimb, Gugul, and Haridra. Yoni Pichu with Nimb tail, Jatyadi tail are used in local treatment of Kapadosh Yoni Rapid. Shaman Aushadhi. Chandraprabhavati, Trifala Gugul, Nimbadi Churna, and Khadira Rishta. Haridra Khand. Guruchi, Nimba Musta, and Daru Haridra used in Shaman Aushadhi Chikitsa of Kapha Yoni Rapid. Rasayan Chikitsa. To improve immunity and prevent recurrence, Guruchi, Amlaki, and Yashti Madhu used. In modern management, local antifungal agents like clotrimazole, muconazole, and niacins are used. Local oral antifungals, fluconazole, and itraconazoles are used. Supportive care, maintaining vaginal hygiene, wearing cotton clothes, and controlling diabetes. Preventive measures. Avoid excessive intake of guru, snigdha, madhur, ahar, regular vyayam, avoiding divaswa, proper hygiene, and use of breathable cotton garments. Adequate management of diabetes and other systematic disorders. Conclusion. Kapha Univapat can be effectively correlated with vaginal candidiasis. The Ayurvedic line of management based on Kapha Shaman, Kled Shodhan, and Krimigna Chikitsa offer promising results along with preventive measures to reduce recurrence. Integration of Ayurvedic and modern approach can ensure better outcome and quality of life for women. Thank you.
Thank you, doctor. Thank you for the very informative session. Next, we go to the another paper presentation. I would like to invite Dr. Sudhanshu Sanjay Patil for the paper presentation. I would like to invite Dr. Sudhanshu Sanjay Patil for the paper presentation.
Dr. Patil from Department of Homeopathy, late academic Ayurvedic College, Ganpat. My dad is Dr. Adveshta, introduce myself. My topic is neonatal hyperbilirubin, in which bilirubin level is high in bloodstream, which we call it interest jaundice. Early discussion of skin is still one may happen. It's approximately 60 to 80% term babies have neonatal hyperbilirubin. Normal risk factor RH, metabolic sepsis, or GS6PD, and mostly common in male 6 babies. Normally, there are two types of jaundice: pathological, physiological jaundice. Pathological jaundice, it, its immaturity of neonate to handle the bleeding production visibly. Jaundice usually occurs in 24 to 70 hours after pathological. It's after within the 24-hour normal um, expected normally. Within the clinical jaundice studies, normally visible dark bleeding will be categorized under this category. In this session, total serum bleeding may be detected by intergalactic pericoincident pneumatic aretic count DCT will be done. Normally, this scenario we discuss with the case. Baby, normal baby 24 date of birth is 24/7/25. Date of admission 28/7/24. Birth 20.9. Male child. Full term primary after birth. Delivery by cesarean section. Baby heart irritable, excessive cry, followed discussion of skin and flora. Then after examination, configure out 26 CPO groups, CRT groups, basic 78, is 39 before examination add-on. I will say because screen health it was present for examination normally or Ariana sustainable RS parent development CBS response is to normal, so much spreading and typically pneumatic flexibility, abdominal sounds afternoon, correcting energy, abdominal sound bowels and baptism, no distension, don't be then be long lab investigation in which C1 level total if the blood group is O positive, mother blood group is A positive, then in serum bilirubins, total bilirubins 4.7, direct bilirubin indirect 30.7. So we this as per the report, hyperinsulinemia is a diagnosis, physiological jaundice. Then we go for management, phototherapy for 2 days. Gradually, after 2 days of phototherapy, normal interest additives will be accepting the feed and rating, mother breast milk. After discharge, serum taxane has 50.5 mmBD, drop IWP, 0.5 ml per if you do if drop 0.5 ml per proper vaccination, then we can BCG, vitamin K. Thank you.
Thank you, doctor. Thank you for the presentation. Next, we go to the another paper presentation. I would like to invite Dr. Renuka Baburao Ubale for the paper presentation. I would like to invite Dr. Renuka Baburao Ubale for the paper presentation.
Hello, good evening everyone. Myself Dr. Renka. I am from Pediatric Department. I represent role of Ayurveda in the management of non-specific mesenteric lymphadenitis in children. Uh, Aims and objective. Role of herbomineral formulation in non-specific mesenteric lymphadenopathy in children. Here is the introduction of mesenteric lymphadenopathy. Is an inflammation of mesenteric lymph node commonly seen in children presenting with abdominal pain, and its clinical presentation is often difficult to differentiate from other causes of abdominal pain, particularly in children. Non-specific mesenteric lymphadenopathy is one among the leading cause of abdominal colic in children. Why it is called non-specific? Because no underlying cause is present behind the colic. Rather, some lymph nodes are found inflamed in mesenteric area. Possible symptoms of mesenteric lymphadenopathy include pain in the stomach area, often on the lower right side, but the pain can be more spread out. General tenderness of the stomach area and fever is enlarged mesenteric lymph node depending on what causing the condition. Symptoms also might include diarrhea, nausea, and vomiting. Sonography is widely used in pediatric patients to identify the causes of abdominal pain. It is a fast, non-invasive, and effective method to exclude most causes of abdominal pain that require immediate intervention. In modern medicine, antibiotic might be prescribed for moderate to severe bacterial infection with antipyretic drug, anti-emetic drugs, and antispasmodic drugs. Enlarged mesenteric lymph nodes are also associated with a variety of pathological conditions such as Crohn's disease, appendicitis, gastroenteritis, and scratch disease, AIDS. As per Ayurveda, if the disease having not have a specific name, it can be treated according to its Nidan, etiological factor, Lakshan, that is symptom, and Samprapti, that is the pathogenesis. After proper examination of the patient in various respective factor indicating the strain, that is Rog Pariksha. In Ayurveda, various diseases are explained in the text which are related to abdominal colic as a major complaint. The feature of mesenteric lymphadenopathy may be correlated with the gulma. Patient information: a 6-year-old male child having weighed 16 kg visited to the OPD on 29/10/24, complained with recurrent abdominal pain and occasional mild fever and vomiting. Since 2 to 3 months, the child Prakriti was Vat Pitta predominant and history taking fast food frequently from outside, no family history. Clinical findings include their abdominal pain and feverish body with vomiting episode. Abdominal pain was present mainly on the lower side of the abdomen. On examination, mild tenderness was found in the lower part of the abdomen, that is in the umbilical region. No family history of such a disease were found. Timeline of the case. Ayurvedic drugs such as the Panchangal Karpati, Erandamul Churna, Vidanga Churna have textual indication for gulma along with the Johar Mohra Pishti with Anutan honey. Treatment duration is 7 days. First followed by the 3 weeks. And diagnosis assessment include assessment for work using the pain scale, which is used to evaluate the pain in the children. High resolution sonography for visualization of the lymph node enlargement. Therapeutic intervention include Ayurvedic herbomineral formulation was given with their Vata Pitta specifying Shothar, Vatanuloma, Pachar, आणि Premignefit. Panchamrut Parpati 125 mg half BD for 7 days. Erandamul Churna 125 mg 2 times a day for with the honey for 7 days. Vidanga Churna 125 mg 2 times a day with honey for 7 days. And Mohara Churna 125 mg 2 times a day with honey for 7 days. Follow-up outcome. Relief in clinical symptom was found and no further episode or after discussion.
Discussion include Ayurvedic herbal formulation along with the Pathya gave encouraging result with their Vata Pitta specified show third Vata no Lomak Pachak remain shape. No adverse effect was seen. Relief in clinical symptoms was found and no further episode after. Panchamrut Parpati should be made with contain Parat, Gandak, Loha Bhasma, Tamra Bhasma, Abrak Bhasma. Benefits of Panchamrut Parpati. This medication is mostly used to treat the digestive system problem. This medication is used to treat the disease of Grahani. It is also beneficial in the treatment of anorexia. Indication of Panchamrut Parpati, Grahani, Atisat, Aruchi, Jwara, Chardi, Raktapitta. Vidanga Churna. Vidanga is commonly used to treat the intestinal worms, such as the tapeworms, roundworm. It is believed to have the helminthic properties that helps to expel these parasites from the body. Vidanga is used to improve digestion. Jawar Mohar Churna, Jar Mohar Churna, Jar Mohar is named as a Nagpashan, is most of the classical text of Ayurveda drugs. We support the stomach and intestine function leading to an improved digestion and food absorption. Jawar Mohar Pishti and Basma is also known as the excellent digestive and carminative qualities. Jawar Mohar is composed of magnesium and properties of Jawar Mohar Pishti antidiarrheal, antiemetic, antihypertensive, antibacterial, antimicrobial, antitoxic, antacid, and digestive stimulant appetizer. Erendamur Churna is said to have Guru, Snigdha, Tikshna, and Sukshma Gunas, as well as Madhur Kotu Kashaya Raso, Madhur Vipaka and Ushnavide. It calms down the Kaphavata dosha. It is advised to treat the number of illness including Shul, Shodh, Gulma, Arsha, Jwara, and Vata Kaphavar. Yukti, Yakrut, Nivakuti also. Krimi, Hamvata, the herb Erendamul was negligible anabolic. Conclusion, Ayurvedic drugs such as the Panchamrut Parpati, Erendamul Churna, Vidanga Churna, Jar Moru Churna show curative effect due to their Vata Pitta specifying Vata Namak and Pachan effect. Stroto Shodha, Balya, Primigna effect. No adverse effect was seen. Relief in clinical symptoms was found, and the ultrasonography report had showed improvement in the underlying pathology. Thank you.
Thank you, doctor. Thank you for explaining the concept of such a simple and meaningful manner. Thank you so much. Next, I would like to invite Dr. Abhishek Vijay Kumar Lenjevar for the paper presentation. I would like to invite Dr. Abhishek for the paper presentation.
Hello, myself Dr. Abhishek Vijay Kumar Lanjevar, PG Scholar, Department of Kai Chikitsa, Vidarbha Ayurved Mahavidyalaya, Amravati, Maharashtra. My guide name is Dr. Vaishali Hemant Wankhede, Guide Professor and HOD, Department of Kai Chikitsa, Vidarbha Ayurved Mahavidyalaya, Amravati, Maharashtra. My topic is management of the Sarvanga Vata with special reference to GBS in Ayurveda. Introduction. One of the most prevalent severe acute paralytic neuropathy is Guillain-Barré syndrome (GBS), which is a diverse illness that advances quickly. GBS is often non-relapsing and has a non-physical post-infection course. Clinical manifestations start with the rapidly developing flexic motor paralysis with or without a sensory abnormalities 1 to 2 weeks after immunostimulation. Usually, weakness develops over hours to days as ascending paralysis. Sarvangavata is a clinical disease mentioned in Ayurveda that shares the symptoms with the GPS. Sarvangavata can affect one limb or the entire body and manifest as an intense aching, pricking pains, verbal abnormalities, and motor deficiencies. Case report: a 24 years old male patient came to Kai Chikitsa OPD of Vidarbha Ayurveda Mahavidyalaya. Chief complaints are loss of power of lower limb with a weakness, pricking and tingling sensation, numbness in both soles. No associated complaints like dyspnea, dyspepsia, dysphagia, palpitation. Treatment history: several antibiotics, antipyretic, antacid, fluid therapy, and physiotherapy for 15 days. Clinical examination: general examination, temperature of febrile, pulse 78 per minute, BP 130/90, SpO2 90, temperature. अष्टविध परीक्षण नाडी 78 पर मिनिट, मूत्र सम्यक, शब्द स्पष्ट, दृक प्राकृत, मल सम्यक, जीवा साम, स्पर्श समशीतोष्ण, आकृति कृश. Systemic examination: respiratory system, AB normal, cardiovascular system S1 S2 normal, central nervous system conscious and oriented, gastrointestinal system PA soft and non-tender, no megaly. Muscle power: right limbs, right and left. Is upper limb is upper limb is somehow normal, and lower limb is 2 of 5. Muscle tone, hypotonia. Upper limb and the lower limb reflexes knee, ankle, and Babinski sign. Babinski is no response. Ankle and the knee is areflexia. In investigation, routine studies of a blood and the urine were within a normal limit. CT scan of a brain was normal. MRI LS spine was within a normal limit. EMG NCV showed a subacute demyelinating sensory motor polyneuropathy involving both lower limbs with affected distals and proximal segment. The EMG NCV was done in Government Hospital Amravati, directing the diagnosis towards the GPS. Treatment adopted is Abhyanga with Bala Ashwagandha Taila, Pindasveda with Sashti Shali. Matra Basti was given with 60 ml of Mahanarayan Taila. Shamana Aushadhi is a tablet. Rasa Rajeshwar Rasa with 125 mg BID with a Kushta Jala. Samir Pannaga, Ekanga Veera, Vishatundika Vati, Monserika Shah, and Gudisi Sattva, all are given as a Shaman Aushadhi, and physiotherapy done. Result is after giving a treatment, muscle power, upper limb and lower limb both are getting normal muscle power, both right and left side 5:5. Muscle tone, normotonic in upper and lower limb, and reflexes is knee and ankle is 1+, and Babinski sign is diminished. Taking into account the role of the Shakagata Vata tablet, Rasa Rajeshwar Rasa 125 mg combined with the Samir Pannaga Rasa and Gudiji Sattva. This blend is effective and in eliminating the blockage and soothing the Vata dosha. Tablet Vishatundakavati, this formulation features the Puchila as a primary ingredient recognized for its nadi balyakara nerve tonic properties. Monshadi Kasha, it aims to improve the nerve conduction and reduce the tingling sensation. Abhyanga, it boosts and reduce the vata dosha and illness is attribute to a reduction its chalaguna, leading to the inability to transmit nerve impulse. Abhyanga support the regeneration of a nerve myelin and unblocking the nerve conduction, allowing nerve impulses to move through. Pindasvedi is it means for a balya, brihana and enhancing dhatus through the balancing both the things. Concentrating on the Pakwashaya as the primary source for Vatvedi, we provided Matra Pasti along with these therapies, physiotherapy interventions were used. The element kind of GBS is one in which there is a significant loss of muscle power following the therapy. The lower limbs on the right and the left side of the body achieved a great 5 muscle power. In addition to various other signs and symptoms, the patient weight get significantly improved after treatment. From the second to the fifth week, the patient weight increased from 44 to 64 kg. He was able to do his work independently and he had a total difficulty getting up until walking without assistance. Discussion. The Ayurvedic analysis of GBS concluded that while it may not align perfectly with the specific Ayurvedic terminology, based on the present symptom, it can be categorized as a Sarvangavata. GBS is a serious acute paralytic neuropathy that progresses quickly. Typically, followed infection can be associated with the Vatvedi in Ayurveda. In this case, the element type of GBS link apatarpana janya vyadi. Therefore, the Vatahar Chikitsa, Santaparna Chikitsa admission for 7 weeks. Here, Vata Prakop is linked with the Dhatukshaya. So, for Dhatukshaya treatment, we are given.
Thank you, doctor. Thank you for the summarized presentation. Next, we go to the another paper presentation. I would like to invite Dr. Sneha Khandari for the paper presentation. I would like to invite Dr. Sneha Khandari for the paper presentation.
Hello everyone, my topic is Effect of Diet on Prakriti, a literary review. Diet plays a pivotal role in maintaining health and balancing the Prakriti, individual constitution as described in Ayurveda. Prakriti, formed at conception and influenced by the predominance of doshas, Vata, Pitta and Kapha, determines an individual's physical, physiological and psychological tendencies. The concept of Ahar, diet, as one of the Trayopastambha, three pillars of life, emphasizes that appropriate food intake sustains the equilibrium of doshas and thereby supports the health. Vata, all creatures and indeed the body itself are dependent on food, hence food is supreme. Incompatibility between diet and prakriti leads to dosha prakop, aggravation of doshas and manifest as various disorders. Ayurveda emphasizes ahara diet as one of the three pillars of life. Prakriti, that is innate constitution, Vata, Pitta and Kapha. Diet influences health, disease prevention and Prakriti expression. Body is formed and sustained by diet. These are the types of Prakriti. Prakriti is divided into Sharir Prakriti and Manas Prakriti. Sharir Prakriti is further divided into Ekadoshas, Dvidoshas and Tridoshas. Manas Prakriti is divided into Sattvic, Rajasic and Tamasic Prakriti. Formation of Prakriti. Prakriti is formed by Shukrashonit, Matuj Ahar Vihar, Mahabhut Vikara, Kala Garbhasaya. Let us understand Prakriti. Vata Prakriti is light, dry and irregular. Pitta Prakriti is hot, sharp and intense. Kapha Prakriti is heavy, slow and stable. The body is governed by Vata, Pitta and Kapha. Balanced diet maintains Prakriti and wrong diet causes imbalance. Role of diet in Prakriti maintenance. Vata Prakriti needs warm, uncooked food like milk, ghee and soups. Avoid dry, raw and cold food. Pitta Prakriti needs soothing fruits like cucumber and sweet fruits. They should avoid spicy, sour and alcohol. Kapha Prakriti needs light, dry food like barley, millets and pulses. They should avoid heavy, oily and sweet food. The wholesome and unwholesome effect of diet determine health and disease. Effect of wrong diet on Prakriti. Vata imbalance causes anxiety, dryness and constipation. Pitta imbalance causes acidity, ulcer and anger. Kapha imbalance causes obesity, lethargy and diabetes. Viruddham cha apte aharam, that is, incompatible food leads to imbalance and disease. These are the food items that we should have in a Vata pacifying diet. These are the food items that we should have in a Vata pacifying diet. Pitta pacifying diet foods items are as follows. These are the food items that helps in pacifying the kapha. Modern perspective. Diet and Prakriti links with genotype and phenotype expression. Nutrigenomics. Diet modifies gene expression. Prakriti specific diet improves immunity and mental health. So, the conclusion is diet maintains Prakriti balance. By following proper diet, one attains long and healthy life. Diet interacts with an individual's Prakriti constitution to either balance or aggravate the doshas that are Vata, Pitta and Kapha. When foods are well matched to one's Prakriti, digestion tends to be smoother, energy steadier and susceptibility to imbalance reduced. Conversely, consistently consuming incompatible foods can aggravate dominant doshas, leading to digestive issues, fatigue or irritability. Practically, adopting Prakriti-guided dietary patterns, favoring fresh, seasonal, properly spiced foods and avoiding generic one size fits all diets helps support homeostasis. So, the conclusion is diet maintains Prakriti balance. These are the references. Thank you. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Prerna Suresh Bhagavat for the paper presentation. I would like to invite Dr. Prerna for the paper presentation.
Morning everyone. Myself Dr. Prerna Bhagwat. I am from PMT Medical College and Hospital Shevgaon. My department is Rachna Shari and my topic of presentation is an observational study of anatomical changes in fufusa with special reference to Pranvas Strothas Dushti Lakshans in bronchitis. Introduction. Now in globalization of word, this concept should be clear on a modern basis. Srotas is one of the major anatomical concepts of Ayurveda. Acharya Charak has explained Srotas as medical view, while Acharya Sushruta has explained Srotas according to surgical aspect. The Srota Mool can be compared with the root and roots of tree. Any injury to the roots leads to destruction of the tree. Similarly, injury to the scrotum can affect the whole scrotus. So moolas can be physiological and anatomical controlling center of the scrotus. Hence, Pranvas scrotos, drushti, lakshanas, and vidya lakshanas are directly affected to lungs, heart, pulmonary arteries, etc. Synonyms of Shrotasi. Shrotanani, Sira, Dhamnani, Rasavahini, Nadi, Pranta, Marga, Sharira Chitrani, Samriddha, Sthana, Ashay, Nikita, Vidyalaksham, Tatra Vidyasya, Kroshanam, Vinamam, Mohanam, Brahmanam, Vepanani, Maranava, Bhavati. Drushti Lakshana. दृष्टि लक्षण अतिसृष्टम अतिबद्धम कुपितम अल्पा अल्पम सशब्दम सशूलम दृष्टानि प्राणश्च स्रोतसा प्रदुष्टन विद्याति. Need of study. Previous studies done on Pranvas strotas and specific disease condition, but there is no study done which can show us exact relation of Pranvas Strotodrushti Lakshanas and bronchitis. Bronchitis is most commonly occurring respiratory infection. It is affected bronchial tree and causing some signs and symptoms which can explained by our acharyas as drushti lakshanas. As many studies done on strotasas and respiratory diseases, but no study done which can show us correlation between them. So need of time to highlight the concept that was already explained by our great acharyas. A. To observe the structural changes in fufusa with special reference to Pranvas Drushti Lakshanas in bronchitis. Primary objective to study the concept of anatomical changes occurring in fufusa with special reference to Pranvas Drushti Lakshana in case of bronchitis patient. Secondary objective to study the Pranvas Drushti Lakshanas and with the Lakshan to correlate the Pranvas Drushti Lakshans and acute bronchitis to study modern anatomy in detail. Review of literature. Review of Ayurvedic literature. To related literature from Shushruta Samhita, Charak Samhita, Ashtang Sangraha, Ashtang Hrudaya, Sarangadhar Samhita will be studied. Review of modern literature. Modern textbook, research paper, journals, literature from internet related to respiratory system will be studied in detail. Inclusive criteria मध्ये history of shortness of breath, common cold, cough, with or without sputum, etc. Randomized selection of patient, irrespective of gender, age group 20 to 80 years, patient will to participate. Exclusive मध्ये patient having post-operative rehabilitation process, state, new term, psychiatric patient, patient having C of lungs, lungs collapse, etc. Patient having any major systemic disorder. Withdrawal criteria मध्ये any patient who is not willing to participate in a study or not willing to give informed consent, any patient of acute bronchitis who deteriorate during study will be withdraw. Assessment parameter checks X-ray, pulse, oximeter, lung sound such as scrapes, bronchi, wheezing, etc., fever, recurrent cough, hemoptysis. Data will be collected from questionnaires and CRF. Plan of work, selection of cases will be done according to inclusive and exclusive criteria. Informed consent, informed written consent will be taken. Case will be observed from sign and symptoms. Data will be collected with the help of CRF and questionnaire assistant criteria will be applied. Statistical analysis will be done, result discussion and conclusion. Discussion will be done on the data collected during the study with the help of related literature. Conclusion. The study will be summarized and accompanied by the relevant listing of the listing of the cases. Hence, conclusion will be drawn on the basis of data collected during study. Study type, observation, study setting, study center. Study duration 18 months. Study population bronchitis patient coming in Kajikistan, Panchakarma, OPD and camps, etc. Sample size 73. Sample technique, sample is randomized. Thank you.
Thank you, doctor. Thank you for the consistent presentation. Thank you so much. Next, we go to the final presentation. I would like to invite Dr. Pooja Kailas Singh for the paper presentation. I would like to invite Dr. Pooja Kailas for the paper presentation.
Good morning, sir and ma'am. Myself, Dr. Pooja Kailastingi, PG first year, Rashna Sharif. Today, I present the relation between Shushutokta Praman Sharif with special reference to modern anthropometry, BMI. The introduction is Acharya Shushut representing the Dhanvantari school of surgeon and known as father of surgery. He was the first anatomist who has done the discussion on surgery. Acharya Shushut told that the surgery is the main important part of the anatomy. Anthropometry is the measurement of the human body which provides scientific method and technique for taking various measurement and observation. The word anthrop means human and metry means measurement. It is science that defines physical measure of person size, form and function capacity. It is systematic collection and correlation of measurement of the study. Main point is Sharir Praman. Sharir Praman is the only tool for determining the IU of the individual. The concept of Praman is also one among them which should be evaluated scientifically to bring out the hidden logical knowledge of Ayurveda. Praman is divided into two parts, Anguli and Anjali. Today, the study is about Anguli Praman. The word Anguli derived from the root word Anga with the uli suffix which measures digit subdivision of Hasta and Pada of the Anguli. According to Acharya Shushu, total number of Anguli is in the body is 20. Anguli Praman. To measure the height, arms, palms, circumference of body organ by individuals, all Anguli is known as Anguli Praman. As all Anguli is the key of measurement. Reference regarding Anguli Praman can be visualized in the every ancient sculpture piece. And the modern term is body mass index, which is calculated by using anthropometric height and weight. And the formula is weight in kg divided by height in meter square. The rationale of study and need of study is Praman Sharif has a wide scope in various fields of Trabekum, surgical and parasurgical instrument manufacturing, Roga Pariksha, sport anatomy, Shastra, etc. The mean of measurement used by all Acharya was different for volume and length as Anjali and Anguli Praman, with the help of individual own finger, hence termed as Swanguli Praman. These measurements are used in the form of ratio indices to modern anthropometry. The main part is aim and objective. Aim is to study the relation between Shushruta Praman Sharif with special reference to modern anthropometry, that is body mass index. Objective is to study the measurement of Shushruta Praman Sharif with special reference to anthropometry. Secondary objective is to review Shushruta Sharif Praman in detail to explore the modern term that is anthropometry in Ayurvedic and modern assay. To explore the scientific significance of Praman Sharif for clinical practice. To examine the relevance between IAM and Vistar index of health of the person. The main part is a methodology, in which the inclusion criteria is the healthy individual between 20 to 50 years, irrespective of gender, socio-economic status, religion, habits, profession, lifestyle. The exclusion criteria is the volunteers which have a history of congenital anomalies, disease like hypothyroidism, and the person suffering from the surgeries like amputation, loss in body part in road traffic accident, and the ladies who is pregnant and lactating are in exclusive criteria. As the IR is the height of person from the head to toe, Vistar is weight measuring from tip of middle finger of the right hand to the tip of middle finger of left hand of the same person. As the BMI is calculated as weight in kg divided by square of height in meter. So material is used for the measurement is Swanguli Praman will be measured by vernier calipers, IAM is measured by measuring tape, and Vistar is also measuring by measuring tape. As vernier calipers, measuring tape, weighing machine are the material which is used to study. As the above mentioned, we calculate the BMI of the patient, observe the patient, and it is concluded that after we calculate the BMI of the patient, as the one angul is 5 centimeter, as a modern term, It shows that the exact relation between the Praman Sharif told by the Shushrut is exactly the same. This is what I present. The Shushrut Praman Sharif is special referred to modern anthropometry.
Thank you, Doctor. Thank you for the insightful presentation. And thank you all. We have now reached the conclusion of the Adveshta National Seminar presentations. It has been a truly enriching and inspiring journey filled with insightful discussions, well prepared papers, and thought provoking poster presentations. At the outset, I would like to extend my heartfelt gratitude to each one of you who stood by this event and contributed to making it a meaningful success. Your presence and active participation have added immense value to the seminar. A very special word of thanks goes to our panel members for their dedication, valuable inputs, and constant encouragement. Your guidance has elevated the quality of the sessions and has been instrumental in shaping this seminar into a memorable academic platform. I also take this opportunity to sincerely appreciate the relentless effort to all those who work tirelessly behind the scenes, organizers, coordinators, volunteers, technical teams, and every individual who has been part of this endeavor. It's our commitment, day and night, that has made this program possible. To our presenters, both in paper and poster sessions, we extend our deep appreciation. The depth of research, clarity of thought, and the passion with which you shared your knowledge truly enriched this academic gathering. Each presentation brought forth new perspective, and together they have broadened our understanding and reaffirmed the significance of Ayurveda in addressing present and future health challenges. Most importantly, the seminar was not just about sharing information, but about building a collective vision to strengthen Ayurvedic wisdom, integrate it with modern perspective, and ensure that its principles continue to guide health and well-being in contemporary times. As we close, let us carry forward the insights, the collaborations, and the spirit of learning that we have shared here. May the seminar serve as a stepping stone for more meaningful contributions, deeper research, and stronger professional bonds in the days ahead. On behalf of the organizing team, I thank you all once again for your invaluable participation and support. Thank you all once again. Thank you so much. And